that. We do have a question from Senator Reichman.
Thank you, Mr. Chair. And I just want to thank you for coming. And I just wanted to make sure I got my head around this as best I can. We're talking about casing their fund, and it says the funding amount of 7%, $200,000, they lose to changes in criteria. So are we talking about if they make these changes in criteria, these other, I did not get those other emails. There's a possibility if they make those changes or whatever, they will not lose the funding of the $200,000?
Mr. Chairman, Senator Reichman, to answer your question, Casa actually testified, I believe, on day 2 of the last two-day committee meeting, which was October 6th. And during that testimony, they explained that they would lose funding, which was the 7% that was referenced here. And I believe it was Representative Owsley that brought up the preliminary recommendation to return the funding to them, that the committee recommend to return that funding to them. The way they explained the loss of funding was that the criteria would be changed and it would disqualify Casa from receiving that funding. I hope that answers your question.
Yes, thank you. Thank you, Mr. Chair.
Militia, thank you very much. I do not see any further questions for you. So
thank you, Mr. Chairman.
We will now move to our next item on the agenda, where we will have a review of foster care funding, and Sharday Kane, fiscal analysis with KLRD. Sharday?
Mr. Chair, thank you for providing me the opportunity to inform the committee on foster care funding. My name is Sharday Kane, and I am a fiscal analyst for KLRD. DCF is one of the budgets I am responsible for analyzing. You should have a blue document in front of you. If you flip to the back on page 4, you will see a chart that outlines foster care funding by funding source for state fiscal years 2019 through 2021. And the rest of the document outlines and goes into detail on each of these funding sources, but the money is here for you to see it. So the first one is State General Fund, the state of Kansas money that comes from income taxes, sales taxes, severance, and other excise taxes and interest earnings. I will note that since the beginning of the pandemic, the U.S. is in a public health emergency as determined by the Secretary of Health and Human Services. The Secretary can only extend it for 90 days at a time, so currently it is extended through January 13th, 2022. One component of the public health emergency is a decreased amount of money required to be matched for the Federal Medical Assistance Program, or FMAP. For foster care specifically, this leads to an SGF savings of about $200,000 per quarter, and additionally, that's $600,000 per quarter saved in the adoption support budget. The Social Welfare Fee Fund receives funds from several sources, including reconciled Title IV-E funding. It's generally used for child support services, but it can be used for other purposes. Right now, it does have money from the St. Francis settlement in the fee fund. The Supplemental Security Income Social Security Administration Foster Care Maintenance Recovery is specifically used for SSA benefits for children receiving benefits received by children in foster care. And I would note that for this one, for state fiscal year 2020, that should be $4.8 million, not $1.8 million. For Title IV-B, that includes the visitation grant and the safe and stable families. That is federal funds designated for children and family services as a part of the Social Security Act. The social services block grant is designated for social services, and it's a bit more flexible. It allows states and territories to determine how these funds are best used to meet its statutory goals. Title 4E, which includes foster care, adoption, and Chafee independent living funds, is a major source of funding for foster care and the related services, and that's federal funds again. And lastly, TANF is the largest source of federal funding for DCF and is used to fund a variety of programs, including foster care caseloads and family preservation. It's based on their 4 allowable purposes, which are providing assistance to needy families so children may be cared for in their own homes or in the homes of relatives, ending the dependence of needy parents on government benefits by promoting job preparation, work, and marriage, preventing and reducing the incidence of out-of-wedlock pregnancies, and establishing annual numerical goals for preventing and reducing the incidence of these pregnancies, and encouraging the formation and maintenance of 2-parent families. And that would wrap up the chart and the funding sources that are in the chart, and I'd be happy to stand for questions.
Sade, thank you for your explanation on that and your explainer. We do have a question from Senator Reichman.
Thank you, Mr. Chair, and thank you for testifying. I'd like to flip back to that chart and just kind of trying to understand for sure. And the first one, the state general fund, that's money that's coming from Kansas taxpayers. Then the list below is the federal funding sources, and it has maybe 8 there or whatever. So that's all from the federal government.
Yes.
Okay, and so when we look at the last, where the state said for 221 is we have 171 so on million, and the total was 245 million. And so I know I'm a calculator right in front of me, but we're paying more than half anyway. That's probably what 60, 70% on that. Is there any problem that we want? Will we still will be receiving these funds from the federal government? Is there any chances of losing any of these or anything like that? Do you know?
To my understanding, no, that would not happen. And I will say that the funding for foster care caseloads is approximately 31.9% of DCF's state fiscal year 2021 operating expenditures. And I would have to find out more information on that for you if you'd like. But to my understanding, no, that money wouldn't go away. It's been in place for a while now.
Okay, thank you, Mr. Chair.
Senator Foscato.
Thank you, Mr. Chairman. Sade, of that funding that comes from the federal level to the state, what percentage of that goes towards foster care as it relates to contractors? So does each contractor get a certain amount of funding? And if so, well, I know they do, but what would be that dollar amount that goes, and is it the same amount that goes directly to each contractor? Thank you.
Mr. Chairman, I do not have that information with me. I can provide that for you, but I will note that the number that each contractor gets depends on how many children they have in their specific area and what their acuity level is at that time.
And yeah, and I'd appreciate that other information. Thank you.
Representative Humphreys.
Thank you, Mr. Chairman. A quick question. There was one thing that you said that we needed to make an adjustment on that you said. Could you repeat that, please?
For SSA, SSI recoupment, state fiscal year 2020 should be $4,776,000.
Okay, and then will you, I'm sorry that I didn't catch this, the social welfare fund that was $1 million this year and 2.4 last time, what is that?
So that would be money that they reconciled from the federal government, or if it's in foster care caseloads and they don't spend it, then it might go to that fund to use for the next year. Right now, the state Francis settlement money went into the social welfare fee fund. So that money is what's in there for foster care specifically, as an example.
Okay, and so, the difference between fiscal year 2020 and 21 was that?
No, I'm not sure what the difference is. I can find that out for you.
Okay.
But that money that's not the same, Francis. That would be for 2022 as money spent. So it's not been, some of it has been expended, but not in this.
Most of the St. Francis settlement has yet to be expended?
Correct. It hasn't.
Okay. I'd be interested in a little more detail about that, if you don't mind.
Yep.
Thank you so much. Thanks. Thank you, Mr. Chairman.
Senator Gossage.
Thank you, Mr. Chair. And forgive me, we were doing some musical chairs over here, so I may have missed, somebody may have asked my question. The question was asked by Senator Vascato about, or I think it was Senator Vascato, about the funds being the same or staying the same. And I was noticing, or no, I'm sorry, that was Senator Reichman. On some of these, there was a drastic difference. For example, the SSA recoupment, which is about $5.5 million. And then it dropped down to 1.7 and then back up to 5.5. Do we know the reason for that?
That's the one that I was saying needs to be changed to 4.7.
4.7.
4.8.
So I did miss that. Okay, thank you. And then the other question is, same thing about the social welfare fund was 2.4 and now it's 1 million. Why has it been cut more than half?
Yes, that one, Representative Humphreys asked for, and I will provide that to the committee as well.
Okay. So my apologies. Thank you.
All right. I do not see any further questions for you, Sharday. And for those of you in the audience and watching online, we did play a little bit of musical chairs. We have a lot of vacant space, and apparently I put a little more deodorant on my left than I did my right because nobody wants to sit next to me. So I wanted to bring all the committee members up around here, and for two reasons. One, give more space out there, and probably the more important for me is it's easier for me to remember that they are legislators on this committee and not members of waiting to testify, and I don't miss their questions. So I apologize for that confusion while that was going on. Next committee, we are going to move on to an overview of the legislative post-audit on our child welfare system. And here to give that is Justin Stowe, Post-Auditor, the Legislative Division of Post-Audit. And Justin, do I understand correctly, you are not going to be with us very long?
Yes, sir, that is correct. I'm leaving you in late December in the very capable hands of Chris Clark, hopefully my deputy, but my former boss, Scott Frank, who was a post-auditor here for about 8 years before me, went out to Washington State Auditor's Office. They're much larger. They have about 450 people in their audit office, if you can imagine. So he recruited me. I've talked at various times to folks in Washington and turned them down, but my wife told me this time I was going, so I am. That's how it works out. So,
Well, Justin, if you would just do us a favor, we're going to miss you when you're in Washington. Forget the phone numbers here.
yes,
If you would, please. Thank you.
certainly, Senator. All right. So for those of you that don't know me, I am Justin Stowe, your legislative auditor currently for the next couple of months. I'm going to be presenting today over a brief memo that we have brought to you in advance. We also sent this out electronically to you. The electronic version has links to these audit reports, so if you click on it, it can take you to those sources. If you see an audit report that you want a hard copy of, just please let me know. Our office would be happy to provide you one, but in the interest of saving trees, we've not printed those out. You'll notice that the memo I'm covering today is built on this body of work here. So these are all of the audits that I'll be covering today. So there's a reason I did not print them out, put them in your packets. I will also note, because of the volume of information I'm going to be covering, I may or may not be able to answer any questions you have. If I can't answer a question, I'll write it down and I will get back to the committee. There's a lot here. I've read through these reports, but I did not work or manage all of them. So I think I can answer most of your questions, but maybe not all. So just so I set the proper expectations, I'm always happy to follow up with you. So what I'm going to do is kind of summarize the highlights of the last decade of our audit work in the child welfare system. So if you see at the top of that page of our memo on page 1, I've identified some of the key trends and kind of reoccurring themes that we've seen in the last 10 years on the variety of our audits. And recall, the audits that we do are directed by the Kansas Legislature. So they're brought to us by interested and concerned legislators and legislative committees. So we don't have any systemic plan or any type of way that we're approaching this necessarily as an office. We don't have some risk approach. We're trying to hit certain elements of the foster care or child welfare system. It is simply based on legislators' interests and concerns that they've heard from their constituents and out in the community. So one of the recurring themes that we often see is that DCF, going all the way back to actually when it was SRS, has somewhat taken a hands-off approach to the oversight of its contractors. So we would often find that they have good policies and procedures to kind of monitor and guide their contractors, but when it came to poor performance or enforcing some of those things, kind of peppered throughout our reports, you see this kind of consistent theme that DCF doesn't take a very heavy-handed approach in making sure that they are necessarily meeting those expectations or really even doing. I mean, they kind of leave it to them. It's kind of that notion we've given them the responsibility of taking care of that, which is understandable to an extent, but can create problems, and we highlight some of those in some of our audits. Kind of in recent years, I'm going to say recent, like this is 2016, 2017, 2018, right? So some of these things may have been addressed by DCF, and I'd caveat that for you all as well. I'm looking back at 10 years, so some of these things, have a long history and may have been resolved at this point. But around 2017, one of our audits found that they didn't have sufficient background checks for the individuals, the foster care homes that they were going into. And so that was a little bit more common, you can imagine, when it was a relative placement because of the nature of that. We found that they did often have initial background checks, but not the reoccurring annual checks. And of course, that makes sure that if someone's been engaged in criminal history since the child came to the home, that child is still safe. So we found some concerns and issues there. We also found that they didn't necessarily take steps to make sure that the in-person home visits were occurring for those children in foster care, right? That's an important touch point. Send workers into the home, make sure everything's going all right. There was occasions where that didn't happen. And sometimes, I might note, this might be like 20% of the times this wasn't happening, right? We felt like that's significant, given the vulnerability of this population, that even 20% of the cases in foster care is maybe more relevant than it might be in other areas like financial audits. Moreover, there's lots of cases throughout our reports where we simply couldn't tell whether things were happening because the documentation was insufficient or incomplete. And as auditors, because we live in this very narrow world, if we can't see it, if we can't prove it, it didn't happen, right? So we do make a distinction between those two things. There are certain cases where we say we absolutely know it didn't happen. There's many cases in the foster care system we just simply didn't have enough information to determine whether it had. And so we flagged that as concerning to us, because if we can't prove that it happened, there's at least the possibility that it didn't. And that sometimes gets us into the 60 or 70 or 80% categories when it comes to some of these child place home visits. We do see, and especially in recent audits, and I'll actually read you some quotes when I get to this audit, there's some concerns with staff turnover, morale, training, some of these things, caseworkers, you can imagine, you might have heard, there's a lot of concerns about caseloads and being over those. Again, maybe a couple of years ago, I'm not sure if those issues have been resolved or not, but we heard that frequently. We also heard that case management contractors had a hard time employing enough case management staff, and that, again, some of their staff had really high caseloads. Kind of finally, and this is always maybe of more interest to us as the auditors than it is to the typical person, but we found that there were a lot of data issues that inhibited DCF's ability to either manage the foster care system as thoroughly or as robustly as we would like, or also just simply prevented us from answering audit objectives that we've been given to the fullest extent of our interest, right? So we'll kind of talk about that. There's some concerns that they don't always keep track of, like the locations, for example, of where the children had been located or which home they had left, or if they did have those records that they were in paper copies, or that those systems that they did have all the information, but they were kept across disparate systems, so the ability to analyze it was limited. So that's the high level summary. That's 10 years worth, keep in mind, over a long period of time. So again, some of these things may address, but there's a lot of issues there. I'm going to now just walk you through the individual audits and kind of highlight the findings. Those themes tie kind of throughout, but I'll kind of walk you through quickly the actual listed audits. So the very first one, this is going back quite a ways. It's 2011, so this is literally a decade-old audit. I'm not going to spend tons of time here. The concern on that audit was that at one point, there was a tier, there's like a flat fee for the children in the foster care. So contractors just got a flat fee. And at one point they decided that could create an incentive for them to keep them in the system. So we're going to pay them on this graduated tier rate so that the longer they're in, the less you get paid, right? So kind of a more of a financial incentive to get kids out of the foster care system. At the time of this audit, they'd gone back to the flat fee, so they kind of gone back and forth, and they wanted to know, legislators wanted to know, did that have any effect on the length of children stay in foster care? The short answer is no, it did not. So the concern there was, let's look into that. It didn't appear to us, based on our analysis, that changing those things had any effect on children's stay, which is good. This is also the first time, however, that we noticed, because we were also asked to look at DCF, then SRS's oversight of its contractors, and that's kind of the first time in this theme that we see DCF had some good policies and procedures, but weren't necessarily enforcing them. So we called that out kind of for the first time, like, hey, it looks like they have a pretty hands-off approach to how they manage the contractors. Moving forward to 2012, we have a audit. This one I actually did manage, so I know this one pretty well. It was back in 2012, looking at decisions to remove children from their homes. So the concerns legislators had been given was they heard from families saying, DCF is taking my children. I don't think it was justified. I don't think it was right. There was coercion. There's all these concerns, right? So we went in and we looked at 9 families, 23 children specifically, and we spent a ton of time. We read thousands of documents, interviews. We watched the court case files in some cases. We got to listen to the police interview the children and look at the files. This is pretty hardcore stuff, I'm going to be honest with you. I mean, we're auditors, so we deal with stuff, but this maybe isn't something we get into a lot. We are not caseworkers, and I will tell you I am very respectful of that job because it's pretty hard stuff and for everyone involved, the kids, the families, everything else. Kind of ironically, what we found, at least in these 9 cases, so these 9 families, remember, that's a very small percentage of the foster care system, and we picked these because they were the ones that had the most concern surrounding them. So they were the most controversial, complicated, probably intense case. I mean, they were on that end of the spectrum. In these cases we felt like the courts, because of course, remember, the courts actually make this ultimate decision, not DCF. We felt that the courts and the case management decisions were generally reasonable. That created a lot of concern for legislators because they've been getting tons of information. So we looked into why would that be? How could it be that you hear all these things, these complaints and concerns, and then we found that actually the courts seemed to be justifiable. Like, we looked at all the evidence, like, yes, we think in those cases it was right to remove they were being harmed physically or emotionally or sexually, right? So there was these real legitimate things, and we read the case plans for the parents, and like, they're not doing what they're supposed to. So in that audit, we highlight some of those reasons, right? These cases are complicated. The parents don't always know what's going on because they are not being told specifically. So if there's a concern that a child is being abused, the police take them off and talk to them. They're not necessarily going to share what they're talking to the kid about with a parent because they're afraid of coercion, that the kid's going to be nudged by the parent to be quiet, right? So there's also, they're not fully apprised of what's being said and what's being done, and sometimes that is for the child's protection. There's also a host of things that parents can be doing that hinder their ability to get back in communication with their children. So maybe not doing their case plans, not going to the counseling, continuing to, to have drug use, some of those type of scenarios. So that is not an overall defense of foster care. I'm not saying that there are not cases that are legitimate where kids have been taken from their parents and they shouldn't have. I'm just saying in this, we looked at these 9 hardcore cases and we found that they seem pretty reasonable to us, right? When we looked at the preponderance of evidence behind it. We did recognize there was a bunch of other things that we couldn't necessarily look into, like the suggestion in one case that a lawyer had coerced a mother to give up her children. We weren't there, maybe, right? So we can't say. We said, well, we weren't there. We don't know what happened. That's an allegation we just can't check on. So we hear that sometimes too, things that are concerning, but there's no way for us to actually give you any assurance that it did or didn't happen. Okay. In 2016, we actually started off a series, a very deep and big audit of the foster care system. So it asked us to actually look into 6 objectives. We split that into 3 parts. And so the first part of this asked us to look at the safety of children during the removal and placement process, whether foster care homes had sufficient living space and financial resources for the children that they were taking in. and whether the foster care process had been designed with a family preference in mind. So this is just the idea that if you're putting children in foster, try to keep the family together, keep them with relatives, keep them with siblings, that type of thing. So you'll see, actually, in this one, this is a big report. These 3 reports actually have a lot of content. So if you're, interested in detail, part 1, part 2, and part 3 total up to a lot of information. You'll see it, we've broken up. I had to break up the findings here because there was so much. So the first one starts with safety. You see that we identified some concerns with report call centers not being, or concerns about children not being responded to in a timely fashion. That can be a little bit concerning because, of course, that's calls, I think, that this child was being hurt or neglected, right? And so they didn't always have a timely response. Pretty good, but not perfect. Again, we find that background checks is where we first identified that the background checks were not being done as completely or thoroughly or consistently as we would like to have seen. And the same for those in-person visits happening in the foster care system, and especially in the aftercare portion. So that's once the child has been placed. There's supposed to be about a year following that where they provide additional services, and those in-home visits are supposed to be a component of that. And in that case, they really fell off. So which maybe is understandable because the child's now supposedly in a safe environment, but there was still that idea that wasn't being done. There's also where we heard some concerns about turnover, morale, and training, and this speaks a little bit to that case management, the workload issue. I'll read you some quotes. I always find these to be kind of helpful to me when I actually hear from real staff, kind of in their words, some of their concerns at the time. So, for example, when we have this in that report, I continually have to tell new workers what to do and how to do it. I no longer have coworkers that I can turn to for advice and guidance, but rather have become that person. It's incredibly frustrating. And then also the caseloads are high and we are shorthanded. Everyone is trying to stay afloat, but that's hard when we are told we need to do better on hitting deadlines constantly. It feels like we are failing no matter how hard we try. Due to high caseloads and the high levels of need, burnout is high. So we heard some comments like that were concerned to us. We want to highlight that in the report, that there was some concerns about their ability to actually handle the cases that they already had. Then moving on to sufficient living space, we found that some children in foster care had inadequate sleeping space, and we found that actually the root cause of that was because DCF was granting 98% of every exception that was asked for. So that'd be a case where a foster care parent says, well, I don't have sufficient space, but I'd like to go ahead and put the kids in our home anyway, and DCF pretty much granted everything that was requested. So that sometimes did end up with maybe 2 or 3 children sharing, the same room, 4 children in a room, that type of thing, which there's some standards in terms of space requirements, and we found on occasion that was not being met. We did find, in terms of family preference, that the system did seem to be designed well to ensure that siblings and family members are kept together. So that actually that concern did not appear to be well-founded in terms of what we saw in terms of the process. A lot of sense that, yes, we do that. In fact, to some degree, there was even some concerns that maybe that was being done too much. And so in that case, the example that sticks in my mind very vividly is this idea that we take an 8-year-old out of their stable home environment and move them in with their toddler brother or sister who they don't know to keep the family together, but we've taken them out of maybe a different arrangement to be more stable. So you sometimes hear concerns on that other end. I thought that was kind of interesting. You don't hear that as often. Okay, so part 2 then. So that's kind of the high level of part 3. Part 2, I'm not going to spend hardly any time. Mostly this was just compliance with state laws, and it kind of recaps what was already in part 1, because obviously a failure in some of those areas like background checks or some of those other areas can result in a violation of state law or federal law. So there was some redundant, some overlap there. We also get into some financial audit stuff and some federal requirements. And so there's a compliance piece. We weren't in the compliance with as many federal requirements as we needed to be at the time, and so DCF had to put together an improvement plan. That was, back in 2016, so it's been many years. I don't know what the outcome of that was, but that was at the time, and I'm sure we could follow up on that. We have that information, I would think, in our audit files. Then in part 3, we were asked to look at the foster care system capacity, outcomes, and costs. I'm going to focus most of my attention here on capacity. We found that, of course, they had a hard time employing enough case management staff in general, and that did lead to some case managers having very high caseloads. So what we found, kind of interestingly enough, is on average, the caseloads were below kind of the expected threshold, so they were fine. But when you looked at the maximum caseloads in any given month, sometimes that would far exceed the actual suggested limit. And that was especially true in the eastern part of the state, so the Kansas City area in particularly. They had way, way higher caseloads on average per manager than other places in the state. We also found that family support workers didn't always have the required experience that we would have expected. We found that most children received the physical and mental health services they needed, but not all of them. So that can be kind of a difficult proposition if they've got really unique needs. It can be sometimes hard to find those in their area. We also found that many cities and counties did not have enough licensed foster care homes in the state, and that was kind of a function of two things. One, we had enough on average, but again, if you average it out at statewide, we look fine. When you look at individual counties, it turns out there are several counties that did not, and they're just kind of interspersed, simply did not have enough capacity. It was also kind of a problem because the way this was being tracked at the time is we were flagging the homes at full capacity, and we know that's not true. So it was actually an overstatement of what they might have had. On outcomes, we just compared their outcomes over time. Federal outcomes, we noticed there was not much change there, so how we performed previously is kind of how we performed. And again, we noted that those measures were self-reported and unaudited, so we kind of said take that with a grain of salt. I mean, here's what they're reporting, but we can't really verify it. And then at the time, we'd been asked to look at the cost of privatization versus, which is our current system, versus bringing that in-home. We found, or in-house, and we found that bringing it in-house would cost at least probably $5 or $6 million more a year annually, just based on certain circumstances we evaluated, plus some additional one-time startup costs. So I don't think at the time there was much of an interest in moving that direction. We did note that only we in Florida appear to have a fully privatized foster care system, or at least the time at this audit, so we're a little unique in that way. Couple other, these are very, very small lots, so I'm going to hit them quickly. We were asked to look at whether members of the LGBT community were receiving disparate treatment as foster and adoptive parents. This was just simply a survey of guardian ad litems, and 88 said that they were not aware of that having any effect on those individuals, like how they were treated in the foster care system. 52 reported that they did know of such an instance, and so that was as deep as we went. This is the post-audit committee just had us do a very quick look just to kind of get a general sense of the sentiment, so we don't have many more details than that. They just either reported that they thought that may be an issue or thought that it wasn't. Likewise, the consistency of care across foster care service providers was this very small look at whether services were consistent across the child placing agencies, and we found that they kind of have some thresholds for minimum services they provide, but a lot of parents that had been involved in that said, yes, we did have a different experience from one to the next, although the parents also reported that it seemed pretty easy to make that transition overall, which is another concern. Then 2021, so this is actually a more current audit. This had us look at the case plan tasks and permanency outcomes for children in the foster care system. So this report is actually in our kind of our new format. So if you went back and read all of our old ones, now we're getting into more of the kind of modern era of what we do. So this is all electronic, again, HTML, that type of thing. So we kind of looked at the case plan tasks that parents are given when they're trying to reunify with their children. Again, we found that overall we felt like those were generally reasonable and relevant. We admitted in this report that requires a significant amount of professional judgment. What does relevant and reasonable mean when it comes to case plan tasks? So we did define that in the audit. Relevant just simply meant it was germane to the reason they were taken out. Reasonable meant that it was something that seemed like they could accomplish. It wasn't like, take 100 therapy classes in the next 3 months or something that just be just impractical or impossible. We looked on average, those case plans had 11 tasks, mostly related to why the child was removed. And in those cases, parents often completed or made progress on the tasks they were doing. We did note that in 10% of the cases, we didn't feel like the case plan tasks were relevant or reasonable. And we flagged that as a concern, because even though most of them were okay, again, this is foster care, and any limitation between a parent and their child we felt like was concerning. So we pointed those out, and fortunately, we also noted parents didn't have to necessarily complete all their case plan tasks to be reunited with their children, because if you put those two things together, that'd be a lot more serious, right? So if we noticed 10% were unreasonable and didn't appear relevant, and that prevented parents from being reunited with their kids, that'd be a very serious problem. We found that in the cases we looked at least, even though they might have had some unreasonable or irrelevant tasks, that was not preventing them from being put back with their children. So That's good news, although we still have concern about that 10%, even though it may be small, that we recommend DCF, you might consider like tightening that out. If it's not relevant and reasonable, take it out. And so those would be things like, we're in here because the parent had, maybe drug abuse issues, so they got counseling, they did what they did, and then we notice they also have some financial issues, and we're like, well, that's not, right, you shouldn't be holding that back. You can't make the home ideal. It's supposed to be about this thing, right? Again, lots of judgment that has to be used there by the courts, by DCF. I mean, that's on a spectrum. But overall, we found that for the cases we looked at, things appeared to be in pretty decent order. We also looked at permanency outcomes and how those varied based on demographic factors like age, race, and ethnicity. And so what we found is there were actually some differences that were driven by that. So we did some pretty sophisticated work here. We did some multivariate regression, which helps us kind of isolate factors so we can look at those things, all other things being equal, because of course these cases are complicated. What we found is that being Black or American Indian did somewhat reduce the child's odds of being reunified to some degree. And then, interestingly enough, conversely, being Hispanic increased the child's odds of being reunified with their family. And then again, not surprisingly, the older the child was when they were removed from the home, the less likely they were to be reunified or adopted, which makes some intuitive sense. Finally, just last thing, Mr. Chairman, just to highlight, we are currently in the process of yet another foster care audit. So this one was brought to the committee with some more concerns. Here, the interest being about missing children and whether foster care contractors and child placing agencies are providing appropriate services to help protect the health and safety of the children in foster care. So kind of a continuation of this series of audits. This is in progress. State law prevents me from talking about what we are finding here, unfortunately, so I can tell you that this is underway. We're very much in the middle of this audit. You can see kind of our objectives. These are the questions we're trying to answer, and I'm giving just a real high-level summary of kind of the work we're doing in those areas. Should you all have interest in more details of how we're going about that, we can talk to you about that component, like our method and our process and what we're doing. We just simply can't tell you what we're finding until the audit is complete and released to our committee. So, Mr. Chairman, that's a lot of information, but that completes my presentation. I'm happy to try to answer any questions the committee members may have.
Justin, thank you very much for that overview. Just a quick question that I have on the second to last part, where you said Black or American Indian reduced the child's odds of being reunified to some degree. Did you, in the course of your audit, did you come up with a reason that was happening, or just, I don't know how in-depth you guys get with your audit. You guys don't get into it that deep, or?
So, we didn't get to a fundamental root cause in that the regression analysis doesn't necessarily tell us that, right? So there's some interpretation. We did actually try to get at that issue a little bit. So we actually had someone we talked to, Dr. Becca Eggman, a professor in KU School of Social Welfare, just asked them asked Dr. Eggman kind of the perspective of what that might mean. And so actually in that audit, they say that Black children may experience different outcomes because of bias, mistrust in the system, or lack of resources. They told us Black children and families are held to higher and more stringent standards. In a 2016 publication for the Children's Bureau supported this idea. It said parties in the child welfare system may let biases influence their judgments. And a couple providers told us Black families don't trust the foster care system, which might make them less willing to engage. So we heard some of those things. Those are more but kind of anecdotal. It doesn't necessarily, that's not tied to our regression work, right? They may be valid reasons and explanations behind them, but that's not, at this point, it's kind of conjecture what the actual root cause was. What our analysis shows is if you hold all the things equal mathematically, there's definitely a statistically significant difference in some of those outcomes. The root cause is left to more interpretive judgment. So those are some ideas, but not definitive.
Okay, thank you very much.
Yes, sir.
And just one other question that I had is, as a legislator, we see audits all the time, and one of the things probably that disappointing for me is once we see an audit, it seems like they're more used for talking points and gotcha moments instead of action items. And this isn't something that falls on you, but usually it's recommended by a legislator to do an audit or a group of legislators. I'm wondering, and I don't know if this is a task for research or not, but I think it'd be interesting to see these audits that are listed here and what type of action plans were derived off of those, if any. What type of legislation was introduced and where we are at on, because I know some of these you put recommendations none, but still seems like there were some things that, for me, reading, caused a little bit of concern that, hey, maybe we need to look into this just a little bit deeper. And I'm just wondering if there's ever any follow-up or on any of these items, where we're at on the recommendations where you did have for DCF or other agencies to do. So I think if we could do that. Justin, go ahead.
Mr. Chair, so we don't track the legislation, so that'd have to be something that Killers and Revider staff would have to help you with. We do track our own recommendations and the implementation status, so I can give this committee a report on, for all the recommendations we made, how many were implemented by the agencies, how many were refused by the agency at the time. So I can compile that for you if you're interested.
I think that would be very,
Yes,
very
sir.
helpful. And if you would work with Militia on that and maybe getting everything together at one
send it to you.
group, that way we're not getting multiple emails and items. And we have a question from Senator Foscadeau and then Representative Ousley. Senator Wright.
Thank you, Mr. Chairman. Thank you, Justin. To the chairman's point, I believe that I've requested an audit relating to this very issue year after year. And so can you clarify to the committee that even though I, as a legislator, may request that audit, is it correct that it then is up to that committee to decide to look into it?
Mr. Chairman, Senator Foscadeau, that is correct. So the post-audit committee makes the determination of what audits we will do. So that is correct. You and many other legislators have brought many audits to the legislative post-audit committee, and they have to make a determination of which they will approve that year or not. So, yes, ma'am.
Mr. Chairman, so I've asked your same question, and I'm glad now to see that DCF, maybe not on the watch of the current secretary. However, we have finally agreed that race plays a part in a lot of what we're discussing with the Child Welfare Committee. And Mr. Chairman, I will provide to Justin and your staff. There is a Native American social worker in Wichita who has been doing a 5-year study on this issue. And if I could share her information, and perhaps she could speak to the committee or share information on your question as well, Mr. Chairman. But my question to Justin is this. When you talk about the case plan task, and then when we talk about the turnover of social workers, and we talk about the requirements of biological parents before that reintegration occurs, and since we know that one mother might have multiple caseworkers because of that turnover, and a lot of times the translation of the duties that they are required to complete before that integration occurs, that translation tends to be lost in there somewhere when you get a new caseworker. So I've actually went to court, Mr. Chairman, with some biological parents that when they would leave the courtroom, I would ask them, well, where is your paperwork telling you what you need to do? And they would say, and this is in Cedric County, I think they do it differently in other counties, but they would tell me they didn't get anything and that they would receive a phone call in a couple of days from the caseworker to tell them what they needed to do. And so my question is, and I've requested this at times, I don't know if it's ever been implemented or not, Mr. Chairman, but Justin, have you in your audits or just requesting information, or do you believe from your work and research that it would be helpful that when a biological parent leaves the courtroom, that they have something in writing, a carbon copy of the recommendations made by the courts to follow, and therefore those copies are everywhere, to whereas a new social worker could kind of pick up where they were. Because what I hear, Mr. Chairman, over and over is that parents are required to, they have to start all over on that list, and they feel they've already completed some of the tasks. So your thought on that? Thank you, Mr. Chairman.
Senator, so of course, we have not researched that specifically, although I will say momentarily or briefly, some of our reports have highlighted that turnover and its effect on families. So the fact that the case management are moving around and they don't feel like they have the same person, that inconsistency can create problems and concerns for them, obviously. As to your specific suggestion, I can't speak to it. As an auditor, if you all want to add documentation, I will never complain. If that gives me the ability to go in and verify things, I'd be happy with it. I think that's kind of a policy question of how do you create the fix for that particular problem. That sounds like a reasonable alternative. There may be others, so I can't speak to it specifically. Although I get where you're coming from exactly.
Representative Ousley.
Thank you, Mr. Chair, and thank you, Justin, for being here. You'll have to tell Scott hello for us when you see him again in December. I've got just a couple of comments and a couple of questions. On our agenda for today, we're at 4 p.m. We're supposed to be comparing House Bill 2345 and Senate Bill 301 for the Office of the Child Advocate, along with the governor's executive order. And all these audits, it sounds like, but I just want to confirm, you have access to everything you need to come up with facts. There's nothing classified that you don't have access, judicial records, such as that.
Representative Ousley, that is correct. We have, Post-Audit Act gets us access to all records, confidential or otherwise. We need to do our work, so we have very far-reaching access.
And then to the LPA committee comment, that 2016 comprehensive audit started out as just the treatment of LBGT foster parents and kids, and it turned into that comprehensive 3-part audit, which was fantastic news. And then I worked with Scott at the time to come up with that limited scope audit thereafter to kind of get some grip on that. Now I forget where I was going with this. You said you follow recommendations. And to the chair's point, the Child Welfare Task Force of 2018, 2019, whenever that was, a lot of those recommendations sat on the shelf. One of the first recommendations out of that was to expand Medicaid. And here we are as a state, and we're still not taking up that recommendation. So you track your recommendations. How long do you track them for? Do you track them through different administrations?
So we are in the practice of only tracking them for 2 years, at which point we consider them expired. Kind of our take on that is if you haven't done what we've asked in 2 years, you're probably not going to do it.
And to that, I know our current administration has internally changed a lot of policies, which did follow up with a lot of the recommendations out of the Child Welfare Task Force. So, Mr. Chair, maybe it'd be fair to give the Secretary a chance to comment on that as she'd like at some point throughout our hearings. And then the permanency outcomes, shorter time for Hispanic kids and longer time for Black and Indigenous kids. Do we know if that's a national trend or is that unique to Kansas?
I don't know, Representative Ousley, whether there's national work in that area. I think to some degree that's kind of a new area for audit where we are starting to get to look at some of those equity pieces. So I don't know that if there's any work been done. This is certainly only our findings for Kansas.
Maybe that's something we could put research on. Thank you, Justin.
Thank you,
Mr. Chair.
And just to clarify, my comment about recommendations and action items off recommendations was off the legislative post-audit where they actually have facts that they have found issues. Recommendations from this committee are just recommendations for the legislature to proceed with, and that is entirely different. And I don't expect this committee to tell the full body of the legislature what they need to do, and they better do it, because we're just a recommendation requiring recommendations to our colleagues. So with that, Senator Reitman.
Thank you, Mr. Chair. Thank you for testifying. Very impressed of trying to go through pages and pages and pages. You mentioned that there's been a lot of audits in this area. And as we look at this, we see this. And I've seen a little bit of a trend. Of course, you've seen a lot more too, that some of the answers are DCS concerned with turnover, morale, and training. So with those kind of answers, they know there is a problem with some of the things that are coming up because they can't necessarily handle it or whatever. And so it seems like one of the situation, they need more people. Okay, all right. And then when you talked about the sufficient living space, it kind of caught my eye when it says 98% of the requesting, you know, for the children that are in their care. They said, well, that's okay, you know. Would that be the reason because, well, one of the reasons would be there's not enough people willing to take these people, and they said, well, this is the only one we got, or this is a choice, just don't worry about it.
Mr. Chairman, Representative, yeah, I think that's definitely a possibility, the lack of foster care homes and the available. I think in this particular case, what we tended to find, it was more just simply reflexive. It was more rubber stamp. You bring us a request for an exception and we just approve it. So they weren't critiquing the exception. They weren't deciding, does that make sense? Is that viable? It's just more, anyone who requests an exception will grant it because it was like 98% acceptance. It was, there didn't appear, and in talking to them, there wasn't a lot of critical thought being put on,
Right.
Does this make sense? Is this good for the kid? It was just, if you ask for it, we'll give it.
Yeah, well, that's really concerning. I mean, my wife and I, we were foster parents for a couple of years, and we had a list of things we had to do to get our house around and that kind of stuff. Anyway, well, thank you for presenting.
Representative Humphreys.
Thank you, Mr. Chairman. Thank you so much. Super interesting. A couple of questions that I had. When you talked about the safety under the Part 1 of the 2016, you said recommendations. We made a series of recommendations aimed at addressing problems. Could you make sure that those are included in the report that the chairman asked for so that we understand, since you didn't really list here what they were?
Representative, absolutely. That will be specifically the type of thing we're reporting back to you on. And just so to give the committee a sense, those recommendations are at the bottom of this page and they span the next page. So there's quite a few. I mean, they're pretty specific and detailed. So we will give you those and then let you know what the department did to address them.
Okay.
Yes, ma'am.
All righty. And then, if I may, under the permanency outcomes, when you looked at the reviewing case plan task, I am interested if these audits were, you know, the quick or the full. And you didn't really mention when you were going through each one of them which it was. I mean, well, a couple of them you said they were the quick, the 2017 and the consistency 2020, but the 2021, was that one of the full ones or one of the?
Representative, it was one of the full ones,
Okay.
Yes, ma'am. And yeah, I'm sorry for that. You can see, I've got it notated limited scope between the two, or behind the two small ones, but that means a lot more to me than you all. So that's
Okay.
how we designate
Okay.
that, so you'll know those are the very small ones.
Yes, got it.
Not easy to see, though. It's in that link, too, so.
And then the permanency outcomes on that one in particular, you said, you know, that you were looking at the children in foster care based on demographics. And you say that, and you mentioned being reunited or to families, so if unification is the goal, the case goal, but you don't mention adoption. And I'm just curious if you noted that how race and ethnicity and age affected the adoption rates.
So we did actually look at adoption, and what we found is that in our analysis, they did not have a significant effect on adoption rates. So they did, ethnicity did have, and race had an effect on reintegration with the family, but not necessarily on adoption.
That's fascinating, interesting. Okay, and then my last question, it's really more of a comment. I noticed several times and several places in here, you mentioned data, and at one point you said insufficient or incomplete documentation was kind of an issue for you all to dig in at times, and that's just a comment that, you know, it seems like that is something that would help our system so much if we were able to figure out that data problem. So that's more of a comment. So thank you, Mr. Chairman. I appreciate it. And thank you so much for being here.
Representative Reese.
Thank you, Mr. Chair. Looking at the 2012 reviewing decisions to remove children from their homes, I was curious about the main findings. You reviewed 9 families that had 23 children removed from their homes. Can you tell me what the ethnicity, racial background, data was for the 9 families?
I don't know that offhand, and I'm not certain if I can tell you all that or not. We'd have to look with DCF because they put very stringent confidentiality parameters around what we can say, especially when we're talking about only 23 children. That's getting pretty small. So I don't know that we even track that in that audit, whether we'd even have that, but I'm guessing that's probably something we couldn't share. Maybe in aggregate the percentage if we had that, but I will have to go back and look and see what I can do.
Yeah, even a percentage would be helpful to know. And then, Mr. Chair, can I have a second question? You used the word on that first bullet, reviewed 9 families, 23 children. In all cases, the removal decision appeared to be reasonable instead of justified. Is there a reason for that?
I'm guessing not. That's a good question.
And I didn't know whether it was the purview of the auditors to really have an opinion about that.
Representative, good question. I would argue we can have an opinion, although I get your point, and I would qualify that our opinion is not binding. And so one of the things we make it very clear to the families when we are engaged in these audits is regardless of what we find, that has no effect on your court case because that is done through the appellate court system and others, that we are not a binding opinion. So we offer lots of opinions, but there's a distinction between an opinion that can actually affect their case and an opinion that is just what we do in evaluation. You're correct.
Thank you.
Senator Foscato.
Thank you, Mr. Chairman. Justin, to the representative's point of that information, I think that's the one of the post audits I keep requesting year after year, and I appreciate you sending me the email asking me if I want to submit that information again. I think that would be helpful. However, again, it's up to that committee to decide whether or not to even look into that request. So that's interesting too. But Mr. Chairman, just real quickly, Justin, when you talk about DCF's hands-off approach, could you just elaborate a little bit more of exactly what you mean there? Thank you, Mr. Chairman.
Senator Foscato, that was a great question, and I was trying to look for an example, and there is one in here, but in the interest of time, instead of me trying to find it through this amount, let me put that as a note, and I will send you the response to that question to the committee as a whole through Alicia. I do have some good information. If I try to pull it up right now, it's going to take me a lot longer than if I look it up later.
Justin, thank you very much for that. I do not see any further questions from any, whoops, I do see one. Senator Gossage.
Thank you, Mr. Chair. Just a very quick question, Justin, and thank you for being here. When they did this extensive research on, I think it was 23 children, I think it was said, what percentage of that is the overall population of the foster care program?
Ooh, a very, very small percentage, Senator. I think there, if to my count, maybe 6,000 some children in foster care-ish, give or take, maybe.
Okay.
Yep.
So, and the other question that I had, and forgive me, we were going back to 2011, and this is 10 years ago. So this was a 10-year audit?
Senator, I just actually went back a decade to kind of give you general, and working with research, we just kind of picked like what's a long period of time, so it's more arbitrary. These are all individual studies that fall in that time frame. They're not necessarily connected. The part 1, part 2, and part 3 are, but everything else is random requests from legislators within that time span.
Okay,
Yes,
within
ma'am.
that time frame. So what was done in the most recent audit?
So the most recent audit that we've released was the one looking at the case plan tasks. And so that was, were they reasonable, and, were parents able to accomplish them? And then also looking at that question of how race and ethnicity might affect outcomes. The one that is upcoming, that we are currently working on, so that will become the most recent, is having us focus on concerns specifically about the safety of children in foster care as it pertains to like the missing children component, like how did foster care children go missing, and what are the policies and procedures to make sure we know where they're at and they're safe, those type of things. So that one is ongoing and should be released in January, February, so it should be available to the legislature early session this year.
Right. And finally, I'm on, for us, it would be the next to last page. And on the back of that page, former teacher here, so forgive me, but I think there's a clerical error because we have a double negative. Kansas performance on 11 federal outcome measures didn't not change. So I'm thinking, did change, did not change?
Did not change.
Did
You are
not
correct,
change.
though, Senator. Thank you. Duly noted.
Thank you.
Okay, Justin, thank you very much for that, and we look forward to seeing the follow-up information from the committee. So, and if we do not see you again before December, best wishes for you, and we're going to miss you.
Yeah, thank you very much, and it's been a privilege working with all of you, and I wish you all the best, and so maybe I'll see you in the future. Thank you.
Committee, we are running a little bit ahead of schedule, so because of that, we are waiting on a PowerPoint presentation to be presented. So if you guys can just bear with us just a couple of minutes, as soon as we have that, we will move on to our next item on our agenda. And that item will be a overview of data organization for child welfare. And Felicia Kakura, CEO of Binti Foster Care Software, will be the presenter on that. And also, I would like to direct your attention also under this topic. There will be written only testimony in your packets from Tanya Keys, Deputy Secretary for Children and Families, and Ed Klump, retired law enforcement, Kansas Association of Chiefs of Police, Kansas Sheriff's Association, and the Kansas Peace Officers Association. And we will set by for a couple minutes until we get the PowerPoint. With us again, we're going to have an overview of data organization for child welfare. And to give the presentation or the overview is Felicia Kurkuro, CEO of Binti Foster Care Software. Felicia, welcome to the committee.
It's great to be here. Okay. Can you hear me okay? Okay. Awesome. Well, thanks again for having me. I'm Felicia. I'm the co-founder CEO of Binti, and I'm going to walk through a little bit of our origin story, what we do, and kind of an overview of foster care software in the country and our vision for improving it. Let's see if I can. Okay, so first, quick background on me. So I actually started Binti due to a personal connection. My sister adopted 2 children, and it was just a really difficult, complicated, stressful process to get through the licensing process. And, you know, I did research on child welfare at the time, and I think, as we all know, you know, the outcomes on children aging out of child welfare are quite sad, and we have a shortage of families. And so it just didn't make sense to me that the process for families would be so unwelcoming to get through the licensing process. So that was kind of my catalyst for wanting to get involved. And my background, I worked at McKinsey for a number of years, and I worked with large government agencies and Fortune 500 companies doing change management and process improvement. And then I was working in Silicon Valley building software for other spaces. And I just knew that there was software that could make the process easier for families. And so in 2016, I spent 4 months shadowing child welfare agencies around the country. And essentially what I saw was a lot of things were being done very manually. So there were, you know, tons of paper everywhere. There were, you know, literally rooms of file cabinets of paper, and lots of sticky notes and shoe boxes of note cards. I see some people nodding. And, you know, large Excel spreadsheets. And I think it was really, you know, hampering the work and hampering outcomes. And so to give you one example, I mapped out child welfare into 6 different workflows and kind of went workflow by workflow, shadowing and understanding what is the current process, what are the challenges, what are the North Star metrics that this team is trying to hit, and what are the barriers to hitting those. I started with the licensing team, the team that is in charge of licensing families to become foster or adoptive families. And what I saw was that families were applying all on paper. So similar to what my sister shared with me, you know, I talked with a lot of other families, and they would share that, you know, they were interested in becoming a family, but then they would get a huge packet of paper, and it was really unwelcoming. And then they might submit paperwork, and then maybe a piece would get lost, and their social worker would change, they'd have to resubmit it. And so they would say, you know, I hear there's a shortage of families, but then it doesn't really feel that way on the other side. And then when I spent time shadowing social workers on the licensing team, what I saw was they were using a 70-column Excel spreadsheet. And, you know, I've talked to social workers in most states at this point, and everybody kind of nods when I talk about that. And so imagine being on a team of a couple dozen social workers or more, and having a spreadsheet that has thousands of rows of families and then 70 columns of requirements per family. And so the columns could be a form that they have to submit, or a background check you have to complete, or a training that the family has to do, or the home inspection of the home, or a reference from a friend or a relative. So it's a very complicated spreadsheet shared across many people. It's kind of a recipe for errors and being error prone. And it's also really challenging for workers to show up and figure out what they should focus on that day. So a lot of things fall through the cracks. It causes delays. It causes families to drop out. And then if a social worker leaves the agency, they might not have put the family in the spreadsheet yet. They might have it on sticky note, and then the family gets lost entirely. And so it started to make sense why the process was so challenging for families. And it's not because social workers weren't working hard or they weren't trying really hard, but it's like they don't have the tools they need to effectively track their work and get families through the process quickly. And so, you know, this is really the team that we started with that I'll spend the most time on today. But as I mentioned, I kind of did this across each of the 6 workflows in child welfare. So the team that licenses families, the placement team that matches families with children, the case management team that's working with children, but also families of origin to try to get them services to reunify, people engaging with relatives, the eligibility payments team, the intake team, the investigations team. And so at first when I saw kind of all of this being done on paper and Excel spreadsheets, I thought, well, maybe there's no, budget for software in child welfare. But I think as we all know, every state spends significant money on state child welfare systems. And every state's spending millions or tens of millions of dollars a year on custom-built child welfare systems. And there's a lot of examples of, really large builds. I think, you may be familiar, but tens of millions, hundreds of millions of dollar builds. Some of the projects fail or there's time delays, et cetera. But even though we're spending a lot of money on these systems, the focus in the past has really been more about compliance as opposed to empowering the work. So the systems of the past have been more, how do we get all of the data for federal reporting, as opposed to how do we build software that families can use and social workers can use to get to the best outcomes for children. A lot of the systems are very old. So in a lot of states, the systems are 20 plus years old, and they're very antiquated. They haven't really evolved. But even the systems that are more newly built kind of still mostly have this, this focus on compliance. And again, it's really a tool that social workers use to put in data. And so as an example, going back to that licensing team, the team that the families are doing everything on paper and the social workers are using 70 column Excel spreadsheets, the reason why they're doing that is that in most state child welfare systems that we've seen, there's a section for the licensing team, but it's really only like once you've licensed a family. So let's say, I license Susie, and now I go into the state system and I put her name and her address and the date of approval and a few other fields. But it doesn't actually help me do the approval. It's like logging my work after I do it. And so that's why social workers and families are doing everything so manually, again, because it focuses more on tracking the work after it's done as opposed to empowering the work. So what we set out to do, and the other thing that we hear consistently across the country is social workers say they spend 50% of their time doing their actual work and 50% logging their work, which, as we all know, social workers didn't get into social work to deal with like administrative, paperwork. They want to work with children and families. So what we really set out to do is build software that empowers outcomes for children and families and actually saves social workers time and provides better data to improve policy and practice. So starting with that team, the licensing team, essentially what we built is, I like to call it TurboTax to be a foster adoptive family. So you can apply online, you can apply on your phone. We can have different languages. So if you have a lot of relatives that speak Spanish, for example, we can do the whole process in Spanish for them. So, you can be on your couch on a Saturday, on your phone in Spanish, applying to be a foster family, as opposed to the current process of getting mailed a packet and then calling someone, leaving a voicemail, and having a much less welcoming process. And it's not just the foster or adoptive parents that do the paperwork, it's also everyone in the home needs to complete paperwork, friends and family need to do references. So we make it really easy for all of those people to contribute to this online application together. So for example, if you're the family and you list 3 references, you list their names and their emails, you click send, it emails them, they can complete it online on their phone, we'll send automatic reminders. So we really just try to make it easy for this whole group of people to get this done, know where they stand, and get through the process easily. And then on the social worker side, we replace that 70-column Excel spreadsheet with a dashboard where, as a social worker, you can easily see your caseload, you can see all the families going through the process, you can see what's done and what's missing. You can track the background checks. I know that was something talked about earlier today, so you can really easily see the background checks that you're running, what's done, what's still outstanding, if you need to run exemptions on any of them. You can track the trainings that families are doing. You can do your home inspection of the home for safety, and you can actually do that on your mobile phone while you're out in the field. So you can be in someone's home and checking things off your list on your phone that the home is clean and has smoke detectors and all those kinds of things, as opposed to doing it on paper. And then we also have robust reporting for supervisors and administrators to have better data on their team to better manage their team and be able to make better decisions. And then I'll briefly just mention one other module of the 6. This is also these 2 are our most widespread modules. So the second one we launched is placement. So this is matching families with children. So we already have all the data on the families because they filled out their whole application in Binti. So we know hundreds of things about them, and we know their address, and we know how many bedrooms they have, and we know their preferences for children. And so a lot of our agencies started saying, hey, can you surface that in a helpful way for when we're doing the search, when a child comes into care and we're trying to figure out which family could be the best fit. And so we built this, and it helps you search the families. And we really have a focus on keeping siblings together and keeping children in their school and community of origin, as well as finding the best match on the first match. And so this is something that prior to Binti, I think, happens manually in most places as well. And imagine if you have 1,000 families and you're trying to keep a child in their school. You're going to have to Google map to a bunch of the families manually, and you might end up moving a child far away from their school when you could have kept them close, or when you could have kept them with their siblings. So it's really important to be able to surface this information quickly, and software can really help workers do that quickly. It's also just a collaboration tool for the placements team to better work together, because imagine if I'm a placements worker and Vanessa is a placements worker, and I make a bunch of calls to families today, and a bunch say no to me, and then I'm out sick tomorrow. Vanessa might cover for me and call the same families, and that happens a lot, and families actually get really annoyed. We talk to families about this, and this is one of the biggest things they complain about, and they're like, I already said no yesterday, it breaks my heart to do it again, and also you seem really disorganized. So if we can, because a lot of teams are taking these notes on Word documents and they don't really share them, and so now you can take them right in Binti, and you can easily collaborate together to see who's been called collectively by your agency about a child. And there's a bunch more, but those are some of the highlights. So the last kind of piece of big context on Binti before I'll get into some of our outcomes is that we also see ourselves as the pioneer for software as a service in child welfare. So I mentioned how most state systems to date have been custom-built systems, and they take many years, and they're very expensive. There's risk of project failure, et cetera. Binti is taking the software as a service approach that's grown dramatically in the private sector in recent decades to child welfare. So quick overview of kind of this transformation in the private sector is that it used to be, if you run a large business, you'd have to build your own payroll software. And it would cost a lot of money and take a bunch of your resources. Now there's 5 payroll software companies you can choose from. You can pay them a couple $1,000s a month. It's way better than you would have built yourself because they have a whole team focused on that, and it just makes a lot of sense. And so there's thousands of SaaS companies that have popped up in the last couple decades doing all kinds of different verticals. But that really has not come to government as much and child welfare. So we're still in this world of custom building and really big expensive projects that everyone is building from scratch. And so what we've done is we've studied what's the same and what's different across the country. And there are unique things by state, but roughly 90% of things are consistent across the country. And so we've studied what's the same and what's different, and then anything that's different we make configurable. So it takes us more time up front, but then it means that we can launch really quickly in new places. So we launch in 12 weeks instead of in years. It's a lot more affordable because we're not charging to build the whole system. It's already built. We're just launching it with you as well. And it's less risky because, again, it's proven in other places, and you can talk to those states on how it's working for them and hear about their proven results before launching with it. And the other thing is it really aligns our incentives, because I'm sure you all have been around and seen different big tech projects where you pay a ton of money up front and then you're kind of locked into a vendor for better or worse. And we're really trying to change that. So we charge a flat annual fee. We don't charge anything up front. And so you're not locked in with us. And we launch in 12 weeks, so you can quickly see whether it's working, and you can decide if you continue with us, and you're actually not out a huge amount. So I really do think that, as I mentioned, software as a service has really transformed the private, software space, and I think it will in government, and we're part of that wave, and we're kind of the first people bringing that to child welfare. Okay, and so this approach has has really resonated with folks, and so we launched almost 5 years ago in January of 2017, and we've grown to over 100 agencies in 27 states. The agencies we work with serve about 22% of child welfare in the country in terms of number of children, number of families served. We are in 5 states statewide, and we're in a contracting process with 3 other states statewide, so we'll be 8 states soon. And we actually work in Kansas already in a local private agency, DECA. So let's see here. And I think part of the reason that we've grown so quickly is we've had really measurable results, and we also drive ROI, so we actually save more than we cost. And we help support family first by approving more families. So going through these things, I think our biggest benefit is that on average, agencies approve 80% more families per year the year after working with us compared to the year before. So we always ask, how many families did you approve in the last 12 months? And then in the first 12 months on bid, we can measure that, and on average, it's an 80% increase. I think that's due to just making it so much easier for both sides. We also help approve families 16% faster in the first year, and it gets faster year over year. So as an example, our first customer was a county in California, and they were 301 days, and after 3 years, they were 93 days. So they kind of kept getting faster year over year. We've had different agencies do time studies where they kind of measure the amount of time it takes to do their work before and after BINTI, and they've come back to us and said that we save 20 to 40% of their time. So the exciting thing is, like, with the same team, you can do more. You can approve more families more quickly. The other thing is that I mentioned is the ROI. So we've had a lot of agencies tell us that we save them a lot more than we cost, and there's different cost buckets. But the biggest one is that the fact that we approve families more quickly. And some of you may be familiar with this nuance around federal reimbursement. But basically, if you're just a person from the community, we're not going to place a child with you until you're approved. But if you're a relative, let's say your grandma, we will place you typically before you're fully licensed. You might need to do like a quick background check and have a quick process. But the federal government won't reimburse you the full rate until they've been fully licensed. And so a lot of states are losing many millions of dollars in federal reimbursement due to this. So I haven't studied it particular to Kansas, so you would have to dig in together and verify, what those numbers are for you. But we've done that in a lot of other states, and a lot of states are losing millions of dollars in lost federal reimbursement. And so if we're able to approve families more quickly, we can get that federal reimbursement more quickly for those families. So that's kind of the biggest bucket, but there's a couple other buckets too. Because we approve more families, we help get children out of group homes and into families, which obviously is better for outcomes. It also saves money. So those are kind of the 2 biggest buckets. Overall, we've helped approve over 40,000 families across the country. And then Family First, I think as we all know, there's the element of prevention, and then there's also the element of trying to get children out of congregate care and into families. And so this has been a huge focus for a lot of states right now, and I think that's another reason why BINTI's grown so quickly is we've been part of different states' Family First plan around how they're going to get children out of congregate care and into families. And then I'm just going to briefly mention, I've really focused on those first 2 modules, which are kind of our flagship modules that are the most widespread across the country. But we actually have built out a first version of a full CWIS system that could be a full child welfare system replacement. And it's across 7 different workflows, including case management, eligibility, intake, community crisis response, family finding. The thing that I want to mention here, and they're at different phases of launch. So as I mentioned, approvals and placements is extremely widespread. Case management is also launched. The other ones we've built first versions of, and we're excited to launch with our first partners soon. The things that we've really focused on as we've built out each of our modules, similar to what I talked about with licensing, is taking that approach of empowering outcomes as opposed to just compliance. And so we really look at what are the levers of permanency. There's prevention, there's reunification, there's permanency with kin, there's permanency with community members, and what are the barriers to achieving greater levels of permanency, and then how can software empower that? And that has led us to, instead of just building a portal for social workers, again, we built that portal for foster and adoptive families and kin families, which we talked about. We're also building out a youth portal for older youth, for them to get access to resources, and to give feedback on the resources that they're getting from their agency, from their worker. We've done a lot of interviews with youth, and they've asked for this, and we're excited to build it as part of the case management system. And then we're also building out a portal for families of origin. We've also done a lot of interviews with them, and we think there's an opportunity for them to engage in the system as well, to get access to the resources that they're getting for prevention services, for reunification services, and also give feedback on the resources that they're getting and the agency, and give, and be able to collaborate with the foster adoptive family and know how their child is doing, know like, is my child doing well in school? What was their, last medical visit? Things along those lines that we can really help them stay in the loop. That will really, I think, reduce trauma and support them in their reunification. We're also, those are kind of the most important next two that we're focused on, but we're also building out, I'm a Casa, and so I know I would love a portal, because I would like to contribute case notes and see the latest, from the rest of the team. And so we also want to build a portal for Casas, for lawyers and others in the future. So really what we're envisioning is a system that just allows the whole team to collaborate on the best outcome for this family. I've already kind of talked about this, about our flat annual fee and how it aligns incentives instead of kind of charging all up front and locking people in. But just to mention that, it really includes everything. And when we work with agencies, we import all of the historic data and help clean it. We have like a data cleanup validator tool that we do to get the data into a good spot. We do all the configurations. And then the other unique thing is that we actually launch with all the private agencies within the state. So you have a number of private agencies in Kansas that are doing, work in child welfare, that are licensing families and doing case management. And in a lot of states, those agencies are not using the state system to the full degree. And so there's a lot of emailing and faxing documents back and forth between the states and the private agencies. And that reduces collaboration. And so when we launch in a state, we would actually launch in all the private agencies as well. They would only see the data on their families, and it would roll up in an umbrella view to the state. And so this allows for better collaboration. It also allows for better visibility into data. So, if you're having meetings like this and you're wanting to see the data across the state, you can more easily just see the data across child welfare, not just the state agency, but also the private agencies at a glance. And then we also have APIs that can integrate with other systems like Medicaid and other things. And then one other thing is that I forgot to mention about our software as a service approach is that we meet every month with every agency. So we work with 180 agencies, and we meet every month with every one of them. We have an account management team. And we get feedback, and then we roll out about 20 enhancements to the week. We roll out enhancements to the software twice a week. So we're constantly listening and improving. And the more agencies on the system, the more feedback we're getting, the more engineers we can afford, the more features we're rolling out. So our team has grown from me to, we're now 67 people, and we're going to be over 100 in the next 12 months. So we're growing quickly, and again, the more states on it, the bigger the team we can afford and the better the software gets. So our advice to states when you're thinking about modernizing your state child welfare system is a few things. So first of all, we encourage people to start modularly and get a quick win. Instead of spending $50 million or however much and doing a big bang build, is to start modularly and quickly and affordably. And so again, you know, if states are intrigued about us, our licensing and or our placements module are very affordable, and we can launch in 12 weeks. So it's a great way for states to kind of try something out and get a quick win and see if that works, and then they can always do more with us. Or you can do modules with other vendors, and we can integrate with them. You know, the federal government in the new CWIS regulations is actually really encouraging modularity. Modularity is kind of one of their buzzwords, because they're trying to move away from this big bang approach as well. So we really kind of tie into that. Another suggestion is just to stay platform agnostic to maximize competition. So, you know, there's pushes in some state governments to, you know, choose a platform, whether it's Salesforce or Microsoft or IBM or different platforms, and just be like, let's just build the whole state on top of this platform. And there's a lot of benefits to those platforms, and that might be the right decision for a certain vertical in government, but it doesn't leave you open to best-in-class SaaS vertical solutions, which I believe are going to start popping up. I think there's going to be a BINTI for, you know, Medicaid and child support and, like, you know, all of the different verticals in the future. So we just encourage states to keep your eye on vertical SaaS and not limit it to a platform. We know that some states have gone that direction, and then they choose a platform, and then their child welfare team learns about BINTI, and they're like, we'd love to do you, but we're like boxed in, and we don't have the flexibility. So that's just a suggestion that we have, is to leave that flexibility open. And then the last one is just ensure that your system works across supporting private agencies to improve collaboration. That's what I was mentioning before. It's really beneficial if everyone in child welfare can be on the same system, collaborating, maximizes collaboration and also data. So that's the overview for me. Thank you so much again for having me, and I'm happy to answer any questions that people have.
Felicia, thank you very much, and appreciate you willing to answer questions, because I already seen a couple of hands pop up. One question I would have, we heard earlier from post-audit that we're one of the very few states that is 100% private. So how does your software would be more, it'd be more complicated to be statewide, I would think. Could you explain how that would work in a private, 100% private setting versus some of the other states that might be 50-50 or some that are just completely state-ran programs?
Yeah, that wouldn't be a problem. You know, as I mentioned, in every state we work in, most of them have a component at the state level and private, but it's fine if it's all private as well. We also work in part of the state in Florida and Texas that are all privatized, so we're familiar with that. So yeah, we would just launch with each private agency individually. Each of them would only see their families and their children, but then we would have an umbrella view that the state could log in, and you can see the data across the whole state, and you can even just zoom in on one agency and see their data.
So that brings up a pricing question for me. So as the state, would the state have to buy a module, pay for their module that they would get to look at, and then each individual private agency, or would have to pay for their each?
Typically, how we do it if we work at the state level is the state actually just pays for it. So it's kind of viewed as a component of the state child welfare system, of your SACWIS or CWIS system, and then you would get it and you would put it in your contract with private agencies that they have to use it as well. You know, in the case of when we work in a private agency but not at the state level, then the private agency pays for it. But if the state started to pay for it and any private agencies were already paying for it, we would refund them for like the prorated amount of the year once the state started paying. And we've done this, you know, for example, the state of Rhode Island, they have 11 private agencies that do most of the licensing. We launched in all 11 and did a rollout with them, and we're currently launching in the state of Washington that has 84 private agencies, and we're rolling out with all of them. So we're definitely familiar with this kind of a rollout.
Senator Gossage.
Thank you very much for being here, a very thorough presentation. I had a similar question to the chair in that, so the system that we are using now in the state, are you familiar what system that is? Is it all paper? Is it manual? Is it the 70 columns that you're talking about? Do you know?
This might be a question for the state agency, but.
Okay. I just wondered if you'd been
Yeah.
talking to them and if you had any idea.
I haven't reviewed it in depth with them. We've talked to
Okay.
folks a while ago, but in general, what we see across the country, and then maybe you can answer more specifically, is that every state has a state, system.
Right, you have to have some system.
But then it's complemented heavily by paper and Excel because again, most of the focus for most systems has been on compliance and tracking the work once it's done versus empowering the work as it's doing it. But I'm
So
curious.
then, when we talk to them later today, they would have an idea of what this is. You've visited with them, I'm assuming, and they can compare, okay, that's that, and we have this now.
Yeah.
And is that right?
That sounds good.
So then the question would be, because this sounds like it would be more beneficial, however, of course, it always comes down to cost. And so we have a private agency that it's using that now, so it'd be good to know how many private agencies do we have? Is it just the one that's using it now? Could they testify like, I think it's better? And then how much are we spending now for our current system, and how much more would it be for this? Can you give us an idea of what it typically costs for this program?
That's a great question. Vanessa, Vanessa's on my team. Do you know if we have a quote for Kansas? We typically ask, we haven't been thoroughly in touch with the agency. We were invited to come do this presentation, so we typically ask a number of questions to come up with a quote.
So we don't have a quote yet.
We don't, but she can probably come up with a ballpark for you to give you a sense.
And how
But-
many states did you say you are working with presently? Are those private agencies within those states? Like, I see you have Kansas highlighted.
Right.
Because you have a private agency.
Exactly.
So how many of the other states are in the same situation?
So we work at least at the local level in 27 states. And then we work at the state level, so like with the entire state and all the agencies within it, in 5 states. And we're in a contracting process with 3 more.
Okay. Oh, I see you say that, 5 states. That's what you mean by the,
Yeah.
by the statewide. And let's see, let me go back to, I don't know if these pages are numbered. There's a page that says tracking workflow management for placement. And I'm looking at that and saying, how many columns is this? I mean, is that a similar, this is tracking, though, the actual caseworker, correct?
The placements is tracking the whole search process for finding which family we're going to place the child with.
Okay.
And tracking that work. And so saying, okay, I called them, I left a voicemail, they said no, they said maybe, and then ultimately placing the child in the home.
And I get that. I'm just saying, this is going to take several columns, too, as to know how you did whatever. I do like the graph. I would love to hear from people, and maybe this goes more to committee, Mr. Chair, but the line bar graph, I think is a good way to look at that instead of continually going over and over and over. Having been a district manager for Sylvan Learning Centers, and we had 70 columns, and I'm just
Yeah.
like, blah.
I know.
And I get it.
We love getting rid of spreadsheets.
Yeah. All right, well, I think those are all my questions. Thank you very much. Thank you, Mr. Chair.
Thank you.
Thank you, Felicia. And just before we move on, you had said something about maybe getting a ballpark quote. And I'm going to ask a question to our advisor. Since we're not in the position of doing this, chances are it would go out for an RFP. I would hate to taint that process if that is something that's going to go out. So I would ask for a revisor's opinion on whether or not you should share that or not.
Okay.
So,
No
Jesse?
problem.
That's a good point.
So I'm not very well versed in the RFP process, but with that, there could be a concern in regards to the conversations with DCF and how even you would approach the RFP process since we have a contracting system. So that's something I will look into for the chair and the committee on how that would go forward. So thank you.
That sounds good. Happy to take the lead of, whatever you suggest. I will say that we've definitely done RFPs in some states. There's also, most of the states have actually done, either purchased us from sole source, from GSA, or through a reseller, just because particularly our licensing, there's really nothing else that does it. So states have been able to have their legal teams like research and, look out in the field and then be like, well, there's nothing else like that really does this. So anyway, it's just something we're happy to, go through whatever process you do, but I'm just mentioning that.
Felicia, thank you very much. I just would
Yeah.
hate to get too far
For
into
sure.
the weeds on that part and something. And I think that is something the committee, when we get to our recommendations, that they could look at, maybe recommending that something goes into an RFP process, or look into more research on software that we are using in comparison. So Senator Foscato has a question.
Okay.
Thank you, Mr. Chairman. Whoever invited you to come, they are really smart. Good, good. Jessica, you're going to be rich. Binti, I love the collaboration concept.
Thank you.
And a lot of times our struggles and experiences of what you've shared create something good and easy to make a difference in the lives of people that we are charged to help. And so I see this not only to help with the adoption process, Mr. Chairman, I see this where this is so refreshing to hear you. I'm just pleasantly thankful for your presentation, because over the years, I've had the frustration of a DCF client call me and they share their situation with me. And then when I call DCF to get information, so then the client has to get an affidavit signed. I have to sign it. They have to sign it in order for DCF to talk with me about their case. And by the time that individual who has no computer to get that to me instantly, they've got to mail it to me, or I meet them somewhere, and it's by the time it all comes back around, Mr. Chairman, I have forgotten what their situation was, and then I've got to listen to their story again on the phone, and it just goes on. And so I see this, Mr. Chairman, where it would also help that side of the coin as well. And for those who don't have the computers, perhaps they could meet at in Wichita, we have many city halls that offer free computer services. So perhaps they could go there and get me that affidavit real quick and signed, and then better help that individual. So I hope you come up with some way to pay for it and to help implement it here statewide. But my question would be, so from DECA, so how do you pay Binti? Is that out of the money that the state receives from the federal, and then that lump sum they give you? Are you able then to just decide how to utilize that fund? Because Jessica said that it's already implemented within DECA. So how is that paid for, and how are you benefiting from it? Mr. Chairman, thank you.
We're going a little off from the conferee, so we'll please hold questions that directly go to the conferee on this. And I'm sure DECA has a presentation later. When we get into that, if you will hold that, thank you.
Sounds good. Thank you for your comment.
Representative Reese.
Thank you for your presentation. It's just out of curiosity. Just in my experiences of using medical records, that the software are built, and they're built well, but they never consult with the people who are actually using the system.
Right.
So were there any child welfare social workers, was their input taken into account when the system was being built?
Definitely. And I think exactly right in terms of the way it's historically been built. And I think that's where we get to this emphasis on compliance in the past, you know? So yeah, so when we first were working on Binti, I spent 4 months shadowing social workers and basically building software that they wanted to help them with their job. And every single feature that we build in Binti, we're constantly talking to our social workers. We're constantly doing youth interviews, families of origin interviews, relative interviews. So yeah, that's and of our 67 people on our current team, roughly 10 are former social workers. We also have, you know, people with lived experience on our team too that we're constantly evolving.
That's fantastic. And then one more question. And you were talking about the portals. One of the things that we've heard over and over and over from physicians, that they cannot get medical records in a timely manner in order for them to be able to see the child. And so I assume that maybe that would be another way that the medical professionals or even a dentist could be able to look up medical records.
Yeah, it's a great point. It's on our list of other people. I think also teachers. Like I think there's the ability for different access levels for different people, you know, that see certain information.
Right. That was going to be the next question about the access levels. Okay. Thank you.
Yeah.
Representative Johnson.
Thank you, Mr. Chair. Thank you so much for the presentation. The 50% time period spent doing report writing was a comment you made. Were there any projections made for how much that might be reduced to get our people back into the field?
That's a really great question. We haven't done an exact analysis, so I don't want to, you know, but I did share that some of our agencies have estimated we saved them 20 to 40% of their time. So I think, you know, I would say that's roughly the amount of time that we're saving on administration and documentation. You know, for some workers, the workers that are, you know, the straight up licensing workers, sometimes there's people that tangentially use us because they're on another team and they're just seeing information, but the people that are doing the licensing work or the placements work, and you know, a few of the ways that we save time, first of all, you know, following up with families and sending them packets and stuff like that. Because we automatically remind families to do things, that takes a lot of the onus off of workers. Workers also spend a lot of time aggregating their information for reporting for supervisors and administrators, and Binti automatically generates those reports. And then to the comment earlier of like sending things over mail, like references are typically sent over mail. I'm not sure if that's how you're doing in Kansas, but that's in most states. They're sending mail back and forth to references, and that's just automated in Binti. And so, you know, we save a lot of that kind of time. Oh, we also make sure you only enter data once, so there's no duplication of entry. You know, there's a lot of different forms where the same information is asked, and we'll just ask it once and we'll populate it through. So those are some of the biggest ways that we try to save time.
Excellent. One other quick question. Some of us lack technical skills. I was told over the weekend that I probably need to update from a rotary phone at home. How are you going to bring in us old timers through training? What type of programming training is going to be available?
Yeah, that's a great question. So we, you know, at Binti, we have a range of users that are from tech savvy to not tech savvy. And we really try to build it to be incredibly easy to use for the least tech savvy audience. We do training, but our biggest focus is trying to make the software really easy to use, you know, so that you don't need, I know another state, not Kansas, has a 200-page user manual for their child welfare system. And we really don't want that to be needed. You know, it's like people don't need a user manual when they go to Google or when they, you know, like book a hotel room, and we want it to be like that. So we do have a 2-hour training that we do when we first launch, and we offer refresher trainings, but we also offer customer support. I didn't mention that, but we have customer support over email, phone, and live chat, and our average live chat response is 12 seconds. So that's a really useful tool. As you know, let's say you got the training yesterday, but then you're in there and you're kind of confused, you can just chat with our team and we'll help you through anything. And that's available for staff. It's also available for families. So if families have a question, if they're going through the process, we'll hop on the call, we'll chat with them, we'll email with them. So that's a really good, and then we have online tutorials as well, like online help center too.
Thank you. That's very helpful.
Yeah.
Thank you, Mr. Chair.
Felicia, does your tech support give help out with rotary phones on how to use?
You can call us from that.
Representative Humphreys.
Thank you, Mr. Chairman. Felicia and Vanessa, thank you so much for coming to Kansas, and I hope you'll get a chance to look around our beautiful capital and enjoy that. So my question also is, you talked about the 6 different workflows, and I think we're interested in the licensing piece, which you particularly spoke about. But it seems like I remember when I've heard your presentation before that you're either working on or you already have launched a piece, particularly following up with for caseworkers when they're working with kids in the foster care system. I mean, I remember you talking about they leave the house, they're in their car, they can put something in their phone. I mean, because that's part of it too that we're concerned about is, you know, huge caseloads and how can they manage all of that? So can you speak to that piece, what you all are doing, or if that's in the future, kind of what the plan is?
Yeah, definitely. And I know it's a lot to keep track of because there's 6 modules and there's different portals within each module. But within the licensing module, the one that's focused on licensing families, that's also for kin. So it's not just licensing people from the community, it's also licensing kin and relatives and making it easy for them. So if you place a child in their home, pretty unexpectedly, it's a lot better to be like, okay, you can do this on your phone versus like, here's a huge packet and you need to mail things, So it helps them. And then it also helps the worker when they're out in the field, they can be doing the work on their mobile phone. They can do case notes. They can even, if their phone supports like dictation, they can even like talk into their phone and that can go into a case note. We have a lot of workers that do that. So that is all within the licensing piece. Okay. But then on case management, like on each of the modules, there's kind of elements of this. So case management, we have also, that's our 3rd module. We have launched that as well. And that has a focus on, the worker who's visiting the child each month, who's really in charge of their permanency efforts, who's also supporting the family of origin. And that also has a case, like a component that is mobile friendly for the worker to be entering forms on their phone, to be entering case notes on their phone, to be keep track of everything they need for compliance, but also keep track of, what is the most important thing to help this child, because it's a little bit of a side note, but I think it's something I'm really passionate about is, there's so much compliance work in child welfare that I think a lot of the work can be very reactive, right? It's like, oh, there's this fire or there's this thing that's due. Whereas, for a given child, they came into our care for a reason. There were some risks. And then we make a case plan to try to address those risks, to try to help them, have permanency. And a lot of times that's in like a 20-page Word document, right? And then week to week, we're focused on other things. And we might not have done those goals that we set in that document to ultimately help this child have permanency. And so something that we're trying to do is keep the most important things top of mind so that we can see, okay, for this child, these were the risks of why they came into care. Here's the main things we're trying to do, and here were the goals we set, and how are we doing on those goals? So not just how are we doing on the court report that's due or this paper that's due, but how are we doing on the main goals for this child? So that's kind of a direction we're trying to move. Sorry, that was a little bit of a tangent to what you.
Yeah,
okay.
That was very helpful.
Okay, cool.
Yeah, thank you so much. Thank you, Mr.
Thank you so
Chairman.
much.
Felicia, thank you very much for that presentation. I do not see any further questions from the committee. We do have a follow-up from Revisor's Office, Jesse Pringle, on my question about the RFP process. Jesse?
Thank you, Mr. Chairman. Yes, Mr. Chairman, Committee, Binti, if the state agency of DCF were to contract for that service, then they would go through the RFP process generally, and any bids that are to be costing over $50,000 would be in a sealed bid, and that would not be public information until revealed. So that's just a little more information on how that process goes for the committee and that information. So,
Thank you. And
thank
so that
you.
means we probably should not give a rough estimate.
Not to the committee at the time.
Okay, thank you.
Thank you.
All right, Felicia, thank you very much.
Thank you so much for having me.
Committee, I did touch on this a little bit earlier, but I do want to redirect your attention to written-only testimony from Deputy Secretary for Children and Families Tanya Keys and Ed Klump. It has to do with the data transmission for child welfare information between law enforcement and DCF. Please read through those because that was one of the recommendations that we had. I think it was number 1 on our list. So look at that and see if we need to do a follow-up, if anybody has any desire to do a follow-up recommendation on cleaning up any state statutes or anything. So again, that should be in your folder. Next, we will move on to our next item, presentation on entry into foster care, Senate Bill 77 update by Tanya Keys, Deputy Secretary for Children and Families. Tanya, welcome to the committee.
Thank you. Good morning, Chair Hildebrand, Vice Chair Kincannon, and Ranking Minority Member Faust Godot. Thanks so much for the opportunity to present on removal reasons when children are separated from their families into foster care, and I will provide at the end an update on Senate Bill 77. I would also offer that I'm happy to provide a very brief update on the current CWIS project if the committee wishes as well. I can begin with removal reasons. Again, thanks for the opportunity. I've got a little bit of information in the testimony about the statutory framework. So within the Child and Needed Care Code, there are already definitions set forth in 2202 regarding reasons for removal, for example, physical abuse, emotional abuse. So that's the foundation for the definitions. The procedures that law enforcement or a court service officer, court or judge might take to remove a child into either protective or temporary custody of the secretary are also set forth in the Child Needed Care Code. So that's a little bit of foundational background. Our procedures, as you've been hearing about in the previous hearing days, we have a set of, DCF has a set of activities that we engage when we are assigned a report to investigate or assess a family. We can offer prevention services. For example, you've heard about family preservation, you've heard about Family First, prevention services, other community-based services. That's part of our work. And also you heard about our practice model where if there's a worry that a child can't safely stay with their family, we have what's called a team decision-making meeting alongside the family and their network and other folks who know and have been working alongside the family to help make that safest decision for the child. We know that sometimes the safest decision for a child is to enter foster care, and that's when a child is placed in either protective custody or temporary custody of the secretary, again by law enforcement, court services officer, or a judge. And that gets us to the removal reasons. Last year, just over 3,000 children entered foster care. The number of children who have the need to enter foster care has slowly reduced the past couple of years. We've learned a lot about effective prevention services and some evidence-based services that are really helping that. I wanted to give a little bit of background. On page 5, you're going to see a number of reasons why, sort of categories that we define a child can enter into care. I mentioned that the Child Needed Care Code has those definitions for us, but in addition to that, federal reporting for foster care requires us to report up to 15 reasons why a child may enter care. So a child may enter care for more than one reason, and we do have an opportunity to choose more than one reason. So that's why on page 5 you see a lot of different categories that we're able to help understand about the family, about why a child entered care. The reports that we're going to talk about today, or the characteristics, are really about the primary removal reason. I mentioned that we have an opportunity to enter 15 reasons. The majority of children in Kansas who enter care for 3 or fewer reasons. And we're going to report today on the primary reason. And we have policy instructions where a practitioner alongside a family will look at either the law enforcement report or the application for petition and decide in that description the child really entered care for the primary reason of physical abuse. And so they'll record that as the primary reason, and that's the sort of the construct of what you'll see today. Again, 3,000 children were moved into care, and you'll see all of that on page 5. Wanted to give a few highlights on the reasons for removal. For example, we know that 3/4 of children entering care last year entered for a reason of abuse or neglect. So for example, physical abuse, physical neglect, lack of supervision. Categorically, those are reasons related to abuse, neglect. But there's also about 1/4 of children of those 3,000 entered care for a reason that a family was in need of assessment, meaning there were no allegations of abuse or neglect. There was a circumstances that that family needed assistance. So 75% abuse, neglect, about 24% non-abuse, neglect. The most frequent reason for removal in Kansas is related to neglect. So for example, physical neglect, lack of supervision, medical neglect, all of those are types of neglect. So that's our greatest reason in Kansas. There's another 9% that are entering care because of a caregiver's inability to cope. Maybe they don't have the resources to feel like they're able to safely provide for their child. Page 5 lists all the reasons, and I'm going to continue to dive into a few highlights, but I wanted to make sure folks understand Table 2 on page 5. So, for example, starting on the left, it gives the larger category, abuse or neglect. And for specifically the primary reason of abandonment, last year of those 3,000 children, 150 had abandonment as the reason for entering care. That's about 5% of all the children who entered care. And that's how you can read this table. I think sometimes all of these reasons, we're grateful that we have an opportunity to enter up to 15 and record the story up to 15 reasons for removal. But sometimes it can be really helpful to focus in on what are maybe those top 5, top 6 reasons for removal so we can learn from that and understand prevention opportunities as well. So on page 6, I went ahead and categorized the top 6 reasons for entry into care for children last year. And those are listed on table 3. So they range from, a caretaker's inability to cope down to physical neglect. Those are the top 6 reasons. And I wanted to talk a little bit about age and give you some highlights by region. Again, these are the most frequent reasons for removal. What's interesting about age is over 1/3 of children who are separated from their families, they're age 4 or younger. So that's the largest majority of an age group. Or is that early childhood age, 0 to 4? Over 40% of children who are removed specifically for lack of supervision are under age 4. So there's a lot going on with that early childhood age. On the other hand, more than half of the children specifically removed for the child behavior problem as a reason are age 15 or older. So there are some pieces in those contributing factors or reasons for removal that impact different age sets in a different way. In terms of regional pieces, which is also kind of interesting. There's not a lot of difference across the regions in terms of the percentage of children removed for physical abuse or physical neglect. Again, not a lot of difference. The Southeast region does have the greatest percentage of children removed for reason of lack of supervision. They're at 29% compared to statewide, it's 20%. So a little bit of difference there with Southeast. And the Kansas City region has the greatest percentage of children removed for caregiver inability to cope. Again, just a little bit higher than the statewide average. And some of that detail is also on page 7. Moving to page 8, you've just got some sort of more charts and tables. I sometimes am interested in the child behavior problem. We know we have a lot of resources, especially in the Family First, mental health evidence-based programs around child behavior problems. So kind of was looking at that as a reason for removal. The Northwest and Kansas City both had more than 30 children and youth removed specifically for that region. It just happens to be a few more males than females. But that's interesting and something we would want to keep an eye on to know about prevention opportunities and really supporting families so they feel like they can meet the needs of their children. In terms of some basic demographics then, the bottom of page 8 and a couple tables on page 9, we know, and you heard earlier today and from other presenters, that Black children are overrepresented in the number of children removed. Last year and for the past several years. And in state fiscal year, 13% of children removed into foster care did report a Spanish heritage ethnicity of Mexican. So that's just a little bit of information on race and ethnicity. Finally, around this piece around reason for removal, we did want to make the committee aware that at the federal level, the Child Abuse Prevention Treatment Act, also sometimes referred to as CAPTA, it's kind of an overarching federal governance around child abuse and neglect information, definitions, and procedures for states. We understand there's emerging or proposed amendments and a reauthorization to CAPTA. We bring this up to the committee to know that if that proposed legislation would go through, there might be some implications for states to consider, perhaps the Judicial Council or this committee, to look at the impact to the Child Needed Care Code or any of our policies and procedures around making sure that we have pieces in place. For example, one of the things proposed is that states would actively prevent unnecessary investigations in the state. So, for example, by setting up warm referral lines like 1-800-CHILDREN or other opportunities to connect families to services and supports to prevent unnecessary investigations. So we just wanted to make the committee aware of that. Thank you for the opportunity to present information on removal reasons. I do have an update on Senate Bill 77. I'll pause, Chair, for a second to see if there's questions before I move on to that.
Tanya, thank you. Senator Foscato.
Thank you, Mr. Chairman. Thank you, Tanya. Thank you for the presentation. So when we first I wanted to say thank you. I really appreciate the fact, Mr. Chairman, that we are now finally publicly saying that Black children do have it a little more tough within the system. Mr. Chairman, I was starting to think that I was losing it because I've been saying this since 2007 when I introduced the Grandparents as Caregivers Act and the passage of that legislation. And over the years, it's been amended to try and make that better. So I was about to give up, but now we're here, so I appreciate that. In your presentation on page 5, so kind of setting the scenario here of, so DC, so a call might be made from school of a child's condition from a neighbor, or maybe there's even a domestic violence call, and the police show up on the scene, and then the police decide to remove that child from that home at that particular time. Once you, after that 72 hours, depending on where the police take the child, whether it's to the children's home or another relative's home, and then sometimes there's that 72-hour time frame where a decision is kind of being made whether or not to put the child back with the biological parent. And why not, so when we go to inadequate housing, and when we go to medical neglect, some of the softer pieces, I would say, as opposed to sexual abuse or battery or some reasons of that nature, what percent? Why not help the whole family at that point? And also, on the next page, I think you referenced that you listed your top 3 or 5 reasons. And so when we talk about behavioral issues, so going back to my question, but making this kind of point here, over the years when I hear individuals say that they're just taking our children and it's for money and so forth and so on, I've often wondered, what stage in that process do we try to help the entire family? So if we're talking about the family doesn't have resources for food or medical or inadequate housing, it used to be saying children were removed because they were poor. I'm just want to know exactly what we are doing now here in 2021 when those softer complaints are made. Maybe the school teacher says little Johnny is coming to school in the same pair of jeans for 3 days or what have you. So what exactly is that process and time frame before that final decision of removal is made in the courtroom? Is that in that 72 hours or where, I just, that's family preservation, keeping children together. Thank you, Mr. Chairman. And I know Tanya can already read my mind, so thank you for the response.
Sure. Thank you. And in the scenario you provided, it may involve 72 hours and a law enforcement protective custody. As soon as we become aware, DCF becomes aware and are assigned a report for a family, we should immediately be assessing resources, what's going well with a family, who is in their network or in their community that can help them. So that can start the minute that we meet the family. We've mentioned we do have family preservation. We have family first programs. We also have resource navigators at DCF that if there are resource needs, concrete needs, maybe inadequate housing, maybe economic insecurities, we can, within our team, try to provide remedy, short-term or mid-term supports to be able to reduce or remediate any emergency assistance needs they have. So that can start right away. But you're correct, in a protective custody situation in this scenario described, we would also have 72 hours, and the court service officers and judges or assistant county district attorneys know that we have processes such as team decision making, and we have partners such as Care Portal who help us identify and connect to, there are connector ministries to connect the family maybe to a church locally who can help them. So we would use that first 72 hours to be able to present information to the court that when a family is in need of assessment or in need of services, that we can prevent the need for foster care, we would present all of that information to court. So in law enforcement situations, yes, we might just have 72 hours. But in families that were assigned, either for assessment or investigation, that type of assessment should begin when we're meeting the family.
Representative Esau.
Thank you, Mr. Chairman, and thank you, Senator, for asking those questions because you asked most of mine, which really did help. I was noticing that the biggest one is lack of supervision. That's the biggest reason. And you covered most of what my concerns might have been. Are we doing things to help the families so that perhaps the reason for lack of supervision is something that can be solved versus taking the child out of the home? Do we have anything that is not subjective? Because, you know, what I think is lack of supervision might not match what my neighbor thinks. And it could also be cultural as well. And that might cross all kinds of lines there. So I'm just wondering, is it a subjective thing, or is there something more concrete in how we determine what is lack of supervision?
Well, we do have some guidelines around lack of supervision, but there's critical thinking also with that. A lot of those guidelines have to do with age and protective capacities of a child, a 3-year-old compared to a 13-year-old. So some of those are around age, developmental milestones of a child. So yes, we do have guides for that. We want to make sure we're really talking to the family and the family's network, especially if the situation is a child care situation. How can we wrap supports around the family for child care? So yes, we do have guidelines, but there is also a process to really consider the factors of child's age, developmental, other resources that the family has, and the circumstances, the duration of lack of supervision. Lack of supervision is also sort of a situation where it could be a broad scenario, lots of different types of times when that could happen alongside a family. So we need to really dig in and learn more about how that circumstance came about for that family.
A minor follow-up, maybe if, and I don't know, I'm not trying to create a paperwork nightmare, but maybe if we kind of had categories of, you know, this is a kind of supervision, like you say, with lack of childcare or something, or a family that has no concept that 3-year-olds really need to be supervised or they can get into mischief pretty quick. And maybe that would help us a little bit to know if it's true neglect or simply an educational kind of thing.
Yes. Yeah, to be able to differentiate those pieces. Agree.
Representative Ousley.
Thank you, Mr. Chair, and thank you, Ms. Keys, for being here. Along those same lines of questions, you've got lack of supervision and physical neglect, age 0 to 4, both above 40% as a reason for removal. And physical neglect is not abandonment, but what's the difference between lack of supervision and physical neglect?
In our statutes, they each have different definitions. So physical neglect may have to do with a failure or inability of a parent to provide clothing, food, shelter. So the physical neglect category definition is broader. Lack of supervision is very specific to a child was not supervised so that they were safe. Based on their age. So physical neglect includes food, shelter, clothing, and supervision.
Thank you for that. And I think you just answered my other question, and I should know this, but these terms are all statutorily defined?
No. All the terms on page 5 are not included in the Child in Need of Care Code. Many of them are in 2202D, I believe. Some examples of, one example that is not specifically defined in the SINC code is child's behavior problem. That's a federal category code that we use for foster care and adoption reporting called AFGARs. So again, it's a way to let us capture a scenario, but the Child in Need of Care Code doesn't use the specific term of child behavior problem. That's a federal term. It is interpreted to be within our Child in Need of Care Code, but those 3 words aren't used in the SINC code. Does that make sense?
It does make sense, and thank you for that. Maybe I could chat with you more offline. go into a little bit more detail. Thank you, Mr. Chair.
Tanya, I don't see any further questions on this, but I do have a follow-up to something that you had said. One of the concerns that I always have is removing a child from a loving parent or parents solely based on poverty. And it appears from your definition that could happen currently. What leeway or what do they look at? What does a judge look at when they decide little Johnny has been to school 3 days in a row with the same pants? Now, there's all types of reasons someone could be in that situation. One is there might be a instance where the parent is spending their money on drugs or something like that. I could see that as a reason for intervening. But if it's a case of a single mom working 2 jobs to try to survive and honestly cannot afford a second pair of jeans for little Johnny, what does the judge look at and what options do they have at that point?
Yeah, thank you for that question. That's also sort of in line with what the new federal CAPTA reauthorization is trying to get at, is distinguishing that aspects of adversity or poverty or economic insecurities are not neglect. So thank you for the question. Within the Child Needed Care Code, there is language that says, uses the word harm and imminent harm. So did harm come to the child as a result of whatever gap there was or whatever need was not met? So in terms of statutory language, we're looking for, did harm occur? Is the child at imminent risk of harm? Those are sort of some anchors in terms of language. We are working to make sure that we are really connecting families to supports to provide that remedy and to distinguish between neglect, a failure to act, a refusal to act. I mean, there are some states who have, who are gaining or implementing stronger language in their statutes that would say, you know, refusal of a parent to act even when provided resources and harm came to the child. So I think there's different ways to make sure that we are really distinguishing poverty or adversity or economic insecurities from neglect. They're not the same, and we know we need to do better. We need to connect them to concrete resources, relational resources, and increase our education on being able to distinguish that.
So that brings a question on harm. That's could be a subjective term. You know, we all know kids sometimes can be cruel, so can adults. But on the playground, someone notices little Johnny has worn the same pair of pants 3 days in a row, makes fun of him. That could be defined as harm to little Johnny, but yet mom, who's working 2 jobs, doing everything she can, loves little Johnny, but just doesn't have the means to do it because of everything's going up. And she went to the grocery store, instead of spending $100, now she's spending $130, or went to fill up her gas tank so she could get to her job. Instead of paying $20, now she's paying $35. That money gets consumed. Is there levity by the judge to say, yeah, that might be harm, but we need to do something other than take this child from a loving parent?
Yes, a judge would have a discretion, or the court would have discretion when the information is presented to them, either in a law enforcement protective custody report that they have, or our petition for application, to consider those facts and circumstances and listen to the information at the temporary order of custody. Yes.
Representative Ousley.
Thank you, Mr. Chair, for the second time. I had jotted this note down when, this is off testimony here, but when the LPA was presenting earlier, you know, they said, according to the 2016 audit that some children were placed in foster care had inadequate sleeping space because DCF waived the capacity and space requirements for 98% of requesters. Do you know if that's still an average percentage of granted waivers, or do you know what we're doing today different? And I don't expect you to have that. I just wanted to put that bug in your ear.
Yeah. I do understand that we're doing things different than 2016. I don't have that percentage. However, my colleague, Scott Henricks or DECA might know. Some of the changes that were made, and some of this is related to our settlement agreement in terms of action items that we needed to implement. We are basing a set of exceptions to go over capacity for a licensed foster home. We're basing that on the child's needs now. So there's still a request process. We've implemented that request process 24/7, so we can make sure that no licensed home exceeds capacity without an exception. I don't know the percentage that are approved. We have several categories. A frequent reason for exception is the child has a sibling, and we want those siblings to be together. So we would want that family foster home to be able to go over 4. So we can get the percentage, but no, I don't know that today. We have implemented additional steps around the exception process.
I appreciate that, and I'd be curious to compare the difference. So thank you. Thank you, Mr. Chair.
And Tanya, if you wouldn't mind providing that to Militia and let her disperse that would be great for the committee members. So, Senator Gossage.
Thank you, and thank you for being here, and thank you, Mr. Chair. I was curious, who determines if a case goes to court?
When DCF is doing an assessment or investigation and we have a worry that a child can't safely remain in the home, we convene a team decision-making meeting. So the family is included, the family's network, any service providers. That team makes a recommendation on what is the safest decision for this child. That could be to go live with the relative. It could be to implement a set of services to continue to prevent custody, or that team may recommend, the safest decision today is this child needs to enter foster care. There's no alternatives. Ultimately, it is DCF's responsibility when law enforcement's not involved. It's DCF's responsibility to take that information, put it in an application for petition, and submit that to the district or county attorney, who then presents it to the judge.
So a lot has been done in the process before the child ever, or before the situation ever comes before the judge, right?
Yes, we hope we're improving. We know there are some circumstances, maybe in law enforcement protective custody or others, where we might not have as much of a chance to offer that prevention array, but we're sure trying to make sure that every family, and we're required to make sure there's a reasonable effort with every family to prevent the need for foster care.
I'm really glad to hear that. I'm just thinking back about my childhood. My mother was one of 15 children that lived in a 3-bedroom home on a farm. I was one of 5 children, and all 7 of us lived in a 2-bedroom house in Wichita. I often would wear the same slacks to school 3 times in a row. My sister and I shared the same 4 dresses that my mother made. But I can say this, they were always clean. And so I think the difference between abuse and we didn't consider ourselves in poverty. We just didn't have very much money. My dad always worked 2 or 3 jobs. My mom got her GED when I was a junior in high school, and gave us a good work ethic, a good example of what work ethic is. So I'm pleased to hear that they don't just take poverty as like, well, he wore the same pants 3 times, but are they dirty? Does the child appear to be neglected? That kind of thing, and imminent harm, as you mentioned. And maybe the parents don't even realize that they can go to Salvation Army and get free clothing, for their family. That wasn't that available when I was a kid.
Yeah.
But I'm just a comment that I'm pleased to hear that. And maybe I'm jumping ahead, but in this statement about the pilot program in Wichita, are you going to address that, or did I miss it? Talking about the services and how the intervention of looking at community services, et cetera.
The pilot project in Wichita, oh, I believe that was in my written testimony around the law enforcement.
Yes.
Yeah, could ask the chair. I'm happy to answer that question. I'll wait for the chair to see it. But while we're waiting for that, just a comment. We're also, DCF, Kansas Department of Education, KCSL, and KDHE are part of a Thriving Families Safer Children national project that we're working on with the National Governors Association and Annie E. Casey Foundation to really think about how we can also work with those who are mandated reporters so they can also understand how to connect families to supports, for example, using the warm line, 1-800-CHILDREN. So if they, as an educator perhaps, have a worry about a family and they really just want to connect them to a support that's in their community, and rather than call the Kansas Protection Report Center when their worry is not about abuse, we are trying to promote 1-800-CHILDREN and really get education out there so that sort of changing from mandated reporters to mandated supporters. And that's a national project that we're pleased to be a part of. And Chair, there was a question on a written testimony that's not a part of this. Are you okay with me answering that? Okay.
I was just curious about, it said it was started in August of 2020. The agency found a new pilot collaboration with the Wichita Police Department. I was just wondering, this has been a year. How's it going?
We have two pilots with them. One is their community support specialists, and I think that Sheriff Easter also reports that it's going really positive. There are two positions with the Wichita Police Department, one with the Sheriff's Office, and the idea is really, we had a conversation with them now maybe a couple of years ago that sometimes they have patrol officers or others who are out with a family and they may notice a need. They may not be, it may not rise to the level of a report of abuse or neglect, but they just see, you know, maybe this family has some needs and how can we help them? So what we offered the pilot to do was a DCF through Federal Child Abuse Prevention Treatment Act funds is funding two positions who are the community support specialists. Their idea is they can connect the family to safe sleep supports, community pantries, other just common supports that they might need. They really just try and make sure the family gets what they need. The idea is to prevent the need for further law enforcement involvement or prevent the need for a report to the Protection Report Center, and that's going really well. And the other pilot is we've given them access to our KIP system, which is our system of intakes. So they're I think there's a couple of people in their dispatch and a couple of folks in their records department. They can get into our system and see, for example, a history of reports that DCF would have on a family. So those are the two pilots that we have with Wichita law enforcement right now.
Thank you so much, and thank you, Mr. Chair.
Tanya, thank you very much. And if you want to go ahead and continue with your next portion of your testimony.
Great, thank you. I don't know if you recall, but there were questions last time about implementation of Senate Bill 77, which became a 38-2290, which was the child with sexual behavior problems, specifically referral to mental health providers. That piece that DCF was to do. After the law went into effect, DCF developed policy. We also developed a referral form, which I hope is a part of your packet. It would be the last page to demonstrate the example of the form that we use. The idea is to, after we get the report, we immediately make that referral to a child advocacy center or a mental health provider. And the idea is around prevention. How can we get supports for this family? What we know, and we really appreciate child advocacy centers and their expertise, this sort of emerging knowledge set of families who have these needs. What we know is that since this has been implemented, there have been over 1,400 reports that DCF has received. That represents about 2% of all the reports we've had over the past 2 years, to just give you a context. Of those 1,400, about 202 were substantiated. So we know, and we also know that at the time that we had those 1,400 reports, 260 of those families were already receiving mental health services at the time we received the report. In addition to that, we know from our data that 130 additional referrals were made. We haven't done a quality case review on this to validate that every report that we assigned for this child sexual problem behavior received a referral to a child advocacy center. We want to start and do that case review in November, but we have not done a qualitative review yet of that new policy. And thank you. That's the information that I have on that update.
Tanya, thank you very much. I do not see any questions from any members on the committee on that, so thank you very much for your presentation and the overview of everything that we've had. Good information. So Tanya, thank you very. I do see maybe not a question. No, okay. So Tanya, thank you very much.
Thank you.
Representative Ousley.
Mr. Chair, if it would be appropriate, in the written testimony, both from Tanya Keys and Ed Klump, they request the committee give them access to a revisor. And so if it was appropriate to go ahead and discuss that now, I see we got a few minutes before lunch.
I think that's doable, or do we need to wait until we do recommendations? I don't know that that would be a recommendation. That would be a request, mainly for a revisor to work with them. So I believe we could go ahead and do that, since it would be a request, not a recommendation. So if without objection from any members of the committee, we will request that the revisor's office work with representatives from DCF and Ed Klump on drafting that statute. And Representative Kincannon, you have a question online?
Yes, good morning. Can you hear me?
We can, thank you.
Good morning. I'm thankful for the opportunity to be able to attend the meeting while taking care of my grandsons in Omaha this week. So thank you to the technology that we have now. My question was kind of along the same lines as Representative Ousley's. Not just requesting them to work with the revisor. I'm just wondering what, I would like to ask them what sort of changes need to be made in the statute. Do we have anybody there that can answer that?
Yeah, Representative Kincannon, I think just in generality, the language, just to make sure, to clean up the language so that it's not misinterpreted that law enforcement cannot be shared that information via DCF. Tanya, if you wouldn't mind correcting me or adding to what I had to say, that would be great.
Thank you so much. You know, certainly we ask for assistance because we need help with the expertise, and we wouldn't want to get out ahead of any other expertise. But some initial discussion that we've had is that perhaps what we understand is information sharing is in 3 to 4 different parts in the Child Needed Care Code. It's not neatly in one paragraph. One idea is, for clarity, bring all that information clearly into a separate section or its own section that delineates what DCF and law enforcement can freely exchange, rather than having it be in different pockets. Those are initial thoughts. There may be an easier way, but that was the initial brainstorm, was have clarity by having it all in one place.
Okay. Yep. Thank you, Mr. Chair.
Senator Poscato.
Hello, Representative. Thank you, Mr. Chairman. So, Tanya, so you just described the pilot program there in Wichita, Kansas, of police and DCF and how they're sharing information. Couldn't it just be that simple?
It can be that simple for technical solutions for information systems. At times, as I understand it, there could be information in our case records that might be of a paper version or might not be in the system yet that would be able to be viewed by law enforcement. So I believe the free exchange of information would need to be a bit more broad than just system access. But yes, system access is part of the technical solution.
In committee, I think probably the bigger concern would be continuity of that not changing and sharing of that data with law enforcement is why. Because you have different administrations and different legal opinions looking at it and coming up with different interpretations of so many different places. So that is what the need is. I am going to take it that nobody had any objections to that. Okay, so without objection, then we will make that request. So thank you. Committee, that does wrap up our morning testimony and our morning agenda. We will now break for lunch, and we will be back here at 1 o'clock sharp. Thank you. Welcome back from lunch, everyone. By my clock, it is 1 o'clock sharp. So we will continue on to the afternoon session of our agenda. First up, we are going to have presentations on the foster care system from individuals, providers, and organizations. And our first conferee is Randy Pewitt, who is a parent. Randy, are you with us? Randy, come on up to the podium here. Good. Randy, is this your first time testifying before a committee?
I've done it before, kind of, yeah.
Okay. Just to give you a little bit of a groundwork of our idea what we do have your presentation, so you don't have to read it. We would prefer you not to read it.
No.
Just give us a highlight and give us some
I'll give you
important parts and state your name and where you're from. And
I'm Randy Pewitt from Topeka, Kansas. Nerves are a little high, guys, so bear with me. I know. This bill needs to be in place because we'll all agree the system's broke. The system that we have as a DCF, CPS, any of it, is seriously broke. They removed, I was told when I was going to court over a daughter that was being unruly, you can read that real quick, that she was coming home. When I get there, she's freaking out in the hallway. They decide not. Her statements were, when she stayed with KVC, she stayed in their office all day long. She was moved at nights to sleep at homes where there was multiple bunk beds. The shower services weren't the greatest because there were so many kids in one home. She decided she was being bullied, so she jumped out of a second-story window and ran away from them. I wasn't notified for over a week that they lost my child. Their communication skills, trust me, are terrible. I've been investigated multiple times. They should learn, when a parent's been investigated, to kind of back off and leave them alone. But this time they stepped on me. When you lose a child, I still was the parent. Nobody notified me. I had to find out on my own from somebody in North Topeka that seen my kid. I got her back. She's doing good. She has a job. This bill needs to be in place and set for the families. When you go to family court, you have a lawyer for your child, they give her or him, they have their attorneys, they have their caseworkers, they have the judge and the DA or whoever's sitting in doing their part. You sit there with nobody the first time around. They appoint you an attorney that really don't help you out and don't care because they're appointed. It has to change. There's so many families out there that are being destroyed. I started a website and it went insane. Kansas Kids Matters. You all can check it out. It's open to the public. About parents and their complaints. Some of them are questioning if this committee gets put in place, will they be allowed, if they lost their children, to bring their complaint up and have it investigated because they still haven't got their child because they done adopted them out. There's a lot of going over this that needs to go through and change. I'm just floored at how much I hear of appalling stories. Here's one in Topeka. KVC just lost a girl, just like mine, run away. Now she was in a car wreck because she stole the car. Why did she run from KVC? Why did she run from DCF? If it's supposed to be to help our children, it don't seem like it's working. And I speak from the heart, guys. I'm sorry, I don't write nothing down. I'm going straight from, there's so many complaints of it's not in neglect. Is that considered abuse? Isn't physical abuse abuse when you take a child because a parent can't survive or pay their bills or their water got shut off or their sewer ain't working? A couple in Goodland, Kansas right now, their sewer didn't work. Lost their kids because they were using the neighbor's bathroom. They got turned in. There's so much wrong that needs to be righted. And it's the kids and families of Kansas that we're destroying and over the world. They made $40 billion between every state in the United States last year. Why can't we get this right and correct it for parents to be a good parent, an active parent? Get the process is drug way too long. It traumatizes the children. I'm going to give you a real quick example, and I won't say much more. An 18-year-old boy at KVC office, parents called me, turned 18 that day, was tired of the system, was tired of the abuse. I went up there and walked him out. The young man has a job, and he's thriving, and they kept telling me, I can't do this. The young man's 18. He's done with you. Oh, there's procedures. No. He should have been allowed to just leave on his own with his parents, but they ended up calling me. PD did not arrest me, but I sure got a big verbal from KVC. Well, it's just a lot that needs to change in our foster system. If you go to the sites, there's CPS, Stop the Abuse. If you go to that site, Connie's an attorney, there's thousands of complaints of wrongful doing. And the turnover at DCF, I was investigated on a Friday. The next Monday, the kid that was with the girl done quit his job, was only there 2 days. The turnover rate for employees is insane. So there's got to be a lot done for these children and families. This is a step into it, but why is it taking so long on a broken system? These are our kids, our future. They're lost, they're raped, they run away. I mean, we got to start thinking about the children and the families and put their needs in there. I thought it was supposed to be help them get back on their feet, not take their kids, adopt them out. Isn't that what we started this to be? Help a child, help a family. Instead, it's, oh, they can't get it right, we're going to adopt them out. And it happens pretty quick and very frequently. That's really much, I'm like I said, there's a lot I'd like to say. It's just crazy. If you get into the websites and you start digging in, we averaged it out to about 27,000 families right now in the United States trying to win their kids back. But like Kansas, we had $1.8 billion from feds, from state, everybody else. With that kind of money, why are we doing this adoption thing so quick? Why aren't we setting these people up to succeed instead of fail as a family? There's a lot of things that has to happen to get this changed. And I thank you guys for hearing me. It's really sad, but the court thing's the worst. We need this to be able to make a complaint, and it has to be a separate company. I don't want them involved. You got somebody involved in-house, guess what? It's not going to work. It's got to be a separate entity. It really does.
Randy, thank you for your testimony. Normally, we would hold questions for all conferees, but you keep referring to a bill.
Via 5 by Bill Clinton, it puts money in their pockets for every child they adopt.
No, I apologize. You keep referring to, I'm glad this bill is in place.
Well, I'm not sure about a bill. Your guys are working on a bill for it or something. I'm just here to testify in the committee, sorry.
Okay, all right. I just want to make sure I understood.
Of what experience I've had through the fall. I mean, it's sad when you get a phone call after a week going, oh, we lost your daughter. She ran away. Why? She jumped out of a 2-story window to run away. Something's not right with the system, is it? When you have a 15-year-old daughter that, you know, she was being unruly for me. That's how we got involved. But they ain't no better than I was. Why'd they take her? They wouldn't give her back.
Bill, thank you. And committee, we will, I think you are the only one here.
I'm the only one personal.
In or not testifying virtually. You're the only one present. So we'll go ahead and open up for questions. Representative Esau.
Thank you, Mr. Chair, and thank you for coming and testifying. I recall you testifying in committee as well in the last, I don't remember if it was last year or the year before, but I recall you coming.
It was last year.
Yeah. If I'm understanding correctly and remembering correctly, you believe that the Office of Child Advocate would be a good thing to give us a place where people could go to
It would
bring
give
their
a
concerns?
parent or a child somewhere to make a complaint so they could do an investigation to make sure the companies are following guidelines and laws. According to the guideline I read on book, when they lost my child, I was supposed to be notified in 24 hours, not 9 days. I mean, there's a lot, you know, it's just a really broken system. and it needs somebody to survive. And I mean, there's kids that need our help, I agree. But there's also parents that are getting raped of their children and just yanked out of their arms for silly stuff.
Senator Baumgartner.
Thank you very much, Mr. Chair. Thank you for being here today.
No problem.
It indicates in your letter that you have 6 children, but how is your daughter doing that was in foster care?
She was only there 2 weeks. She was there 3 days before she ran. Now she has a job at KFC. She's got her own apartment set up. She's finishing school. So actually, she's doing very well. We were having a problem with, when the minute they give them computers at school, I had a problem with a 22-year-old gentleman messing with my 15-year-old daughter, but now he's facing 20. I made sure of that.
Thank you very much. Thank you, Mr. Chair.
Senator Foscato.
Thank you, Mr. Chairman, sir. Thank you for coming and sharing. Something you said reminded me of years ago when individuals would call me or email me and say, DCF has taken our children. And then, so nowadays I'm trying to, put everybody in the group together. So the police first, DCF, in the courts and so forth. But one thing has been consistent for years is that of what you said about, so the young mother has a child, she's on drugs, the child is put in a foster home, then the uneducated young low-income mother has to do all these things to get the child back. So now it's a newborn because it went in after she had the child, and then so now we're approaching that 12-month period where we need to do permanent placement, and then so she can't get all that stuff done, and so then they go to court, and then the child is put up for adoption. Because we say what's in the best interest of the child, and the child doesn't know the biological mother, because the child's been with the foster family the entire time, and so we want children to be with people they know, and so when people call me and they say, oh, they're kidnapping our children and giving them up for adoption, it's something, I'm not sure what it is, and I'm not saying that this is the case, but it's something going on where we just run out of time with helping that struggling mother, and then the same entity that was part of the child going into foster care is the same entity, or anyone can correct me because I don't know for real, Mr. Chairman, that same entity then is the one that takes the child and helps put the child up for adoption. And then, what happens with that single mom who loved her child and just, was struggling financially, just poor, period. Or maybe she was on drugs, or maybe whatever the case was, if there was no rape or bodily harm done, just and no major abuse of neglect other than being on drugs. I just hear these stories. I'm serious, Mr. Chairman, and this is the final point I'll make to this gentleman, is that I live in Wichita, and a grandmother called me, and she called me from, she saw me at a Wichita State basketball game on the other side of the arena, and she said to me, she says, Senator, I'm sitting right behind the family that has my granddaughter, and I can't see her or touch her. And it was just ironic. She got tickets right, and they had adopted her grandchild, and she had been struggling financially without transportation to do all those 11 things that were mentioned earlier. And so anyway, I thought it was just me, but thank you for sharing that. And then you mentioned a website. What was that, sir?
You can go to Kansas Kids Matter. I started it. We're up to 290 members. or you can go to Stop CPS from Taking Our Children. That site has over 10,000. That is Connie, I can't remember her name. She's an attorney. She's in Washington. But these sites, if you want it, you don't have to say anything. You just go in and read and listen and watch the parents. You can feel the pain.
And thank you, sir. And Mr. Chairman, if, and I don't know, there's others in the room, if that process, I'm just curious, because I've been hearing this for years and I've not gotten a concrete answer of where's the stage when the child is placed for adoption. Thank you, Mr. Chairman.
Representative Carlson.
Thank you, Mr. Chair. My question is, in some of the past testimony we've had, I believe it was stated that when a child runs, most of the time they will go to a family member or a close friend of the family. So you didn't know that your daughter was gone for 9 days. Do you know where she went for those 9 days?
She went right back to the 22-year-old pedophile I'm putting in prison that met her online.
All right. Thank you very much.
Sure.
Thank you, Mr. Chair.
Okay, I do not see any further questions from any committee members. Randy, thank you very much for your testimony.
Thanks, guys.
For being with us. Committee, next we have Raymond, and I apologize if I mispronounce your last name, Seipold. And he is a parent and he is testifying virtually via WebEx. Raymond, welcome to the committee. Raymond, are you with us?
Hello?
Raymond, we can hear you now. Thank you.
All right, sorry about that. Yes, I do have a speech written if I might be able to read it now, sir.
Raymond, we do have your testimony, and we've all read it, so you don't have to read it. If you just want to go over the highlights of that, that'd be perfect.
Okay, well, first off, I'd have to say that the foster care system is broken. When a child enters the system, the parents are basically sold into a false sense of hope of being reunited with their children, when the financial incentive to adopt the children through the foster families is held at a higher value. And what I mean by that is just basically simple, is that the social workers practice an act called psychosemia, and it's when social workers sit in a room and conspire to lie in order to deprive parents of their children. Now, you're probably thinking, well, that's not right. Who watches them? Well, the problem is they're allowed to investigate themselves. So whenever you file a complaint and you go all the way up the chain of the command to the supervisor and everybody else, they're just trying to figure out how to cover up their lies. And they basically managed to do that with my children for over a period of 25 months. I mean, I still have an active sync case, and one of my children's been returned to me, but his sister was adopted through the Kansas foster care system over lies, deceit, and unsubstantiated claims of why they would have entered the foster care system to begin with. And I just don't think that's fair. And I think that it's happening to a lot of people, and people need to know that it's not okay. That's kind of where I stand on that, in all honesty. And I know who the individuals responsible for kidnapping my children were. Their names are Candace Johnson, Executive Director of Reintegration, Melissa Cooley, Caseworker Supervisor, Brianna Sutherland, Reintegration Foster Care Worker, and visitation workers also. Even though they're not social workers, they take their reports with a grain of salt as if they're treated as such. Deanna Atkinson's, Michaela Ray, and a family support worker named Chave Adams conspired to take my children away from me through the courts by utilizing agencies such as Casa, KFAM, the Guardian Ad Litem program, the Public Defender's Office, the court reporter, the court clerk, the juvenile prosecuting attorneys, and even the judges in my case. Records were withheld, testimony was withheld. You can't fight a case if you don't know what you're going in against. I don't feel like I have any rights or my life matters to them. And I think a lot of parents feel the same way. And you're probably going to be hearing stories like this for years, but I'm not scared. I'm here to address you today.
Raymond, thank you for your testimony and your written testimony. Committee, do we have any questions for Raymond since he's on virtually? Senator Foscato.
Thank you, Mr. Chairman. Raymond, I was hoping to actually get a visual of you. I think you've called me. This is Senator Foscato. I think you've called me several times, and I know that you've reached out to Representative Henry Helgerson as well. And through our phone conversations, I didn't get an understanding just at this point. You said you still have an open sink case. So of your children, how many have been reunited with you? And at this point, thank you, Mr. Chairman.
One, my son was given back to me after I had voiced concern of trying to get a building in Kansas. And they gave me my son back on July 31st of this year, but they adopted my daughter out on March 5th, I believe. And it's just not been good, but I'm glad you've listened. My children have autism. They can't speak, so I have to be a voice for them, ma'am.
Thank you for sharing your story, Raymond. Thank you so much.
Senator Baumgardner.
Thank you, Mr. Chair. I'm just asking that at some point someone can answer how, if there are two children in the household, one is returned to parents and the other would be adopted out. That seems overwhelmingly inconsistent. It would be safe to reunite one child, but it would be appropriate to adopt out another child from the same family. So I'm not questioning the testimony. What I'm wondering is how that is possible within our foster care system that such a situation would occur. Thank you, Mr. Chair.
And I know we do have some testimony coming back up from DCF, so maybe they can enlighten us on that as well. That's a very good point. Raymond, I do not see any further questions for you. Thank you very much for your testimony and allowing us the opportunity to hear what you had to say. Committee, our next conferee is Kelly Patton, private investigator and parent ally for Raymond Seipolt. And Kelly is with us virtually. Kelly?
Hi, I'm sorry. I got laryngitis. So I'm just going to stick to my script and you can read it and follow along. If you can't understand me or hear me, I'm really sorry. My name is Kelly. I'm a private investigator licensed in Kansas, and I've had the pleasure to meet Raymond Seipolt and be his parent ally and help him through his navigation through the DCF Sync foster care system with his children with autism. I've been doing this since 2015, since the missing Vincent Moore case. He does have a website called Help Us Find Baby Vincent. The Moore family has not seen Vincent since July of 2015. I began educating myself within the past year on topics of the welfare of children presented by the Kansas Department of Children and Families Child Protective Services, and I've accumulated over 100 continuing education hours in 1 year that covers multiple topics and subjects within the foster care system. With the education that I've acquired, I've obtained on the process of the Kansas foster care system and my appearances and my documentation of the child in need of care hearings. I'm here to report based on my collection of evidence. We are failing the preservation of families and children. I've established a pattern and practice of violations of the Adoption and Safe Families Act of 1997, Kansas State Codes for Care of Children, and constitutional rights of families and children. The continued violation of the entitlement of the due process establishes a pattern of a violation of KSA 21-5426, intentionally benefiting financially or receiving anything of value for participating in a venture that the person has reasonable knowledge to know that has engaged in acts set forth in subsection A1. Agencies receiving grants from Department of Children and Families make referrals for community services as support services for the families and children. It has been unfounded or unknown if these agencies are colluding with bribes or incentives for false accusations and testimonies that leave the parents in a perpetual cycle of never quite completing all those goals that keep constantly being modified to keep the case in an active status. Thank you.
Kelly, thank you very much for providing your testimony. Committee, do we have any questions for Kelly? Representative Humphreys.
Thank you, Mr. Chairman. Thank you, Kelly. I'm sorry to ask a question when I know it's hard for you to speak, but I want to make sure I understand what you're saying. You're saying that who is benefiting financially from, and who's in violation of that statute, are you saying? Trying to understand.
That's what I'm saying. It needs to be further investigated. The state of Nebraska right now is actually, the IG's office is actually in an active investigation right now. I corresponded with them a little bit back and forth, but Nebraska is actually doing an investigation at this time.
With a particular contractor or just their system in general?
Maybe it may broaden, but I believe it's with St. Francis Ministries, which is St. Francis Ministries of Kansas as well. So, with the findings there, it may broaden.
Okay. All right. Thank you, Kelly. Thank you, Mr. Chairman.
Thank you.
Kelly, I do not see any further questions from any members of the committee. So thank you again for your testimony. Committee, next we have Mary Dean, President of the Kansas Justice Advocate. And Mary is with us virtually. Mary, welcome to the committee.
Thank you, Chairman. Can you hear me?
Yes, we can.
Okay, great, because my volume on this side is kind of low. I want to thank you, Chairman, and Ranking Chairman Member Senator Letha Fausto for giving me this opportunity to testify to this Child Welfare Oversight Committee, which I believe is long overdue. I've submitted numerous documents to the committee to review based on my concerns over the years about what's happening to children in the system. I have been part of a committee that was formed by former Governor Kathleen Sebelius, where 6 counties submitted recommendations to her about implementing recommendations when it came to African American children who were in the system longer and reintegrated back into their with their parents later, not soon enough. This has been an ongoing issue for a very long time. And I get phone calls on a daily, not a daily, but regularly from parents and grandparents about issues, and especially when it comes to having their children taken away from them because of their situations. Our Black cultures are different than a lot of cultures, and that's something that it would appear that some social workers are not willing to understand. They don't care. Uh, I just got a phone call from a grandparent last week who has had his children for grandchildren for at least 3 years. Now, this is on top of the fact that Ranking Member Senator Oletha Fauske-Doe helped create a bill and submitted it where it was passed for the grandparents to make sure that they have an opportunity to have their kids. And I still get phone calls from grandparents about the system taking their children away from them and then wanting to adopt them out. That's what's happening to this grandparent that I've tried to advocate for. You know, the sad part about it is that I have been a Casa volunteer. I got the court-appointed training to be an advocate for parents, and have been put out of the court by 2 judges from 2 different courts because they didn't like the fact that the parent or grandparent requested that I be there present with them as their advocate. How can a judge put an advocate out that was trained by the court to be an advocate, and it's the people's court? I don't get that. Also, it bothers me that certain organizations like DECA, it still has a relationship with a faith-based, so-called faith-based organization called Faith Builders that have been accused in the past of trafficking and selling Black children to wealthy people who they believe were better equipped to have those Black children than their own parents. They were intimidated by said lawyers that represented this organization to give up their parental rights. So the system has been broken for a long time. And another issue should be the governor. I give her recognition for creating a child welfare long overdue. But I have an issue when committees are created, and instead of involving the people who are boots on the ground, and maybe give them a stipend to report what it is that they are hearing. And it's always those people with degrees and agencies that have special connections with said committee members. And I think that's awful. So I have been very concerned for a very long time. I've talked to Ranking Member Senator Fauske-Doe about this. I've also talked to print media like Community Voice editor Benita Gooch and the Eagle. Stories have been written about the concerns that people have had with the broken system. And I'm here to tell you that it's broken and it needs to be fixed. And I think that the committee should involve those people who have boots on the ground, and I say with a stipend, to give you the correct insight and information that's where a system has been broken. You know, sometimes the head don't know what the tail is doing. The head might have good intentions of making sure that policies and procedures are followed correctly. But then when you have those terrible social workers that go into someone's home and have their own biased opinion or where they think that child should be, it will continue to be broken. And so I'm hoping that this committee will listen to the concerns of the people that's testifying today and tomorrow about you know doing a better job in having oversight on the people and the agencies that you're giving that the state is giving money to. And thank you again.
Mary, thank you very much for your testimony. And committee, do we have questions for Mary? Senator Foscato.
Thank you, Mr. Chairman. Mary Dean, thank you so much. Part of your presentation, you were cutting out a little bit. And so I just want to say for the committee, in the inner city Cedric County, where I reside and represent over 72,000 people, I get phone calls not only from African Americans, but from Raymond, who was just on the phone, male Caucasian, Asians, Native Americans, Latinos, from everyone about these issues. And I think I really heard about it from Mary Dean years ago. She's been a strong advocate in the city of Wichita. But Mary, can you elaborate a little bit on that federal individual that came to Wichita, and we had meetings with individuals sharing these same concerns, and I think that was maybe 5 years ago. Can you elaborate on who that was and what's the status at this
Yes,
point?
her name was Rita Banizalio, and she is with the Department of Justice. She was contacted. I contacted her based on my concerns when it came to faith builders and the selling and trafficking, as far as I'm concerned, of Black babies, Black children. And uh, what happened is that, long story short, we, the group, and we call ourselves the DOJ group, we have a MOU that was worked out with Rita with the Department of Children and Families.
Well, Mary Dean, thank you again for sharing with the committee. Thank you, Mr. Chairman.
Senator Baumgartner.
Thank you very much, Mr. Chair, and thank you, Mary Dean, for sharing your insight with us. I feel that you are boots on the ground, and you, with your experience as being an advocate in the courtroom, you are essentially our eyes and ears. So could you please share with us what are the different issues that are leading to so many, as you mentioned, so many African-American children, particularly in Sedgwick County, being placed in foster care? What is your experience? What can you glean from your experience and share with us as to why there is such a high incidence of those children being placed in foster care and staying for such a long time?
I think it's cultural differences and understanding of different people's culture. I heard someone say, I don't know if it was you, that said that when they grew up, they had 9 or 10 brothers and sisters, and they lived in, this 2-bedroom, maybe. I don't know, but I do know that uh, uh, our cultures are different. Whereas uh, my auntie had 13 kids in a 2-bedroom uh, a farmhouse in Moscow, Tennessee, and everybody was just fine. I had 6 brothers and sisters. We grew up in a 3-bedroom home, one bathroom, and we were just fine. No one came into our home and told us that each child had to have their own bathroom or their own bedroom. That's like I said, cultures are different. And I think because some social workers come from rural areas and they're not exposed to various cultures, especially Black culture. I'm just going to say Black culture because that's my concern, has been my concern for a very long time. Black children being taken out of the home sooner and not reintegrated back as soon as they could. Is that, you know, they have a biased opinion about how Black people are supposed to live, how Black people are supposed to discipline their children. If they come into their home and they feel like it doesn't look as clean as it should, they want to remove them. Or if they feel like they're not disciplining their children the way they think they should be disciplined, they want quicker than they should. And when they get to court, a lot of the parents and grandparents are intimidated by the court and by all the people on the other side that's supposed to be representing that child. But as one father said earlier, that you over there by yourself. And when the court does with an attorney, it's someone that already has cases up to their wazoo, and they can't pay enough attention to your case is all about. So you don't get they don't get the kind of representation that they need. And then another thing is that these parents and sometimes grandparents are piled on with all kind of court orders that's setting them up to fail as far as I'm concerned from the jump. You know, a lot of these parents are limited incomes, don't have transportation, but yet and still you want them to go to these various agencies to get this test or get this training, and they got to pay for that. Nobody's offering to pay for those trainings. And so they're setting them up to fail from the jump. And so it's shameful because it's still going on as we speak.
Representative Johnson.
Thank you, Mr. Chair. Just quick clarification. I'm the rookie. What is an MOU? Policy or
Memorandum
plan?
of understanding.
Got it. Thank you.
Representative Reese.
Thank you, Mr. Chair. Ms. Mary, thank you so much for your testimony here and all of the excellent information you have given us. In your packet, there's a lot of historical data that's here that I think it would be useful for us. It'll take me a little bit to go through it and read it, but I want to thank you for that. I especially want to thank you for the copy of the slides that you have done, the diversity and inclusion workshop that you gave for St. Francis. These are very, very good slides, and I want to thank you for that.
Thank you.
Senator Gossage.
Thank you, Ms. Dean, for your testimony today. This is Senator Beverly Gossage, and it was I who was talking about my childhood and 5 kids sharing a little postage stamp bedroom, 3 in a full-size bed and then 1 in each of the bunk beds, and you really couldn't walk in between the 2 beds. But we were actually very happy, and my parents didn't have much money, but, you know, my mom could make beans and a ham bone go a long way.
Right.
I'm just trying to say I don't think it's always cultural in that my mother was one of 15 children that grew up on a farm, and, you know, they were lucky if they had 3 bedrooms and 1 bathroom, but it was an outhouse. So I do think, though, when we talk about culture, maybe the culture is more people that were raised in a home where everybody had their own bedroom and they had 3 bathrooms, and didn't understand that, you know, these are people that could still take care of their families. Maybe they could benefit from some free clothing at Salvation Army, or, you know, some help with food or whatever, but to having their children taken away. And I'm not accusing anybody of that, but I have seen in our own family this exact situation that you're talking about. it was many years ago, and hopefully things are a lot better now, that an infant was taken away from my niece, and she never saw him again until she found him after he was 30 years old. And the
You
same
know,
kind
I
of situation. So my sister tried to adopt her grandchild, and they wouldn't let her. And they put the baby up and gave the baby to the family that was the foster parent. Later, the social workers said to my mother, when my mother went up to talk to somebody, who would have been the great grandmother, and said, you know, we've stopped all that. Things are a lot better. It had to do with money. It had to do with paying the agency. It had to do with paying the foster family who was going to be adopting. Whether any of that is true or not, whether all of that is just speculation or rumor, I don't know, but I'm just telling you that I've heard some of the same things, have experienced some of the things, same things. But it's one thing to say the system is broken, but what we're here to try to figure out is how much of that has been fixed, what is still broken, and what can we actually do to see a difference. Thank you so much for your testimony today, and I would believe that everybody in this room is wanting the same result. Thank you again. Thank you, Mr. Chair.
can I say one more thing before also when it comes to culture, in that training that Danielle Johnson and I did, uh, we created a booklet that we gave to St. Francis because our children that are farmed out to Western Kansas and whatever, uh, people don't know how to do their hair, they don't know how to take care of skin and whatever. So that's a difference in culture because I see white foster care parents with some of their foster care black children out, and their hair looks an absolute mess and their skin is horrible. So that's part of the culture also.
Mary, thank you again for your testimony. And just to kind of add something to what Representative Reese had talked about on this handout, committee members, if you have not looked through it, you also have a souvenir picture of our very own Senator Foscadeau in there. So, Mary, thank you very much for your testimony and being with us. Committee, next we have Tobin Hoffman, who is a parent, and they are with us virtually, I believe. Tobin,
Yes.
welcome to the committee.
Well, you got my testimony. I'll keep it pretty broad from sheep. We were in Kansas. We don't even live in Kansas. We're from Nebraska, and we were down helping family with farm work. And we had an accident with our son. And I'm because of who I'm employed with, I'm a first aid medic provider. He went unconscious in my wife's arm right in front of me. I ran to help, and we rushed for the hospital. You know, we go to a hospital. Next thing I know, we're getting shoved around, and they're keeping us confused. And next thing we got police and guards escorting us out of the hospital and taking our son away. And we go find some lawyers for this custody hearing. And 30 family members are sitting in this custody hearing, and you know the attorney's sitting there telling you, "Oh, you got a catalog baby," which this is my first child in my life, and I'm 50 years old. I mean, I understand what that lady's saying. I grew up in a rough family, didn't have much means in life, and I've worked hard, and all my siblings have worked hard to go somewhere in life and serve our country. And to get treated as I got treated, I asked myself, why did I go do what I did? And I mean, it seemed like they're right. The judge was on one side; it was everything against us, and they only believed one person. And when our family started reaching out to representatives and stuff, we started getting retribution from KBC and TFI. I mean, the grandmothers didn't get to see the child for 80 some days. And the parents is us, it was 150 days. And my wife, it was her first child, and it was heart and devastating. She was breastfeeding this child, and I mean, she was emotionally torn away with the accident. She felt so guilty of the accident, but it wasn't her fault. It was something that just happened. And I don't like to see anybody go through that. I know what heartache is. And I mean, to have your child gone, I mean, it took forever in the visitations and everything. We were very proactive at our case plan, had it done fast. And we were always getting different case workers. And this Wendy Dobbs, it just turned and twisted every word you told them. We were honest and upfront, and it just turned every word we used against us, which I think was totally wrong. And the judge was very one-sided. And we had the means to spend the money for attorneys and stuff, but I feel that they robbed my son's future in some way. That it could have been better to improve clothing, food, education, but that's just wrong. I mean, you got 30 family members that are well and have good jobs and could took care of this kid right off the bat with the injuries that he suffered. I mean, he was out of the hospital in a week after the injuries. And what they're accusing us of was totally way out in the ball field. Nobody shook that child. But I mean, 16 months later, we finally got our child back. It's caused rifts in the family. He's doing well. And there was nobody to go after. You know, there was no Casa, there was nothing. You felt lost, you know. You're doing what they said. You're a person that follows the rules, and you have one accident, one mistake, you know. A fresh mother, young, and you know, it just it's very heartbreaking. And I don't think any family should go through that. I think it could have been totally done different. They could have kept us under observation. You know, it could have been done way better, because in my industry, if you would have treated people like that, you'd be sitting in a jail cell, because federal people come down and you have to speak for things and actions you do on the world I work in. And what I seen was very, very discouraging. I mean, it just makes you lose all faith in government, trust of the medical industry. I mean, I don't even want to talk to a doctor anymore. My son seen his pediatrician 7 days before the accident happened. He was doing totally fine. You know, we didn't even know he had a genetical defect, which it's hereditary. I mean, how do you know a kid's skull's growing faster in his brain, causes more fluid around his brain? You don't know that until a neurologist diagnosed it. So that's basically all I have to say.
Tobin, thank you very much for sharing your testimony with us. Committee, do we have any questions for Tobin? Not seeing any. Tobin, again, thank you very much. Committee, next we have Danny Hewlings, Director of Women's Activity Learning Center for Topeka Correctional Facility. And Danny is with us virtually. Danny, welcome to the committee.
Hello, thank you. Okay, so my role here at the Topeka Correctional Facility is to assist the mothers and grandmothers with their children, any needs for the minors 18 and under. So right now, I actually have 67 mothers that have foster care cases. And of that 67, 122 children are involved. So with that, I have been a part of quite a few case plans. I just know that nothing is uniform across the board. There's a lot of inconsistencies. It's always up for interpretation of how to do things. Smaller counties, a lot of times the women that come to prison, their prosecuting judge and attorney on their criminal case is also on their sync case. So a lot of times there's some bias on that. The fact that we can go through 3 to 5 caseworkers in 1 year, that's a huge disappointment. I'm considering that permanency is the ultimate goal, but the agency themselves are very unstable. We have had situations where the caseworkers just don't respond when we reach out to them. The ladies here at the Topeka Correctional Facility have the ability to meet with me daily, which is not the same for jails or any of the male facilities here. So this program is exclusive just to the Topeka Correctional Facility. So they have the ability to be in contact more than somebody that's incarcerated at Lansing or Norton. So when I meet with a woman 3 times in 1 week and leave emails for the caseworkers or leave voicemails for the caseworkers and just no one responds, that gets pretty discouraging for the women. They do have the ability through this program here to work on a lot of the case plans, tasks that are put out there for them. One of the big things is they can't work on the housing piece so much or the job piece. We have started a lot of new industry at this facility, so that becomes an option later. But my experience also is a lot of these women aren't from around here. So when they work at a work release job or an industry job, that's not where they're from. So the job a lot of times isn't able to be a spot for them because they don't live in that general area. So I think the big discrepancy for me is that there is no permanency when it comes with the agency. A lot of times they put a lot of tasks on the parents, but they just don't follow through a lot of times. I think that's the big issue. Or because we go through so many caseworkers that we get to a certain spot where we're at weekly Zoom visits. Our facility right now is still locked down from COVID, so we don't have contact visits yet. So children and caseworkers can't come here to visit right now. So we've been able to do Zoom visits. I have a number of ladies that I see every day of the week to do a Zoom visit with their kiddos. So they have the ability to at least communicate and bond with their children. It just sometimes really takes a lot to get that ball rolling. You know, I had sent my informational handout and the brochure of what we have here to offer. And really, the ladies just need some time. So when they do the 12 to 18 months, sometimes that's not feasible because when the woman gets here, whatever the journey that brought her to prison, most often is drugs. There's a huge drug epidemic. And so a lot of these women come to prison and they're actually able to work on themselves. They can do the drug treatment programs. They can take the parenting classes. But the problem is they just need a little bit of time. So that's really my message today is just because they have become incarcerated, they still have that want and desire to be parents to their children. And most generally, the children, you know, they don't see their parents' faults. They just see that that's their mom and dad. And it doesn't matter if they sleep in the same room. It just, they need their parents. So a lot of times, you know, these women, they don't come from the best families. So they grew up kind of hard. And so they didn't have the luxury of even knowing how to parent. So my hope is that the women that become incarcerated, the foster care people understand that they are here, they are working, they are trying to be sober, so that when they get out, they can be successful.
Danny, thank you very much for your testimony and for the brochures and the handouts that you have given us. Representative Humphreys.
Thank you, Mr. Chairman. Thank you for your testimony. And we've talked on the phone because I have a friend that you have helped. And so I kind of want to say to the committee, this conferee is doing a lot for the women. She's so responsive whenever I speak on the phone with my friend, and I'll say, well, I don't know how I can do that. You know, we always end up, well, you could talk to Ms. Ewings. That would be a way that we could get this done. And so I just want to tell you that you are making a difference and that we appreciate what you're doing there. And I think it's interesting that you bring this angle because it is an angle that we haven't really heard before. I mean, I've been on a committee like this for several years, and so I think it's interesting for us to consider what you're saying and just it's just something that we haven't really, again, had to. We don't have bills or statutes in particular that deal with this in particular. So I think you brought an angle that's helpful. And so thank you for coming. And I'm sorry I didn't get to meet you in person, but thank you for everything that you're doing. Thank you, Mr. Chairman.
Senator Foscato.
Thank you, Mr. Chairman, and I have to say thank you to Representative Humphreys. You did a wonderful presentation the other day in our Juvenile Justice Oversight Committee, and so this kind of fits right into it. When we toured the Juvenile Detention Center, and just the overall presentation from the sentencing commissioner, the hope with probation and parole, it was shared that women don't get a lot of visits. And so on top of that being isolated from your family or friends, and then you've got to do the time for the crime, and then you've got to work out a plan to get your children back. It's a little overwhelming. And so to the conferee, Mr. Chairman, I'm sorry, her name is, I don't see it, but when you said they need more time. So usually, you know, we haven't quite decided within the law, is it 12 months or 2 years to look for permanent placement or not? But when you say they need time, can you elaborate a little more? Thank you.
Well, I had submitted a letter that I had written to a judge regarding a woman that I had been helping. And I kind of like to refer to that because this is kind of the piece that I'm talking about with needing time. So this mother had come to me in 2018 when she became incarcerated. She had a 9-year-old daughter and a 3-year-old daughter. The 3-year-old daughter was with her sister, and the paternal grandparents went to her sister's for a visit and then never brought the 3-year-old back. So while the mom was here, I assisted her numerous times to try and track down the family. The father of the child was also incarcerated. So she had writing privileges. She would write to him and try to get phone numbers and addresses for her family. So every time we would get a phone number for the grandmother and call, the grandmother would either not answer or she changed her phone number quite often. So the 9-year-old was with the mother's mother and father. And so they all collectively tried to figure out where the 3-year-old was. Well, in the midst of this, the 3-year-old's paternal grandmother committed a crime. She stole from a store, and she had the 3-year-old with her when she did that. So when the grandmother got arrested, the 3-year-old went into state's custody. So at no fault of the mother who was here, her daughter was placed into state's custody and housed with kinship. So the mother's sister had the 3-year-old. So the issue that I had was the child went into state's custody in August of 2019. The court hearing for the termination was March 16th of 2020. That means at the time of termination, the case had only been ongoing for 7 months. That's 5 months shy of the noted 12 months and 11 months shy of the max of 18 months, I'm sorry. So once we reached the 12-month mark for this case, the mother only had 5 months left on her sentence. And they still went ahead and terminated her parental rights. It's just, why couldn't we have waited 5 months for her to get out?
Senator Baumgartner.
I just want to say, Danny, thank you for your testimony. And my question following up from Senator Foscato was simply, what was the outcome of that letter that you had shared with us? I think the outcome is horrendous. And it really flies in the face of so many children that are in foster care, at least in my Senate district. The first one I was ever contacted about was 1 week in as a senator, and that was a child that was 3 years old, had been in foster care since birth, and it was 3 years out when they were doing the final placement. It does seem as if we are very inconsistent in the way in which we met out timeframes and guidelines, and that lack of consistency again, this 3-year-old that you're mentioning, the mother had no control over what occurred while she was incarcerated. I am glad that Senator Fauscadeau shared the information that we learned during the tours, and that was that not only the youth that are incarcerated, but the adult women, so the female youth and the adult women receive markedly fewer visits from anyone while they're incarcerated. They don't have the support services from family or friends when incarcerated. And we have very lackluster skills program for the women in the adult custody to develop skills for meaningful job opportunities. And so I think, Mr. Chair, that I look forward to hearing how we might make things more consistent for women that are incarcerated and afford them the same leeway that seems to be occurring outside of the incarcerated foster system. So I appreciate that this was brought to light. Thank you, Mr. Chair.
Danny, thank you very much for your testimony again. That was very enlightening, something that as a legislator for only minimal years, that's the first time I've heard of this issue as well. So I'm glad you come before the committee and gave that testimony. Committee, next we'll turn to presentations on requirements for becoming a foster parent and experience with the foster parent application process. First up is Janet Owens, Chief Child Welfare Officer for DACA. Janet, welcome to the committee.
Thank you, Mr. Chairman, Vice Chairwoman, and Ranking Member. I appreciate the opportunity to discuss the foster parent licensing process and the recruitment process as well. As Mr. Chairman shared, my name is Jeanette Owens, and I'm the Chief Child Welfare Officer at DECA, and we've provided foster parent recruitment, training, and support services for the past 20 years. I think it's important to start out by sharing these past years have been difficult on foster families and families in general. In the past 17 months, we've had a net decrease of almost 260 foster families, and almost half of those have been in the last 5 months. Child placing agencies have needed to adapt and increase supports in several new ways, while also ensuring licensure and regulation requirements are met. You'll see in my written testimony that we often balance 6 to 8 sets of requirements and policy manuals when we're working with our foster homes. These here are the steps that foster parents need to take to become licensed. Each one of these is an individual step that we often use to kind of explain the length of the process. The process is not quick or easy, but it does help screen and assess families for this important role. The length of time to get licensed varies. And as you've heard earlier, the system like Binti will help reduce some of that possible time. DECA began using Binti earlier this year to assist our families, and I'd be glad to speak on that later if so desired. Some of the licensing steps may only take a few minutes to complete, while others may take hours and a more lengthy time. The pre-service training takes an average of 2.5 months. That would be TIPS MAP, Deciding Together, or NTDC. I'd like to point out just a few of the steps in specific that's on your list there. The prohibited offense form is one that is quick to complete, but often has a lot of potential clarity needs behind it, and I'll speak to that a little bit more later in this testimony. Another step is reviewing the types of care needed. You guys have had this discussion a few times about the importance of having the right foster parents for the kids out there that are in need. Another step in the process that I'd like to point out is motor vehicle records check. That is one that DECA has put into our process because it often provides us immediate information on an applicant and their past history with that. The next area that I want to cover is policy reviews, and in there you can see highlighted as confidentiality, behavior management, and restraint. As we're working with foster families, one of the regulations is to make sure that they're prepared to protect that confidentiality of that foster kid, to make sure that we have the right understanding and knowledge for behavior management and restraint. Ideally, we don't have to restrain a child, but if it comes to that in the foster parent's home, to protect that child's safety, and that is the only time that restraint is allowed, we want to make sure that our foster parents have the education to be able to do that safely for the child and themselves. The last two steps in the process in those two columns that I want to talk about is the walkthroughs. Our first thing we do with the family is meet with them and do a walkthrough of their home, and the last thing before they get licensed, we do that again. We walk through their entire house and through the survey to make sure that they're prepared for when DCF arrives, and DCF also walks through their house and goes through that survey as well. So by the time that they get licensed, there's been 3 complete walkthroughs to ensure that family is ready for the placement of their first child. I think it's important to note that many of these steps have their own barriers and sometimes blocks that occur. I mentioned the prohibited offense earlier, and I know this has came up several times with the bill that was proposed last year. Just this past week, we had a home get through the final process, all of those steps mentioned earlier, and found out that they had a misdemeanor assault charge on their fingerprint checks that prohibits them from being licensed. It would be great if we had a system that could put all possible things that somebody could be prohibited for in a list, but because that is so expansive, we don't have that. And so occasionally that prohibited list form becomes a barrier to people that have done the process and then can't be licensed. Another set of barriers that sometimes happens that we don't talk a lot about is out-of-state background checks. It is a requirement that if the applicant has lived outside of Kansas, that we need to get those out-of-state background checks. The difficulty is every state has their own process, their own forms, and potentially their own expense to those. And so we learned the hard way that we need to check those every single time before we give them to a family, because they also sometimes take months or even longer to get back the results. So we now check those before we give them to each and every family. Another barrier, and probably one of the most difficult barriers, is just home modifications. We've many times had families select out of the process because of the need to have some sort of home modification. Sometimes that's because they rent and they don't have the authority to make the structural changes. Sometimes it's because they just remodeled their home and they're unwilling to remodel what they just remodeled. Other times it's because of an expense and they can't afford to make those changes. And then sometimes because of the length of the modifications, there's just been a life change that's happened and they've decided to no longer go through the process. I now want to shift to the retention piece because we believe that retention for foster families begins almost immediately and is ongoing. Child placement agencies provide 24/7 support, and at our agency, we assign a foster home one specific worker and supervisor so that home knows every time they call that for support, they will get somebody that they already are aware of and connected to, somebody that knows that home's strengths and needs specifically. But even with that, after 18 years in the system, I still hear about support calls that regularly surprise me. I'll provide just a few of those incidents. At one time, we had a foster parent that had purchased a brand new vehicle and drove it home and put it in the driveway, and within 3 hours, the foster teenager had taken that brand new truck out for a joyride and totaled it. Thankfully, the child was fine, and thankfully, we had foster parent insurance that could help them with that expense because there wasn't insurance yet. We've also had foster parents threatened by members of the foster child's family. And some of the cases stand out when the family members drive by the home or sit outside of the home, and our staff try to work with the families to help them feel comfortable and safe and help them to feel like the children in their home are safe. Those cases are always very sad when the safest thing to do is to move the child, and that occasionally, unfortunately, happens. Another set of support things that I want to speak about is probably the biggest risk I see occurring at this time for the safety of our children, and that's when foster children are screening into acute hospitalizations or PRTFs and there's no beds available. We've talked about this sometime, almost for years, I'm guessing, but it seems like the need is higher than I've ever experienced before. These children are sent back to the foster homes until a bed's open or they no longer screen in. What that means is we're putting actively homicidal or suicidal children back in our foster homes. Trying to support a family in this situation is extremely difficult. Staff complete critical incidents, we complete safety forms, we check in with those families regularly, we talk to them about putting up their sharp things, we talk about how to search rooms for dangerous items, we talk about how to get correct alarms, but supporting a foster family through sleepless nights and other things becomes very difficult. I mentioned in the written testimony about the steps that occur when a foster family loses a family member, but I also wanted to point out sometimes we unfortunately lose foster parents as well. Sometimes in these cases, there's spouses in the home that we can support, and other times the foster parent was a single adult. One case that I wanted to share about with you that happened this year was when one of our homes received a devastating diagnosis that they were terminal. In the short period of time that she had left to live, she worked to ensure that that foster child could go directly to an adoptive home, and so that they didn't have to experience another move before they found their final permanency. That was an act that I will never forget of ensuring the safety of children. The last area in the retention barriers that I want to talk about today is the grief process. And this impacts a majority of our foster homes, and it's frequently daily. Many foster homes assist in the transition of children going back home after they've lived in the foster home for many months and years. You guys have heard many, many stories about this happening. From the beginning, when we work with applicants, we talk about the grief process. But unfortunately, it doesn't stop that pain from happening. One example, though, that I want to share is I recently had the privilege to talk to a foster mom that had fostered a child for the past 3 years in her home, and it was a young child. The foster mom was sharing the hopes and the concerns that she had. While her heart was breaking, tears in her eyes, she was sharing the things that they continue to do as a family to help this child successfully transition and to keep any additional trauma from happening to that child as he had transitioned home. And in my head, I made note that the tasks and the things that she was doing to do that were in direct disregard for what her needs were and what would have been in her best interest. And again, it reminded me of all of the wonderful things foster families do. I think it's important to speak of the high things that foster parents do. There's a lot of times they don't have very much authority in the process. I think it's sometimes forgotten that they're volunteers and they've opened up access to their home, to their livelihood, to all pieces. Anytime that we can say positive words and highlight the good things, I think it helps strengthen our recruitment and retention for the state. And sometimes we unintentionally make comments that go the other way. For example, we really focus on being a kin first state. And sometimes then to clarify the difference between kin first and foster parents, we say stranger foster care. And that in itself sometimes feels derogatory to our families. They don't feel like strangers to these kids they're tucking into bed at night. I'd like to conclude by sharing just a few of the system needs and solutions. The focus on consistently improving remains. In one particular area that I want to talk about is kinship families, gaining the opportunity to be supported by any child placing agency and not being required to be licensed to be supported by child placing agencies. At this current time, kinship families must become licensed to be supported by a child placing agency outside of their case management provider agency. The detailed licensing requirements that I shared earlier often limit families from moving forward in that licensing process. Another area that I mentioned earlier was just liability insurance. I do think that it would be great to continue to look at the ability to have statewide foster parent liability insurance. Foster parents often have to cover expenses due to foster children accidents, needs, and behaviors, and having that statewide insurance may assist foster families in when they encounter expensive repairs or replacements situations. Another area that I think continues to need focus is the placement process. There are still obstacles within the care match system, and child placement agencies that are not case management providers often have reduced opportunities to match some of those younger children. It's recommended that continued enhancements and accountability features are added to that care match system. And the last area that I want to speak to is the continued focus on funding placement stability grants, and we appreciate those very much. The current rate structure begins at the placement date of a child, leaving expenses for recruitment and licensing of families to occur prior to that funding. Placement stability and innovation grants provide additional opportunities to the child placement agencies to enhance their services. So thank you for your time today. And if you would like me to talk about Binti, I can add that to this, or I can stand for questions at the appropriate time.
Jeanette, I think just for sake of time, we'll just go ahead and open up questions real briefly. I don't think I see any. So Representative Humphreys.
Thank you. Thank you, Mr. Chairman. Just real quick, you mentioned the care match system, the agencies that aren't the management providers, and is that group that we used to call contractors? Is that what you're calling the case management providers?
Yes. Yep.
Okay, so you would say if you're not one of those, then you might have reduced opportunities.
It's certainly something we share with our foster families from day one, that if they're looking for a young child, that often the CPAs that don't have the children coming into those entities, they may have a longer wait, or they may choose to go with one of those case management providers.
Okay, and then the one other thing is the recruitment process, that you're talking about the rate structure begins when you place a child, but would you say DCF kind of does a lot of the recruitment, or, where does that fall to you all to do that, or that middle case management group? Who does the recruiting? And is there a faith-based segment of that?
I would say all three. I think it's, the state has a great diligent recruitment plan that we all work on together. Individual agencies have all of our own individual recruitment plans, and then we have that statewide recruitment plan. Many of the child placement agencies have very specific faith-based recruitment pieces to that. Our specific plan is first our foster parents. We know that our referrals that we get from our foster parents almost 90% of the time get licensed, and so that is our highest success rate. Our second is faith-based right behind it, to have new inquiries from there.
Thank you, Mr. Chairman.
Senator Baumgardner.
Thank you, Mr. Chairman, and thank you for your presentation. We heard earlier in testimony from Mary Dean the concern she had with regard to DACA and their relationship with faith builders, and she mentioned child trafficking. Were you going to address that?
I'd be glad to speak to our relationship with faith builders. We have worked with faith builders for about a decade. Faith builders is a consistent partner for us to help provide goods and services to not only our foster families, but also our family pres families. And additionally, they often refer additional foster parents to us. I'm trying to think of the correct verbiage there. Human trafficking obviously is something that is horrific, in that we would do all things to ensure safety of children. And so we wouldn't partner with somebody that we suspected any type of abuse, neglect, human trafficking, anything like that.
And Mr. Chair, if I might, as a follow-up, under system needs and solutions, you talk about kinship families gaining the opportunity for support. So is that policy, or is that policy to not provide that?
There's funding. This is a complicated issue, and I was wondering if putting it on here might be a little complicated. So currently, licensed families, through, like we talked earlier about, funding can come through once a family's licensed, and so kinship is supported by the case management providers. And so one thing that would be great is if those kinship had the opportunity to have all options for CPAs. That becomes a funding issue, and so it's trying to figure out how in the system we could make that happen.
Well, I appreciate that you bring that up, because I think, quite frankly, this committee continues to hear kinship first and that that is the push. But there isn't, on that other hand, that discussion. But by the way, these support services don't come with that. And so it's great to say kinship first, but with all of the grants and other money that is going out to communities, it's not helping those families that are, those kinship families that are providing those services.
To add just one piece to it, there have been steps taken to help with that, in particular of having exceptions for kin families for non-safety issues so they can get licensed in that process a little differently. So there have been steps to also try to mitigate the funding piece of that.
But it's still, the process is to get them licensed.
Yes.
Thank you, Mr. Chair.
Jeanette, thank you very much for your testimony. And I just have a comment. I don't know, you might want to stay there. You might have a comment after that, respond to it. But if any members of this committee have ever looked at becoming what the process is to become a foster parent, I know that there are some on this committee that have in the past, but it is a daunting task. I did it one night just to see. And there is no wonder that we have a shortage of foster parents, especially if you live in a rural area, classes and stuff like that. So that, that might be something that I recommend tomorrow that we look into streamlining that a little bit. So, and I don't know if you have any comment about what I just said or not, but I want to make sure you had an opportunity to.
No, I appreciate that. It's definitely a delicate balance between making sure we have the right people that are prepared in the requirements behind it. And so there's a lot of moving parts, but the family first and the other, there's new regulations that will be coming down at some point. And it's hitting that balance of what we have to do in the process. I do think, kind of circling back to the Binti piece, we specifically went down that route because we knew it would maybe be a way to help those families that wanted a different and easier path to complete licensing online. And so I think continuing to try to find support services has been a piece of what we do.
Representative Ousley.
Thank you, Mr. Chair, and thank you, Jeanette, for being here. I apologize, I had to step out during your testimony, but just to kind of follow up on Senator Baumgartner's questions about the faith builders, you mentioned that they often bring in more foster parents, and I'd be curious to see if the adoption rate for the foster parents that faith builders brings in is equal to non-faith builders adoption rates for foster parents. Did I phrase that right?
And so I'll answer that in two ways, if that's okay. So when the concerns first came up a few years back regarding some of the things Mrs. Dean shared, we did the research to say, okay, where's the adoptions and all of that? And that did not, it was a lower amount of adoptions within those faith builders' homes. I have not done that recently, so I can look into that. On the other side, once applicants become DECA licensed homes, they follow the exact same procedures as everybody else. And so while they had that connection to faith builders, they have the same licensure requirements. It still goes through DCF, it still goes through the BIS, the best interest staffing, and all of that process. And so that meets our other foster family standards.
Thank you for that. And if you do update that, take another look at it. I'd be curious to see the results. Thank you, Mr. Chair.
Glad to do that.
And Jeanette, just a quick follow-up. Senator Foscato reminded me. I think she had a question earlier about the Binti program. Okay. How those funds what funds are used to pay for that program?
So the funding process for child placement agencies is we're paid per child, per night, per level of care of that child. And so we put all of the funds together that covers the entire agency, the entire program. Sorry, let me say that differently. So staff salaries, benefits, mileage, recruitment, all of our recruitment goes under that. All of our retention things go under that. Foster parent conferences, all of that's in that one pot of money. And so we strategically made the decision to purchase Binti and hoping that that would help our recruitment retention process.
Thank you very much. Jeanette, thank you.
Thank you.
The committee, I'm going, unless you guys have an objection, and I know this is going to put us behind just a little bit, but we have an opportunity to hear from an incarcerated mother. Danny Ewlings was able to get one to come on and testify. I think it would be very useful and important for us to hear from her and hear her story. So I'm going to deviate from our agenda just briefly and allow her to testify before the committee. And I apologize, I do not have her name. I just know Danny is putting her on. So Danny, if you're with us, go ahead.
Michelle. Can you hear me?
Yes, if you wouldn't mind, just if you can, if you're able to, state your name and for the committee, for those listening online.
Yeah, my name is Michelle Voorhees. So my name is this as both a child and a parent. While the personal consequences of being removed from my home have been overwhelmingly negative for my family, I want to be very careful not to vilify the foster care system as a whole. I don't believe that foster care is inherently bad. I think that it's a necessary measure. I think that there's very specific circumstances that foster care is needed and children flourish in that environment. However, I don't think that foster care is the answer to every child issue that we have. I think that the real issue lies in trying to determine when it's necessary and when it isn't necessary to remove a child from the home. And what I really want to talk about today is the attachments that children have to their parents that are so important. And those attachments can never be replaced. And when you damage those attachments, there are lifelong consequences to that. And I think that that needs to be recognized before we remove children from the home. We really need to think about, is removing them from the home and harming these attachments that they have, is it worth doing that? What they're experiencing, is that going to be better for them in the long run? I come from a very low income family. Statistically, my family portrays all of the hallmarks of low socioeconomical status, poverty, addiction, mental illness, incarceration, incomplete education, unemployment, and homelessness are all issues that my family deals with. I was originally placed in foster care in 1996 when I was 5 years old. I was removed from my home not because I was being abused, but because my mom was struggling with some mental health issues and she had attempted to commit suicide. As a child, this was devastating. Being removed from my home was completely devastating to me. Not only was my strongest emotional attachment removed from my life, but so was every familiar comfort that provided me with a sense of security. My bedroom, my toys, my routine, the known expectations and boundaries of my household. And being placed in a non-relative foster home forced me to navigate a foreign social construct all on my own. As a child, this was terrifying. But having to do this without the safety of my primary emotional attachments was nothing less than traumatic. This experience created a negative belief system that impacted my developing identity. And because I didn't immediately understand the boundaries of my new foster home, I had all kinds of beliefs about myself. I believed that I was a bad child. I believed that I was unwanted, that I was unloved. And this belief system remained intact and worked to perpetuate the cycle of poverty and dysfunction as I grew into an adult. Family dysfunction tends to be generational in the absence of proper intervention. I had my first child when I was 16. He was placed in a foster home at 6 months of age. Again, not because he was being abused, but because I was arrested for underage drinking. He was only in the system for 5 months, but the impact of that experience was just completely devastating for the both of us. As a minor child myself, I had huge barriers in completing the tasks set forth in my case plan. Financially, the expectations were impossible. I was expected to live on my own. My infant was expected to have his own room, his own bed. I needed smoke alarms, outlet covers, child locks, a fire extinguisher. I was expected to produce $25 at any random interval to take a UA. And if I didn't have that $25, that UA was counted as dirty, even if I was sober. Anybody who's ever lived in poverty could recognize that this case plan was desperately unrealistic. Just because I don't have smoke alarms in my home doesn't mean that I don't love and nurture my child. It just means that I don't have the money for it or that I'm uninformed. It doesn't mean that I'm a bad mom. I regained custody of my son, but the impact of the experience was debilitating to both of us. Our bond had been damaged. My son showed signs of attachment insecurity. He needed to be held constantly. He couldn't sleep alone. He panicked if I left the room and he lost sight of me. The shame that I felt as a mother was almost unbearable. And it led to all kinds of self-destructive behaviors, which ultimately led to my incarceration. I developed a serious fear of asking for help. And since that experience, I've recognized that many low-income families are hesitant to utilize resources out of fear that they'll be judged as unfit by the state. And this culture of fear only exasperates the cycle of dysfunction. Now, I understand that legislating social policy that regulates child welfare is inherently difficult. I appreciate the complexity of this issue, and I know that there's not an easy answer. But if I could advocate for one change to the current system, it would be that every measure be taken to preserve the integrity of the parent-child bond. I would advocate to reduce the use of out-of-home placements and increase intensive support and parental education. I would suggest incentivizing reunification and not adoption. Between my parents, there are 7 children. 6 out of the 7 of my parents' children have experienced foster care at some point during their childhood. All 6 of these children struggle as adults with substance abuse, anxiety, depression, mental illness, homelessness. None of these children graduated high school. The one child that was left in this home that was considered to be unfit multiple times by the state, the one child that stayed there, she grew up to be a first-generation college graduate. She is successful. She works as a chemist right now. She owns her own home. She's doing great. And so I just really want to point out that foster care does not always provide better outcomes than living with less than optimal parental care. And that's been my experience. Thank you.
Michelle, thank you very much for that testimony. You did a very good job of articulating your story and position on that, and we appreciate that and appreciate you taking the time to do that. If you wouldn't mind opening up for questions, taking some questions from committee members. Senator Gossage.
Thank you so much for joining us today, and I would like to echo what the chair just said about your testimony. And as I was reading it, and I noticed that it was here included in the packet that we received, as I was going along with you, one, as a former teacher, I noticed that it was handwritten, and you have lovely handwriting, so you obviously have worked on that as well.
Thank you.
May I ask you a personal question?
Sure.
Okay, do you know how soon or when you might be able to get your child back?
So I'm currently incarcerated for 23 years. When my oldest child originally went into foster care, he only stayed in foster care for 5 months, and I got him back. My criminal conviction happened when he was 6 years old.
And then you say your older child, so you have 2 children now that are in the foster program?
So I have 2 children. My oldest child, who had experienced foster care in the state of Kansas, he now lives with my parents. He's not affiliated with the system in any way. My youngest child was in Illinois when I caught my case, and so he has actually been adopted in Illinois. And so I don't have rights to my youngest, which is actually pretty ironic. My rights have been terminated for my youngest, but I actually still have full parental rights for my oldest. He lives with his grandparents.
Thank you, and thank you again for joining us today.
Thank you for having me.
Michelle, thank you again for your testimony. I don't see any further questions. So again, thank you. Committee, at this time, we'll get back to our agenda. Now with us, going back to the presentations on requirements for becoming a foster parent and experience with the foster parent application process, Benita Gooch, private citizen experienced in foster parent application process, and Benita is with us virtually. Benita, welcome to the committee.
Welcome. Hold on. Yes. Thank you for letting me testify today, and I thank you, Senator Fosco for inviting me to participate. We were just having a casual conversation, and I mentioned my experience, and she asked that I share it with you. I don't know how important it is in the grand scheme of all the things that I've heard here today, and all the things that I've heard as a journalist myself over the years about the system and how tough it is on our children. But I would like to share it. You have my written testimony. It's just the fact that I really did want to be a foster parent.
Benita, I apologize, but we just lost you. Benita, are you still with us?
Yes, I'm here. I saw you all disappeared. I just kept talking. Can you hear me now?
We can. Thank you.
Okay, good. No, I just would say that in the scheme of things, I just know that there are parents like me, people who, and again, I refuse to be in this for the money. It was about helping children. It was about potentially becoming an adoptive parent because I had one child. I would like her to have a sibling, but it was just so difficult. And, after I got beat down one time, I got up the nerve to go back again and try one more time. And same thing. I just got so beat down and frustrated by all the things, that little minute petty things that I was being put through, that you give up. You try, you sit through 10 weeks of classes, first of all, and then there's another drag on, and that I heard people talk about the house visits, and it just seems that things they were looking for were so not the important things on how you take care of children and how you raise children, but that I have to follow and click off every little box. And yes, to some point, I understand you have boxes you have to click off. And I did some of those things, even though I didn't understand, like you have to have a first aid kit in your car. And I would question how many of them or how many of you have a first aid kit in your car that makes you qualified to be a foster parent. I mean, it's just these, and it has to have so many this size bandages and gauze. And I mean, this stuff is just so petty sometimes. But then, I'm just saying, it's just enough to turn off a lot of people. And I finally got told that I wasn't competent enough because I worked late hours, and my daughter, who would stay with me, I didn't send her off to sit or whatever. I keep her with me. She stayed at the office late at night with me. And she would do her homework while I'm doing my work. When she got past bedtime, I pull out her little blanket and pillow and put her on the sofa. And when I finish my work, we go home, and I get her up, and they say, "Oh no, you can't do that. That's not acceptable. You can't." Well, I raised my child, and I wanted to say she became a perfectly great adult, a great, great, great adult. And, what was wrong with that? But that wasn't acceptable because you can't wake up a child and move them in the middle of the night. So anyway, enough is enough. It's not that big of a deal compared to everybody else, but I would just say somehow you've got to figure out a way to look more at who these people are and their interests. And I mean, the other thing, just real quickly, wasn't even see how clean or nice your homes were. It was, did your home have ADC? Because I've seen foster homes that were so dirty that I wouldn't have let my child live in them. And I know people who work in the system and they've had to pull kids out of these homes because they were so dirty, but they got passed. And how did these people get passed, and approved, and others like me can't? That's all. Thank you.
Benita, thank you for your testimony. Committee, do we have any questions? Senator Foscato.
Thank you, Mr. Chairman. Thank you, Benita Gooch, and thank you for taking your time to share with us. And this is, can I share who your dad is?
Oh, yeah. Go ahead.
Okay. So Benita Gooch's father is Senator Rip Gooch, the seat that I sit in now, and her nephew was Chief of Staff, Kerry Gooch. And so Benita, the question, and she's a publisher of a local or statewide newspaper now, the Community Voice. So when you shared with me, and this is the first time I've ever seen you emotional, you're a tough person, and I actually can feel your testimony here today. When you shared with me that you tried 2 or 3 times, I believe, to become a foster parent, we know that our colleague, Representative Gail Finney, who we all know became a foster parent, and she shared all the hoops she had to jump through as well. But when you shared that the main reason that you were rejected was because of after-school care for your daughter, who went on to do great things. You have a wonderful young daughter, same age is my daughter, I believe. But you said the after school or daycare, when they ask, what will you do with your daughter when you are the foster child? You said, well, the same thing that I do with my daughter. And so just for the committee and those listening, share just the atmosphere, because I've been in your office several times and it's like a home in there. You get take a nap and eat and you've got everything in there. And so you explain that, just give us a better visual of what that looked like. And yes, thank you, Mr. Chairman.
Well, no, I mean, we had everything we needed to be there in the evening. I mean, we have TV if she wanted to watch TV, but she had to do her homework. We ran it just like home in the evening if she had to be there. And then, but if I wasn't finished, the idea that she could just, hey, get a little pallet. We had a sofa. She'd sleep on the sofa. At one point, we actually had a bed. But she would sleep on the sofa and I'd get her up. But the problem was, they said, was waking up this child and making them move in the middle of the night was unacceptable. So, but it wasn't that we didn't have everything. It was just the fact that you weren't supposed to do that. And that wasn't allowable. So, again, it worked for her. And I guess, but sometimes parents have to do what they have to do. And it wasn't like she was getting hurt. She wasn't being kept by somebody who wasn't safe, who wasn't approved. She was with me the whole time. They would have been with me the whole time. I don't know why that wouldn't have worked.
And thank you again, Benita Gooch. Mr. Chairman, and those listening, this is, whenever I'm in these committees and I hear that African-American people aren't willing or don't want to be foster parents, yes, they do. And then the other issue, Mr. Chairman, and those listening, is that I'm a single mom as well, of 2 daughters that's graduated college and doing well, very well, thank God. And so the single aspect, a single mom, I just don't get it. And so, well, you did a great job with Lauren. Thank you.
Yeah, and you have African American females who really would be great moms, but as a majority of us are single, more than 60%. So you're losing out a lot of us if you don't make some accommodation for some of the ways we have to function. And I'm just saying, if not this, it would have probably been something else. And there are probably just a lot of things in the way. Let's don't forget about the whole process too, but just so many little things seem to be tied up in the process that make it very difficult to be a foster parent.
Representative Carlson.
Thank you, Mr. Chair, and thank you so much for your testimony today. It's been very enlightening. The only comment that I have is that in my small town, which is very small, very rural, our city prosecutor, very successful young family man with 3 very successful children from probably 9 to 15, wanted to become foster parents. They lived just out of town, had a beautiful home, had horses, had dogs, had a pool, had a stay-home mom, very active in the community, very active in school. Their kids were all very successful in academics and as well as athletes. Just to mention that these are Caucasians. What my city attorney told me they had to go through to become licensed foster parents was astounding. I know these people. I know their children. I've been in their home, and it was like, okay, you had to have a plug thing in every outlet that wasn't being used. Right. And they were at their house so many times, and they had so many questions that finally he told me that they were almost ready to just say, this is not worth it. This is ridiculous. And yet I know another 2 families in our same town. One's a single mother. The other one is a single man, and they both became foster parents. I don't know what the difference is. I'm not saying they aren't good people, but for what the prosecutor had to go through and what these people went through are 2 totally separate things. So there does need to be some consistency in what we are doing to get foster parents, because it is just not, there's no balance. There's just no balance at all. And I'm very sorry because you had so much to offer. But it's not only single mothers, it's the system, and it's not working properly. So thank you very much. Thank you, Mr. Chair.
Benita, once again, thank you. I don't see any further questions for you, so thank you again for your testimony. Committee, now we will hear from Rachel Hillstad, private citizen experienced in foster parent application process, and Rachel is with us virtually. Rachel, welcome to the committee.
Thank you so much. Thank you so much for allowing my testimony. My name is Rachel Hillstead. As you've heard, I live in the Kansas City area, and my family and I fostered 73 children over the span of 7 years. We are one of those foster families who decided to light the proverbial match and toss it behind us and walk away. I've appeared on the Steve Harvey Show talking about mental illness and OCD, anxiety, trauma, multiple well-known podcasts, and I've written think pieces for the Huffington Post, CBS News, Scary Mommy, and multiple other media outlets. I was invited to the Missouri Capitol for a luncheon thrown by the First Lady to honor individuals who have been in many capacities influential in the foster care world. 20 years ago, I went into special education, teaching elementary students in the Center School District, and I had what my husband liked to call a classroom that was a very angry one-room schoolhouse. I had 6 children total, many of color, and there were 2 that were in the foster care system of Missouri. And I saw one of those foster moms, the way that she related to that child, the way that she reached that child when no one else could. really made me want to be a foster parent. My husband was not quite as excited at first. We had a daughter who had some pretty severe disabilities and had 13 surgeries by the time she was 2. Her twin brother had died at birth, and he thought we had our hands full. I, on the other hand, knew that there were so many kids who needed help, and we could help. Over the years, we fostered white, Native American, and African American children. The longest we had a child, only 6 years old, was for 19 months. The first night we had her, we were at dinner, and she explained to us that an adult in her home had used a glass beer bottle to sexually assault her. During the ensuing months, this child was forced by KVC, our agency, to attend weekly visits with this person, mom's boyfriend, who was not biologically related. Her mother was too drunk to show up to the visits. This child had been in 2 separate car accidents with the same caretaker. The police on scene told the caseworker at the last accident that this child was lucky to be alive. This child would have panic attacks and night terrors after the visits. And there was nothing we could do until the one day we decided to stand up to the system. I told this little girl's social worker from KVC that if she wanted to repeatedly force the child to interact with her abusers weekly, she would have to pick the child up and take her to the visits herself. I would no longer be party to it. Visits stopped. The child was only in care because one biological parent had taken the child from another, and hadn't told, mom had taken the child from the father and hadn't told the father where she was. The only reason the child remained in our care for 19 months was because the paperwork involved, ICPC, that's what other people have stated. That paperwork took 19 months. She's a happy teenager. We have contact with her. She's with her father. She's happy and safe with her parent, and that's all we can ask. Another child who was African American was put in our care, dropped off at a safe haven site by her young mother who did not know what to do. The child's father and paternal grandparents had been providing a faithful and loving home, but because the mother, once located, would not divulge the identity of the child's father, he was put on a reunification plan as well, and the wheels of the foster care machine were now rolling. Hardworking and dedicated parent he was, he could not get his own child back because neither of them had a voice. I'm sorry. This was years ago, and it haunts me. He was a Black man working 60 hours a week, making $8 an hour. And the state of Kansas still took child support out of his check to deliver to his mother, who, as you will remember, didn't have custody of the child. I held him in the McDonald's parking lot and we cried together. We helped direct this man to the services he needed, and I will add, we were white and wealthy, and we were able to help direct this man because we had the connections in order to do it. We helped direct this man to the services he needed in order to be reunified with his daughter. It was made very clear to us as her foster parents that, had we desired to, we would have been able to help facilitate termination of parental rights and adopt her ourselves. Well, there was a very capable parent and grandparents ready and willing to take her home. There is clearly a problem with the system, which is why we are all meeting. There's a scene in the classic movie The Matrix where Neo, the protagonist, there we go, is shown the seedy underbelly of the world that had, until that moment, made sense in his mind. It was a world he thought he understood. I'm here to tell you that once you've seen the matrix of foster care, as it were, you are never able to go back. The things we see in the dark are our responsibility to bring into the light where the shadows of bureaucratic apathy, social worker and foster parent overwhelm, and the trauma inflicted upon children for trauma's sake must be dealt with. Here are my 4 solutions that I was able to kind of process. Children's rights. The American foster care system is based solely around the rights of biological parents. The institution at its core needs a dramatic paradigm shift from a parental rights standpoint to a children's rights view. In foster care, children's rights are often in conflict with parents' rights by the very nature of the issues at hand. The child pays the price of that trauma and the cycle continues. And I couldn't help but be touched by Michelle's Michelle's testimony, because that cycle does continue. Time and time again, the behavioral, social, and emotional issues children develop and continue to have are a direct and debilitating result of the push for biology above all else. I would like to add that as foster parents, my husband and I wanted to foster, but we didn't desire to adopt. Number two, localize. The cogs in the machine become too numerous and redundant. I hear Benita say that she was given guff for having to work or having to have the children in after school care. I know several foster parents who had their children in after school care through KVC, and it was never a problem. So I'm not sure what the issue was there. We walked away from the system. Oh, goodness. Okay, here we go. We walked away from the system because one of our last foster children, my oldest daughter, walked in upon this child sexually perpetrating against my 6-year-old daughter, who then became a victim of the system herself. When I brought this up to the KVC worker, she said, I have no way to know that this wasn't something that this child learned in your home. We wanted to help her. Our record with KVC was stellar. In fact, after we decided we would no longer be foster parents, KVC contacted me and asked me if I would be a foster home retention specialist because they knew I had a wide reach with foster parents. I would talk about our experiences at the end of MAP class. I was a mentor foster parent, but I couldn't lie. I couldn't lie to people and tell them that everything was going to be okay and their own families weren't going to be traumatized and that they weren't going to be a part of a system that systematically traumatizes children. And that the fact that I was a part of that system, while we did a lot of good, we also helped to traumatize children. Effective third-party advocacy. A third party needs to be established that advocates only for the child's rights. The guardian ad litem system is one in which attorneys are paid for never visiting the child, foster parents or biological parents, but then showing up to court to collect a paycheck. Now, there are very good guardian ad litems, I would like to add. The majority, no. What if we went back to the drawing board and thought of ways to find people who were truly unbiased? What if this third-party system had the same sort of setup as a jury or jury service? Time limits, I know that's been addressed. There's absolutely no reason a child taken at birth should be allowed to bond, love, and be loved for 18 months to 4 years. Think that the foster parents or other placement are his or her parents for life and then be ripped away. And to Michelle's point, I do believe that the more you I do know that the more you localize, the more you can take cases in a case-by-case basis. If someone is making progress and gets out of prison in 5 months, let's use our own intelligence and social acumen to be able to decide in that case that that child is best off with the biological parent. I write online about our foster care adventures. I would like to add also that through our church, there were, I believe, 22 foster families that signed up to become foster parents. And then through my own advocacy, I've received messages from 63 people or 63 families across the United States that through my testimony and my writing, they decided to become foster parents themselves. I love that this is happening. Let's do this. Thank you.
Rachel, thank you very much for your testimony and for your time serving at least 73 Kansas youth or foster youth. I know it's a hard situation for you, but 73 kids had a loving home for a little while, so we appreciate that, so thank you.
Thank you.
Committee, do we have any questions for Rachel? Senator Foscato.
Yes.
Thank you, Mr. Chairman. Rachel, thank you so much, and I love your glasses. They matched
Thank
your
you.
background and everything. I just wanted to clarify, so in Benita Gooch's case, so she owns a newspaper, she's a publisher, and
Okay.
she has a huge office, a huge business there in Wichita, Kansas, and she actually wanted, just like she does or did for her daughter, who is, I think, 26 or 27 now, she she would have had to have brought the child back to her place of work. And then after school, and then when she was done at work and they've done everything she shared, then she would have had to pick the child up and take the child to her home in the evening. And usually she doesn't stay there past 6 or 7, actually. But that was her situation. Yeah. And then, Mr. Chairman, I did want to ask or share this or ask. So Rachel, yeah, you're Rachel, right?
Yes. Yep.
It's so many names today.
Oh, yes, I know. I know.
Rachel, thank you. So you mentioned the African-American man that worked 60 hours a week, $8 an hour. And I just want to make it clear to the committee and everybody who's listening, I'm not saying that this only happens to African-American children, but the majority of the situation that you describe does, of whereas there's a single black man who wants his children, but he fighting the system, he
Yep.
doesn't get them. And then could you elaborate, though, a little bit more on what you said by the 12-month period? A newborn is kept in with a foster family for 12 months. And then the issue of trying to reintegrate with biological families, are you saying that there should be that constant interaction? And in your, oh, I wish I could have went on Steve Harvey with you. Wow. But
That's great. I'll have
in
to
your
send you the.
presentations, do you talk about foster families that are just foster families for 3 minutes, 3 days, 3 weeks, 3 months, 3 years, and they are just foster families? And then the difference between foster families that also want to be adoptive parents. Do you,
Yes.
can you comment? Thank you.
Thank you. I do believe that there is a great benefit to, there's a great wealth of, not indiscrimination, I can't think of the word, and I'm a words person, but a great wealth of knowledge and impartiality, as much as that can be had, in families who only want to foster. Because in our culture, in our society, I think that and I see it a lot, fostering to adopt is seen as a goal. And I have friends who, I'm just going to say it, who maybe want to be the Brad and Angelinas of the foster care world, and maybe want to adopt one single Black child. You have to understand, I was raised on Rush Limbaugh. I was raised by very conservative parents, and the foster care world just opened my eyes to a lot of things. So I feel like I'm riding the middle line. But it was a conversation between my husband and I that we would not adopt one African American child, because I don't believe culture. Yes, someone talked about culture. It is so the two cultures, white and Black, Caucasian and African American. There are so many cultural differences that you don't realize until you are in the foster care system. For example, this little girl would come back from visits with grape soda and hot chips. Now I'm thinking, well, she needs an apple and milk. She had grape soda and hot chips. So could I go to the social worker and say these are unhealthy things for her to eat? Sure. Is that going to help her long term? Is that going to help her keep her bond with her family of origin? No. I feel like I'm divulging or I'm diverting from what you had asked. As white foster parents, I know that the hair, I did not realize how important hair is for African American women. And so we were lucky enough to have a next door neighbor who did our foster daughter's hair, and we just paid her to do it. There's so. What was your other question? Tell me your other question.
I'm sorry, Mr. Chairman, but you've kind of answered it, because over the years I just see the phone calls I get are from those who they've just ran out of time fighting to get their children back.
Yep.
And
yes.
part of that, they don't have the resources and so forth and so on. And so over the years, and I don't know, maybe DCF has implemented it now. I don't know. I got kind of discouraged. But today, Mr. Chairman, I'm encouraged with the presentations and the information, is that we have a system where when those come to be a foster parent and they go through the MAP program, that they are funneled to, I just want to be a foster parent. I want to rent, I just want to rent the house. I don't want to rent to buy the house.
Right.
So be funneled to foster to adopt, because that's where the battle comes, Mr. Chairman, is that the foster parent has the child, the single poor mom is working to get the child back, and they run out of time, and then the court says the best interest of the child is with the people that they are familiar with. And so that woman loses the battle. And then, Mr. Chairman, you see, I've been doing this since 2004, in the legislature since 2004, and I've been tracking families my own self. I've been keeping records, and the children funnel back to the family, to the black family, where they're back eating the hot Cheetos and great soda pop. They funnel back to them anyway. So why not foster or cultivate that relationship in the beginning? Let's do that.
Yes.
And funnel the children foster parent to adoption, just foster parent. Then you cut out all that other stuff. Thank you, Mr. Chairman.
I would like to say one more thing. I do see that racial disparity that you are talking about. And I also see, if they're black or white, if there is a child whose parents have been abusive and that black child is going to be adopted by a white family and all resources have been exhausted, that those parents are mom and dad. It's so nuanced. It's nuanced. So thank you.
Representative Johnson.
Rachel, thank you so much. How are the kids at school today?
They're doing great. They're doing
Thank
great.
you. Just like to mention that she is one of the best examples of SPED teachers I've ever worked with. Her ability to read children, their behavioral patterns, modify them with words and subtle controls is outstanding.
Thank
and I
you.
think the good Lord put me in the classroom with her one day, and we got talking foster care, and then she made me cry. Thank you, sir.
Thank you.
Rachel, thank you again for your testimony and for what you've done. And committee, I don't see any further questions, so I'll direct your attention to written-only testimony from Scott Hendricks, Director of Permanency for DCF. We'll now move to our next item on our agenda, the overview of best interest staffing. Our first conferee is Tanya Keys, Deputy Secretary for Children and Families. Tanya, welcome back.
Thank you so much, Mr. Chair and Committee. It's good to be back. Thanks for an opportunity to provide a little bit of detail on the policy process with regard to best interest staffings. I do have two colleagues that follow with some additional information. Just a bit of background. When the case management teams are working with families, all efforts start with reunification. In fact, about over half, 57% of children are reunified. There are times when that's not possible. The goal changes to adoption, and parental rights may be terminated. When that happens, then the child becomes available for adoption, and that starts some of the processes that you're going to hear about in this testimony. In the past 3 years, there's been an average of about 1,000 adoptions, and you've got that information for you on page 3. Almost all adoptions are finalized with either a relative or a foster parent. And foster parents are about 57% of all finalized adoptions. There are some differences by age that I just wanted to review for the committee, and you've got that in Table 1 on page 4. For example, for children who are age 0 to 3, so those toddler age or younger, of the adoptions that we had most recently, last year in 21, over 800 adoptions, 2/3, 63%, were by their foster family, and then about 1/3 with the relatives. So that gives you a sense of what that table is showing with regard to the relationship of adoption. So some differences by age. I'm going to talk a little bit about the policy pathway for the best interest staffing. And we've got a flow chart a little bit that I'm going to go through in a second. When a child's available for adoption, a best interest staffing is considered for all children. Depending on some circumstances, the actual best interest staffing meeting may be waived. And there's a few circumstances that can contribute to when that meeting can be waived. I'm going to go ahead and get you guys, if you want to follow along, on page 7 with a little bit of a flow chart. I'm going to talk about the left side first, and this is the first question that we ask when a child's available for adoption is there only one adopter? If that's yes, then it takes a path, and it takes a path to consider whether or not the actual meeting can be waived. To think about whether or not the team can waive a best interest staffing, they think about, is a child placed with a relative or a foster or a kin? And if not, were relatives explored and searched? And how long has that child been living? Have they been there 6 months? Those are the 3 considerations. If those are all true, then yes, they can still consider to waive the best interest staffing. The case team is sort of sent a communication and saying, hey, does anyone object? You know, we have these things in place. Does anyone object to waiving the best interest staffing? They get that answer. The path can be no one objects to the best interest being waived, the staffing being waived, and they go forward and select. This pathway on the yes, on the left side, is about half of all adoptions, just to give you a sense of the percentage. There's another path, though, where the best interest staffing might not be waived. So if there's more than one prospective adoptive parent, if the answer is no, that there's not only one, there might be 2 or 3, right? So it takes a different path. So the case management provider prepares some packets, provides the packets to the team. Our policy sets out who is part of the best interest staffing team, and you have that information on page 8. That team, who's the best interest staffing team, receives the packets. They have an opportunity to ask any questions in advance so they can keep that process going. And then the meeting occurs. At the meeting, the case management agency presents information on the child because the goal of the team is to really select the prospective adoptive parent that can best meet that child's needs. So they present information on the child. There's a worker for the families who are prospective adoptive parents, and they present information on each of those prospective adoptive parents. The team may have additional questions that they need to get answered, but if not, they also may be able to reach a consensus process in that meeting to select the best adoptive parent for that specific child. There are some timelines that we have there for you so you know when those timelines are made. There is an opportunity for the prospective adoptive parent who is not selected to be able to request a review of the decision if they're not selected and they wish to request a review, and there are procedures in place for that as well. I think my colleagues will speak to their experiences, so I'll stop and I can answer questions now or after the complete testimony on the process.
Tanya, thank you very much for your testimony, and for the sake of time, I think we're going to go ahead and go finish with all conferees before we open up for questions. Committee, next is Danielle Bartelli, LPC, former case management worker for Call Valley Center, KVC. Danielle, welcome to the committee.
Thank you for the opportunity to speak today. I did want to clarify that I am the Vice President of Operations with KBC. We do have a caseworker that will testify right after me and talk about her experience, but I did want to talk about just from the perspective of the case management provider what a best interest staffing looks like. I've been with KVC now 21 years. I've overseen the adoption program that we've had since about 2008. So I've seen a lot of adoptions come through. I've also seen a lot of really successful reunifications and just truly love this work. I did want to highlight too that KVC has just reached a milestone of 5,000 adoptions since we started adoptions. So we have successfully matched 5,000 children with adoptive parents. And within the last year, 95% of those children have gone to either the foster parent that they've been placed with or a relative. So somebody that knows and loves them, which we think is really important as well for those children to keep a consistency. As everybody knows, every child, every family is very unique. One of the things that we talk a lot about at KVC is that the importance of maintaining connections. We try to encourage all of our foster homes to obtain a connection with the biological parent during the reunification process, and even if the process moves into adoption, we still want that connection to be maintained because we know a lot of children will seek out, even when they're adopted, will still seek out biological family. And so when foster parents that do adopt have that connection already, a lot of times those questions can be answered easily for the child later on as they start to develop those questions. So we have our adoption team. We have specific workers that work directly with just kids that are legally free for adoption. They work with prospective adoptive families. They're able to educate and help encourage and talk about the importance of those connections. And they do that throughout the period. Adoption, as you all probably have heard, in foster care is not the fastest process. There's lots of paperwork. There are courts that are involved. And so there's time to be able to really educate the person adopting that child on what that process will look like and the length of time and other things that will be important as that child ages in their home. So we do really encourage foster families and relatives to maintain those important connections. over the last several years, there's been multiple changes to the best interest staffing process. Ms. Keys did highlight one, which was the best interest staffing waiver, which has been really fantastic in not delaying the adoption process, which lessens the anxiety for the child and for the adoptive family during the process. So that's been a wonderful change. Another change is prospective adoptive families are now able to participate in the best interest staffing during the time that their family is being discussed. That's been so helpful because when you're sitting in the meetings and you're reading the information from the paper, just reading a family, there may be questions that come up, and then that family can speak about themselves right then and there and get those questions answered. In the past, we would have had to kind of delay, write our questions down, reconvene the meeting again, and then come back with answered questions after those have been clarified. So that's been really helpful too, to have those families there to participate. They don't participate in the discussion piece. They don't participate in the voting piece. We also, I think Ms. Keys also mentioned that the best interest staffing team really takes their responsibility very seriously. We try to get as many people in the room as we can that know and love that child so that we can make the best decision. CASAs are involved, guardian ad litems, therapists, teachers have been involved, neighbors of children. So we really try to get as many people in the room as we can that know that child so that we can have a really robust and important conversation about that child. But as you can imagine, if there are multiple families that want this child, someone is always going to be sad. Someone is always going to be disappointed that they weren't chosen. And so there is always that discussion with the family that wasn't chosen. And again, this becomes an opportunity for us to talk to the family about if there was a connection with this other person, how can we maintain that connection for the child moving forward? How can you guys continue contact with that family? Can this be a new aunt and uncle for the family? I think it sounded like ICPC has been brought up, so a lot of times when we have relatives living out of state, we can't place the child with the relative right away because the reunification process would require visits and coming into the state, and so we have to hold off on placing with the relative, so we place them with a foster home for temporary placement. And then at that best interest staffing, that relative comes forward and still wants to be considered for the adoption. And if that family is chosen, we want the foster parent that has had this child over the last several months, years, however long, to still be able to be involved in that child's life. So it really is a very big decision. A lot of things are considered. The system isn't perfect. I will be the first to admit that over the last 21 years. But I do think the best interest staffing process has seen lots of success for children, and there's always room for improvement, but really the best interest staffing process has really made an impact on multiple children throughout my time at KVC. So I would like to introduce Carolyn Soper. She is a caseworker. She recently became an adoption supervisor, but she was a adoption case manager for many years. So I'm going to introduce her.
Carolyn, welcome to the committee. I apologize, we don't have you on our agenda, so if you would go ahead and again repeat your name and who you're with.
Thank you. My name is Caroline Soper, and I am an adoption supervisor at KVC Health Systems. And I have worked previously as an adoption case manager with KVC prior to that. First, I'd like to thank you all, Senator Hildebrand, Representative Concannon, and members of the Joint Committee. I want to thank you guys for listening to my testimony today as a caseworker and now as an adoption supervisor in the state of Kansas, my experiences regarding adoption in child welfare, and my experiences specifically with the best interest staffing. Like I said, my name is Caroline Soper. I currently work as an adoption supervisor in Topeka, Kansas at KVC. I have worked at KVC since May of 2014 after graduating from the University of Kansas with a degree in social welfare, and I am a licensed bachelor's level social worker through the BSRB. Throughout my time at KVC, I've had the pleasure of completing around 40 plus adoptions and participating in an estimated 60 plus best interest staffings. They're some of my favorite things to do because I get to talk with families more on a question-to-question basis, and the community partners involved in the meeting get to meet, sometimes for the first time, the families that are interested in adopting our children and get to hear from their perspective of how much they love our kids, which is always so special. Today, I'm going to discuss the best interest staffing through my social work lens. So when thinking about the best interest staffing, there's a lot of preparation that can be involved. That includes prepping the families, preparing myself, and prepping the child or children that are the ones that we're all here for during that meeting. So I receive children on my caseload when rights for parents are either terminated or relinquished, and the child is going to be legally free for adoption. Sometimes children are already in relative families, sometimes they're in foster families, sometimes they're with non-related kin, so family members have friends, it could be them. But I generally give families an overview of the best interest staffing process, and the adoption process as a whole from beginning to end, and I give them a timeline of what it could look like. My fastest adoption has been about 6 months, so I give them that hope, and then I say sometimes it can take quite a bit longer depending. Once a family has completed the home study and it's time for the best interest staffing, I again reiterate what the best interest staffing is, what the purpose of it is, and whether or not it can be a best interest staffing waiver or a formal meeting. Both Danielle and Tanya were explaining previously what that looks like, and so I'll explain that to the families. And I explained both, whether they are going to be a best interest staffing waiver or a formal meeting, as a way to provide transparency to the families and to mitigate any questions or worries or concerns that the families might have. At this stage of a child's case in child welfare, a lot of the families, from my experience, have been very anxious to get this process over with, to finally have the child or children in their home viewed as their own children. And honestly, they've been burned sometimes by other case managers or the system itself. So I get to be part of the fun part of foster care sometimes. So if the best interest staffing is going to be a formal meeting, I go through the following steps. I explain why we're doing it, what's the purpose. I give a brief description of what questions we ask the families, and I explain how it's a standard set of questions that we ask every family, and then the meeting members may have more that are not listed in our documentation. I also explained to families that these are questions they've already answered in the home study, so that there's less anxiousness again with what they're going to have to come to prepare for the meeting. If there's more than one family that we are wanting to take to a best interest staffing, I really emphasize my role as being the unbiased party that is solely there for the best interest of the child, as the child is my client. Especially also if I have a working relationship with one potential adoptive resource more than the other, that can be very anxious for both parties. And so that explanation of being unbiased and showing that is really important. I explained that it's not clouded. The decision of who will be picked as the adoptive resource is not clouded in my opinion. It's based off of facts. It's based off of what we see when we're in the homes. And if if it qualifies, what the child feels and what the child wants. I also explain who can be part of the meeting. I explain who comes up with the recommendation at the end after either one or both parties' home studies are talked about. And I explain the timeline of what this whole process itself of the best interest staffing looks like. Now, I also go into, with more than one family, how they would like to be told, not really great news. I had an experience myself when I first started working where I had to tell a foster mom that she could not adopt the child that she had in her home for 5 years because a relative was chosen instead. And let me tell you, it was not a great phone call. I could have prepared better, and now I know. And what we all know is we need to have, no matter who we're telling, a community around them for support. So I tell them, in case there's news that you're not going to want to hear, how would you like to be told? And so in more recent examples, I've had families with COVID, we've had a phone call or a Zoom call with people that are in their support system, and then we're able to tell the news that way. And that's worked a lot better, and the families are feeling more supported with the prep in the beginning. And I share that for if they would like to be told the good news. So no matter what, they're not anticipating good or bad news. They're able to expect what's going to happen. Things that I do to prepare is I read the home study that's written on the family or families, and I take notes. I'll highlight, I'll pick out, since I know the questions, I'll pick out answers that fit those questions. That way, when the families are asked those questions, if they get confused or they don't have it in front of them themselves, if they need help, I am able to answer those. And I'm able to give my perspective on what I see if the child's in that home already, and able to provide my support or just my inclinations of what I've seen in the home. I also will pull information on the child. So there's a section at the beginning about children and their strengths and their needs. And so I will pull that information from the records from what I have seen in the child when I see them in the home and gather that all together to be prepared. Now, not only do we have to be prepared, we have to prepare our children. And those conversations begin as soon as we get them, if possible. Now, we want to communicate adoption to the children within their cognitive ability, so not necessarily what age they are, but what their brain age is. Sometimes we have children who are 14 and older that may not be able to have the grasp of what adoption is and may be at more of like the brain age of a 3 or 4-year-old. And so I am very cognizant of that and make sure we're explaining adoption in a way that makes sense to them. And that can include what the kid wants in a family, what the kid likes in their current family, what they, would they want 2 dads or 2 moms, or would they want a big yard or a dog? We ask all of these questions. And when we have teens who are their chronological age of like 14, in my experience, I've had just a few teens, but I will be very, very transparent and honest with them about what this process looks like. And I'm very adamant about listening to what they want out of their life. So it can be really intimidating for a child to be part of this process. We allow our children who are 14 and older to be part of the meeting. Not a lot of children, in my experience, want to be in a room full of grown-ups explaining what they want in a family. So I explain the purpose. I explain that this meeting gives the professionals of the case the opportunity to look at an adoptive resource more thoroughly and have them get to know each other if they're not in the home together already. And it gives us the permission to continue to move forward and enter this transition. I explain the teen their role in the meeting, and I also give them options for how they would want their wants and their needs to be expressed. So in my experience, I've had children who want me to be their spokesperson. So in some cases, I've written down what I would say about the child, and then I've read it to them. And then if they told me that they wanted me to say something else, I would change it for them. Which goes into the meeting questions they cover and what they cover. We want to address the strengths of the child first and foremost, because every child has strengths, every child is good, and we want everyone to know that. We explain the challenges and the needs, so what the family needs to be prepared for, what the family will need in terms of mental health services, education, and so on and so forth. The questions also cover what if the child has any bond with the potential adoptive resource and what that looks like. We want to know that the resource has the ability to meet all of the needs of the child that we explained earlier. We also want to recognize the grief and loss that a child can experience through adoption and through losing their biological family, as well as acknowledging the trauma the child has already been through and may still go through while we finalize this adoption. We also want to emphasize the background of the child, whether that be different racial, religious, or other factors that make up this child's beautiful story, and what makes them that way later on when they're in their teens or even maybe earlier and they're asking who they are. We're able to provide that and help them figure out who they are. I also want to know how they're able to provide a safe, loving, and nurturing home to the child, and what evidence they have to support that, which can come from my perception of the home, if they're in the home already, or through the home study itself and their own testimonies. We talk about how they've already advocated for the children or other children around them in their community. And then also how they're prepared to make a lifelong commitment to our children, because that's going to be the most important thing for me to know. I want to know that a parent is going to be a parent for the rest of their lives, no matter, and honestly, regardless of if their behavior increases, their behavior changes, or stays stagnant, will this family love this child no matter what? So we'll go through all those questions, and at the end of the family portion of the best interest staffing, I remind them of the next steps. So I explain the timeline of sending our members a recommendation for approval to our director. I reiterate the prepared plan of communicating our decision to the families and see if they want to change that at all. And then I give some brief information on the next steps. So if they're approved, they're able to then read the child's file, and then we can go from there. And again, the purpose of explaining these things to the family is to help promote transparency so that they know what's going to happen next. And it helps, from my experience, just with their anxieties of what to look forward to, what to expect, things like that. With the changes that the best interest staffing process has had within the past couple of years, I've seen a lot of just improvement in our timelines. I've also seen a lot of relief to our families as well, with the ability to waive the best interest staffing, or a lot of families feel excited after sometimes the best interest staffing because they're able to finally explain to others and other professionals how much they love the child or children in their home. And then as well as what's also nice about this new process is these families are getting closure, and these children are getting the closure that they need and they desperately deserve. Next speaking, we have a foster family who has just gone through the best interest staffing process and is going to give her testimony on how that experience was for her. Are there any questions at this time?
Caroline, thank you for your testimony. We're going to hold questions until all the conferees have had an opportunity to give their testimony. Committee, next we have Abigail Barnhill, an adoptive parent experienced with the BIS process. So Abigail?
Thank you all very much.
Abigail, welcome to the committee.
Thank you. Good afternoon, Senator Hildebrand, Representative Concanon, and members of the Joint Committee. Thank you for allowing me to be here today. It is an honor to speak with you about Kansas children and how foster families partner with agencies and organizations to find permanency for children in care. My name is Abigail Barnhill. My husband is Lieutenant Matthew Barnhill, and we've been married for 13 years. 3 years ago, we had no children. We went from a very career-focused and organized life with no children to the most beautifully organized chaos with 7 children in just 2 short years. Reintegration was not an option for any of the children who came to our home. Our eldest has been adopted, and we are in the process of adopting the rest of our children. This includes a biological sibling set of 5. I am here to speak to you today concerning our experience with the best interest staffing portion of the adoption process. How does the best interest staffing process work? A group of individuals making up the best interest staff meets on a weekly basis to provide one another updates on the children that are candidates for adoption and their potential adoptive resources. That part of the process takes place while other necessary processes in the progress of the process in the home takes place, such as home studies, background checks, etc. When the end stages of the best interest staffing would come to a close, the finality would be the interview process, where the staffing board does just this, interviews the hopeful adoptive resource. The adoptive resources sit for a reviewal under these individuals. We answer questions pertaining to our immediate and long-term capability and capacity to care for the children. We answer questions as to our intentions concerning the adoption, our beliefs, values, parenting styles, religious beliefs, our health, our financial stability. We answer questions that satisfy the best interest staffing board's need to know that we truly understand our children and what they require from us, both immediate and long-term, when looking at their physical health, mental health, academic success, and special interests. Can we support and cultivate all that they need? Are we ensuring that we have children that not only have survived their previous pasts, but will survive in the future? Can the individuals who make up the best interest staffing see it, hear it, and feel it, that I love my children when they are in my presence as I advocate for my children? This time together with the best interest staffing is important. I've heard many folks, most folks, and too many folks mislabel this process as a bunch of people who don't know them and don't know their child making decisions for them. Maybe they do not have an educated understanding of the process. This is not just a snapshot of time in a room. It is more than that, and it is the finality and finalization of a long process. Many individuals who know the families and children have come together with others who don't know the families intimately. They come together for a non-biased committee. Keep in mind, though, that they receive information from us. Fight for your children. Who is invited to the decision-making process? Caseworkers and managers from the agency of the child that they are placed in, Casa, if involved, individuals from DCF, the child's guardian ad litem, adoptive family workers, and to my understanding, therapists could also be involved, and then children if they are appropriate in age, and then the adoptive resource. To what extent are foster parents or family members of the child in custody included in this process? I believe that would depend on the workers and the family. Our family has had workers incredibly committed to our children whom we've built strong relationships with. I am in constant contact with them to provide all involved updates, pictures, full transparency on incidents, fact-based evidence on outcomes of treatment and academics, information upon information. Then they have everything they need to use for the decision-making process, not fully relying on discernment with no information. Our family has been 100% included because we advocate for our children and have made ourselves a partner with the agencies and professionals who are also working for our children. Suggestions and recommendations for improvement. As a whole, I only have good to speak on this best interest staffing process. On occasion, poor record keeping and negligence with records has hindered process, which is incredibly disappointing and unacceptable. When this has happened, KVC has addressed it swiftly within itself. However, they cannot control other judicial institutions. Caseloads being smaller would significantly improve processes. Smaller caseloads frees caseworkers and adoptive family workers to provide a higher level of care to each child and family. Smaller caseloads would free them to get to know children and families more intimately, commit to gathering information on a deeper level of research that only time can allow, and free them for accurate record keeping. Smaller caseloads creates an environment of less stress for caseworkers, which would produce better outcomes. I understand significant factors are at hand and changes would need to happen to change the child to worker ratio, and that is a conversation for another day. It is important to note today, however, that this is an important and imperative improvement to be made. Wait times, communication, turnover, and repetition of information given would all be improved. Families can improve this process by being a positive advocate for their children, getting as much information about them as possible to those making decisions for and about them. To the best interest staffing panel, they cannot make decisions for families and children without information. Potential adoptive families need to be in the habit of giving a weekly or bi-weekly, concise yet informative driven report about your family and children. Speak to their limitations and celebrate their successes. Give those making decisions in the best interest staffing everything they need to make fully informed determinations. Educate yourself on the resources available to you and advocate for your children. Thank you for having me here today.
Abigail, thank you very much for your testimony and for your experience. Committee, at this time, we will open up for questions. I have one quick question. You referred to your husband as Lieutenant Matthew. I see him there. What is he a lieutenant of?
At the Shawnee County Department of Corrections.
Oh, thank you very much for what you do, Lieutenant Matthew. So, Senator Reichman.
Thank you very much, Chairman. I think I'd like to address this to Carolyn, if you wouldn't mind. Is she still here, isn't she? Okay. Good. Thank you very much for coming and trying to explain the process, which is very long and delicate, and there's always going to be some people who are going to be disappointed however it goes. About a month ago, I was talking to a constituent, and he was thinking about being a foster. Well, his wife was one of the foster parent, but he said he didn't want to get involved because the attachment process of someone else going on, of losing that child or whatever. It reminded me when you talked about the lady that had the child for 5 years and then somebody else came and got it. So those two questions I'd really like to ask you. Number one, how did you come up to the decision for one that was in there for 5 years? Why did they lose it when they asked to become that parent? And number two, how should I respond if someone wants to be a foster parent and they may lose it? And I did notice that one said, well, maybe you could be an aunt or an uncle or so on and so forth. So those are basically my two questions, and thank you.
Thank you. So to address your second question first, I would say that the purpose of foster parents is to foster a relationship between the child and their biological family. And so if someone's interested in being a foster parent, I would say to call their local foster care agency and just take a class. We require foster parents to take MAP classes for their licensing. So I would recommend starting with a class, but also acknowledging that like what's going to be their purpose in fostering. Are they wanting to just adopt a child, or are they wanting to foster a relationship between a child and their family first? which leads into your first question of how were we able to do that and why did that happen in the first place? In regards to this situation, a lot of balls were dropped, for lack of a better term, and in general, the child should have moved to this relative like 2+ years prior to this meeting. This relative had been advocating for more visits with their relative, with the child, advocating for this and that. And they had an approved ICP, it was an ICPC case, so they had an approved home study. They were a licensed home themselves, and they were a relative to this child. And so we also wanted to take into consideration the racial aspects of and the dynamics of the case. This was a black child in a white family, and her relative is also black, and we were also concerned with what might happen when the child was 16 and wondering who she was and who her family was. Now, that's not to discount the wonderful and beautiful family that the foster family was and is to that child, as they created such a wonderful bond with that child and gave her a loving and nurturing home. It was not an easy decision. It was very difficult until the last minute. And what we had to do was, how are we going to do what's in the best interest of the child, no matter how awesome this foster family is, when we could be placing with a relative as well.
Thank you, thank you.
Representative Humphreys.
Thank you, Mr. Chairman. You can say, I do have a question, but Tanya, just a quick question for you. When you were doing your presentation and we were looking through this, you said, I put down these timelines, or you referred to timelines, and I didn't see that anywhere. Could you just point those out to me in your testimony? I thought you said timelines.
Thank you. Yes, there are timelines on page 7 of 8 in the bottom 3 flow chart boxes that speak to the timelines for which that best interest staffing team needs to reach a decision, 3 working days, also timelines to get back to folks when they've requested a review within 5 days, et cetera. So there's some details on timelines. Those are policy timelines.
Okay, that's super helpful. Thank you. Okay, so my question is, how long does the best interest staffing usually take?
Usually takes between 1 and 2 hours.
Okay. And then who makes the final decision?
Great question. So I'll answer that in layers. In general, the voting members, I would say the more recommending members of that process are KVC, so the case manager and the supervisor. It is DCF, the DCF liaison assigned to the case, and it's the child guardian ad litem. We also include Casa as needed, and we are able to have them give their opinion. So let's just give an example of one family, and we find them appropriate, and we believe that they should be the adoptive resource for this child. We send up that recommendation to our adoption director at KVC. Her name is Jenna Brown. She either approves that recommendation or she'll deny that recommendation. Now, I have not had cases, I've maybe had 1 or 2, like a year or 2 ago, maybe, that were denied by Ms. Brown, but those were different circumstances, and we had the home studies that we had there, it was needed to deny that instead.
So the decision, though, is it like, has to be unanimous? Okay, there's 5 people involved, it's 3-2, we're voting yes on this family. How do you do that?
Yes, so it's a unanimous decision. So everyone has to agree. Now, if not everyone agrees, we have to come back within 3 days of that initial meeting and then make a decision from there. If after that 3 days we still can't get a consensus, then it is up to KVC to make that determination.
So KVC has the final one vote?
Yes.
Okay, and I'm trying not to fixate on the fact that a child lived in a foster home for 5 years.
Sure.
And then you didn't place that child. I think it's outrageous. And I'm appalled that that was the decision. I know I don't know all the facts, but the science of attachment, there's science there, and I believe children want permanence.
Right.
And it really doesn't matter if they are blood related to them or not. And I will just stand and say, I'm flabbergasted, and I know that's not all the decisions you make, and I don't want to fixate on the one, but the fact that race had something to do with it after that child had lived in that home for 5 years is also, well, it's personally offensive to me since I have adoptive children. And I guess I just want that to be on the record.
Can I speak to that too? I'm sorry. As part of my other testimony.
It's up to you.
Would you like
Danielle?
me to speak to that at all, Heather?
Danielle, you're more than welcome to come up. And
I just wanted to just address.
you might hold off until you get to the mic and state your name and who you're with.
I'm
again,
Danielle
please.
Bartelli again. I'm with KVC. I just want to speak a little bit about the process. I think a lot of times these things come down to it's just KVC making these decisions, but we have court processes making decisions for us, against us, with us as well. And sometimes those decisions, we try to, the family, we're having as many visits as possible. It's not as if that child didn't know their family or feel just as comfortable in that home as they did their foster home necessarily, but they had siblings over in this other area. They had lots of extended family in this other area. So it comes down to lots of information and not just race and not just the fact that they've been in a home for 5 years. That's why I wanted to talk about, especially in ICPC cases, it becomes very difficult, and we want as many visits as possible between that relative and that child. And there was some, there are other people that make decisions in that process regarding placement, and so it isn't always solely KVC making some of those 5-year long.
And I understand that, of course, it's more complicated than it seems. I understand that. But you said yourself, we should have done that 2 years ago, but you didn't. And so now it's 2 years later, and that child has been living in the same home for that much longer. And so I've talked to attorneys and different psychiatrists and psychologists, a whole realm of people about the science of attachment. And y'all know, I've brought it up many times in these meetings, and we just are going to have to do something about it. I feel like statutorily that it is something that the judge will have to look at when they're making the decision. So I'm not getting on you personally, but I just had to let my views be known that it's something that we're going to have to address.
Sure.
Thank you. Thank you, Mr. Chairman.
And Danielle, while you're up there, I guess that brings a question from me is, if the kin was in the process of wanting to adopt, what were the circumstances of why that child was not in with the kin as a foster child from the beginning, and why was that child into a foster care family for 5 years?
So I can't speak specifically to this case because all the cases have complications throughout the time period. But ICPC is a barrier to placement. Anytime we have a relative that's out of state that wants to be connected to that child, the ICPC process can take anywhere from 6 months to a year to get any type of approval. And then we also have, like Bonita testified to hoops that they have to jump through, and cultural things, and poverty levels, and things like that. So sometimes that ICPC isn't approved right away, and they have to jump through more hoops. So we did hear Benita talk about that. That's the same type of scenario that happens across the state lines for other relatives. In Missouri, they have to become licensed. We did just recently get a border agreement so that we can now place without an ICPC, at least across the state line to Missouri, which is extremely helpful because Missouri is a bordering state, obviously, and we can facilitate transportation for reunification during that process, and then that child's already placed with the relative. But ICPC has been, it is a problem for adoptions, and I completely agree with the attachment.
Is that ICPC hurdles, are those federal or state? Because each state's different regulations and rules, or?
Federal, right, ICPC? Sorry.
ICPC regulations are federal, but states have their own operations, their own resources, and how they manage their interstate compact. There are some modernization of an information system that is used to help reduce timelines and examples of border agreements between different states, but it's based on federal policies, but each state has their own team at which they process interstate compact requests.
Representative Humphreys.
Thank you, Mr. Chairman. I appreciate that. I've done several ICPC adoptions. It has taken anywhere from 1 to 10 days to do it.
To do a home study?
No, to do an ICPC adoption. The home study was in place. So yeah, you have to get a home study. That can take a month. I know the limit. I know how the time limits go. And when you're an agency, it may be a little bit different. But I'm just not buying 6 to 12 months.
I'm talking about the part to put the paperwork in. You have to send a whole packet, a social.
I know the packet.
Okay, and then the other state has to come to the home, do the home study, and then it has to come back to Kansas. I have never had one.
Well, the home study was already in place. I mean,
okay.
in the ones I've done, the home study was already in place. So I understand that can take some extra time. But when everything is in place, Kansas and the other state will do it in a day or in 10 days. I've had also happen. So I just would like to make that clarification.
And not necessarily placement.
It could be. So
I mean, Carolyn might be able to speak to that happening and within 10 days. I have not seen that happen, so that's fantastic.
I couldn't speak till.
Thank you, Mr. Chairman.
So for newer members of the committee, if you would like to briefly, keyword briefly, explain the ICPC or ICPS process. I don't know if I had that right acronym there, but
It's okay.
somewhere on it. Go ahead.
Yes, so ICPC.
Please restate your name.
Oh, yes, sir. My name is Caroline Soper, and I work for KBC. The ICPC process, it refers to interstate compact. So it allows us to place children outside the state of jurisdiction into another state for the purposes of placement or adoption. So there are different types of ICPCs that can be involved in the process. There is a Regulation 7, which expedites the ICPC process. It's court ordered and can be given, it can be ordered for relatives in some circumstances. There is a adoption ICPC, which gives it for the purposes of placing a child in the home for adoption. Now, there's the actual placement ICPC, which can be the Reg 7 or just the standard. I believe it's a Regulation 2. I could be mistaken. But that can place the child in the home. It doesn't give us the opportunity to therefore use it for the adoption we would need the adoption ICPC for that per regulations, but it gives us the opportunity to place the child in the home. From my experience, I've had at least 5, maybe more cases on an ICPC, and the timelines of things can range from the minute I can finish paperwork and get all of the necessary documents to getting the approved home study. It can be 2+ months. It requires us sending the paperwork to our liaison, who sends it to DCF, who then sends it to the receiving state. And then that receiving state has to gather that information, contact the family, and then complete the home study from there. Now, that home study is like a home study in Kansas where they create the home study, it goes back to their supervisor for corrections, and then they are able to approve it, and it takes time to get that to us. In terms of adoptions, we also need what's called concurrence from the state the child is in, stating that that state is in approval of the child being adopted in that home. A lot of the states require a 6-month minimum of that child being in the home before we can receive that concurrence from the state.
Caroline, thank you very much. Representative Reese.
Thank you, Mr. Chair. This question is for Danielle or Caroline, either one can you answer. When you have the meetings with the family to determine, if a child is going to be adopted, are interpreters supplied and brought in, or?
Yes. Yes.
Do you contract with like certified interpreters?
Yes, we do.
Okay. You don't use like bilingual staff?
Unfortunately, we do not have a lot of bilingual staff. And in my experience with families who are bilingual or need an interpreter, we make sure that those are properly utilized and that we're getting who is actually going to be helpful to our families.
And do you have forms already translated, or any kind of forms that you have to use?
We have some forms translated in Spanish. Not all of our forms are translated into different languages. In a case that I had where a grandparent is primarily Spanish speaking, what I did was I provided the paperwork or the documents that were being reviewed to the translator, who then read it out to the family, and that worked.
Okay, thank you.
Mm-hmm.
Representative Esau.
Thank you, Mr. Chair. And I just have to echo what Representative Humphreys said. I can't get my head around 5 years and then you place a child with another family, and no matter how many mistakes were made along the way and balls dropped, that child was bonded with their foster care family. And if we are doing this in a child-focused, what's best for the child, I can't even comprehend it. So she said everything I wanted to say in that regard, so there's no reason to repeat it. I have a question, though, that's not exactly related to that, and I hope I can phrase it in the way that will make sense. Sometimes adoptions, for whatever reason, don't go well. Everything was done right. We thought it would be good, and not because the family decided they didn't want to adopt, I'll rephrase that. Not because there were problems and they ended up needing foster care services, but the family said this isn't working well, and the child ended up back in the custody of the state. I've heard reports of that. I've had other people that have heard reports of that. Have you experienced that? And if so, how have you addressed it to overcome any barriers or challenges along that way?
This is Danielle Bartelli. Sadly, we have seen that. We see primarily young children that are adopted in their baby toddler years and then coming back out when they're in pre-adolescent or teenage years. So we have seen that when they have some mental health issues, they have some questioning going on. One thing that we have changed within the last couple of years is that we used to refer those children back to our reunification team to then begin the reunification process, but we have now realized that it makes more sense to send them back to our adoption team because they're they have the expertise in the adoption process and the resources available to help just forge a relationship or re-engage that adoptive family back in the process. And so that's one thing that we have done that has seemed to help that process. It is very sad. You have anything else to add?
Something I can add to that is a preventative measure that I do when speaking with families is expressing the importance of the child's needs.
Caroline, before you get too far, would you mind repeating your name and who you're with, please?
Yes, Caroline Soper with KBC. So I like to prepare families. So say we have a family who's been recruited. A child is not in a foster home or in a home that is an adoptive resource, so we've found a family through recruitment. Now, I will prep the family while also being mindful and privy to our child's information, but I explain the mental health needs of the child and the resources, things like that. But I also continue to reiterate that the state that the child is in could never change. The child's mental health, say they had really bad anxiety, depression, that could stay consistent for the rest of their life. They could have other aggressive or defiant behaviors in the home, and those could never change. And so it's, how can we help you with getting the resources, and funding that you need? And how can we also put in therapy, things like that, and show you that this child is perfect the way that they are, and here's how we can help you for the future. I'm very transparent with my families, and I'll say with our younger kids, I worry about, in general, our older kids coming back in, because they were 5 years old and fine, and then they were 16 and showing aggressive, defiant behaviors. So I'm very much with the families of, are you open to family therapy? Are you open to these resources? Do you want to take a class? Do you want to do this? Do you understand what these mental health diagnoses mean? Do you understand what this means? Are you prepared for the lifelong commitment that is needed for our child?
Senator Baumgartner.
Thank you, Mr. Chair, and thank you for your presentation. Before you presented, we had testimony from Rachel Hillestad, who had fostered more than 73 children with her husband. They shared a situation where there was a child with them that was a KVC, through KVC, for 19 months. And then they indicate that it took long because the biological parent was living in a coastal state. So is that an ICPC situation?
Yes, it is.
Okay. So clarify for us, because during the time that the child was with them, the child was required to participate with weekly visits with the person that had sexually assaulted her, even though that individual was not biologically related. So what stopgaps do you have now so that that's not occurring? And why would a child be required to make weekly visits with someone that was not a biological relative in any manner?
So this is Danielle Bartelli with KVC. I can't speak to that specific case because I don't know which case she's referring to, and for confidentiality reasons, I couldn't speak specifically. Generally, we would initiate supervised visits with a parent. I think she indicated this was a boyfriend of the child. That wouldn't generally happen unless the boyfriend has been a part of the life. We didn't know about this sexual abuse, that may have come out later as part of the discussion. So I'm not sure what information fell on that timeline or...
She was pretty explicit, Mr. Chair. that the first night they had her, she explained to us what had occurred with the adult in the home. And there were 2 separate car accidents, also subsequent car accidents. So at what point, seriously, at what point does KVC step in and say, these visits aren't safe for a child?
Well, if she said this information at the very first night, if this information was not included in the petition, one of the things we would have asked her to do was hotline the abuse, of course, so that there could be a proper investigation. But again, we would typically offer supervised visitation for the parent involved in the case. So not knowing exactly what was going on in that specific, I can't speak to that specifically, but typically that would not have occurred if there were questions about the safety of this particular boyfriend, significant other, sometimes even stepfather, husband. You know, we would want that person to be involved in the case planning around reunification with that child if it's safe to do so. But we wouldn't necessarily say, and right now you will have visitation with this person that you've accused of sexually abusing you.
Thank you, Mr. Chair.
All righty. Thank you, everyone, for your testimony on this subject. I do not see any more questions for any of the conferees. Well, Senator Gossage.
Thank you, Mr. Chair. Less of a question and more of a comment. I just want to say for everyone here, I can't speak for everybody in this room, but I believe I'm right when I say that, of course, we appreciate foster parents who are willing to take in often troubled children and give them a home. Mother of 4, former teacher, extremely important to me. That brings me to tears when I hear these stories. And just want you to know how much we appreciate the parents that foster children, the fact that all of you with the agencies are trying to be sure that these kids are safe. You're trying to do the best you can, which is why sometimes it seems like all of the rules and regs and the little tiny things that you have to have in the homes seem ridiculous. And obviously they can be revisited, but it's because you're trying to set up a safe environment and do as much as you can for these children. And I would say everybody has the best interest of the children. But the purpose of this hearing is to say there are some things that are broken. There are definitely some things that we can fix, and we want to get to the heart of that. So if any of us are asking tough questions, it's because we're trying to drill down to what can we do, and we appreciate your recommendations, and thank you, Mr. Chair.
Are there any other questions or comments before we move on? Not seeing any. Thank you for all the conferees for your testimony. Committee, next we are going to have a overview comparing the 2021 House Bill 2345, 2021 Senate Bill 301, and the Governor's Executive Order 2128, establishing the Office of the Child Advocate. And to give that overview is with the Revisor's Office is Jesse Pringle. Jesse?
Thank you, Mr. Chairman. Good afternoon, committee. I am Jesse. I'm from the Revisor's Office, and alongside Nick, I help staff this committee. And during session, I help staff House, Children, and Seniors. So some of you sit on that committee and have seen some of these bills, and some of you have also seen these bills on the Senate side as well. Since the executive order in early October came out, there have been a few questions in regards to, well, what bill does this? Which bill was that? How are these similar? How are these different? So for the next few minutes, I'm going to go over a few differences on very salient differences between the bills, the executive order, and then I'm going to start off with a little bit of procedure so I can give a context to where these bills currently are for the committee in case you want to make any recommendations or want to introduce any further legislation. So first, House Bill 2345, as amended by House Committee, was introduced in the House, seen in House Children and Seniors. That died on calendar around turnaround, but some of those items are similar to what is in the EO, so that seemed important for the comparison. Second, we have Senate substitute for House Bill 2153. So House Bill 2153 started in the House. It was originally related to crimes related to adult and elder abuse. So the Senate originally had introduced Senate Bill 301, which was the Senate version of the Office of Child Advocate. So Senate Judiciary held a hearing on that Senate Bill 301, but did not work that bill. Instead, they put the contents of that into House Bill 2153. So for your information, that means Senate Bill 301 is still in the Judiciary Committee, whereas House Bill 2153, which was passed through emergency final action, is waiting to be read into the House at the moment. And lastly, we have the Governor's Executive Order 2128. I'm only going to compare that second one as it relates directly to these two bills. And since that's an executive order and signed, that is in effect. So some of the important things to consider between these as you look at recommendations and legislation, they all relate and reference, the child advocate. And they all talk about who they are working for a child. So the House bill defined a child that is similarly defined in the Sync Code, which is in Statute 382202. The Senate version outlined specifically and had a broader definition in regards to a child means an individual less than 18 years of age. They are in custody of the secretary. They may have previously been in the custody of the secretary, is alleged to be a child in need of care, or at one point was receiving services, treatment, or any other services from the Department of Corrections. And then Executive Order 2128 does not define any child, but subsection 8A does reference that it refers to a child in custody of the secretary or is alleged to be a child in need of care. Some other important informations and questions that came up last time was, where is this office to be held? Which department? Not the physical location, but within the government structure. So the House bill was within the legislative branch. So all of you. The Senate version was within and under the jurisdiction of the Kansas Attorney General and would have its own division. And then the governor's executive order houses that in the Department of Administration's Office of Public Advocates, which is what that first executive order was, and that is number 2127. The appointment process for the child advocate between the three was that for the House, the governor and the Chief Justice of the Supreme Court were to appoint the child advocate, and it would be confirmed by the Senate, therefore including all three branches of the government. The Senate version was appointed by the Attorney General from applicants that would be recommended by the Joint Committee on Child Welfare System Oversight and also be subject to confirmation by the Senate. And the executive order has the child advocate being appointed by the governor. Another important thing about that appointment is the House had 6 years or until a successor is appointed. The Senate version was that there's a max of 2 terms for each child advocate, as it would expire on January 15 of each numbered year. And the executive order has the child advocate serving for 5 years or until a successor is appointed. The funding for the child advocate division and office for the legislature would be through the LCC budget and approved by the LCC. For the Senate's version, it would be through the Attorney General. And finally, the executive order that would go through the governor's budget, as well as it had the power to contract with DCF to receive extra financial assistance. I've also outlined some of these, but in the essence of time, you all should have the document with you and can review. They all have reporting requirements. They may differ in who they report to and what they report to. Generally, the purpose of the office is the same: to receive and address complaints in regards to the children defined in that specific document. They all have some sort of interaction with the judicial branch, as sync cases go through the court system. But all of them also deal with records and information that is very sensitive in each of these cases. And so each of these versions of the child advocate deal in some sort of way on the confidentiality of those records. So in the House version, there was a provision that said any federal and state disclosure restrictions that were applicable to the state agency or any of the entity providing documents to the child advocate would be the same, as well as would apply to the child advocate and be the same. It also applied any confidentiality records, specifically the Child in Need of Care Code and the Juvenile Justice Code. The Senate version is additionally the same. In the executive order, subsection 12A provides that no employee of the Division of Child Advocate shall disclose confidential information without lawful authority. And that's the only reference in regards to the confidentiality of that information. And then lastly, when these two bills were in session, this committee did not currently exist. So for your information, the House bill referenced any relevant joint committee if it were to become a joint committee. And then the Senate version created in the bill a joint committee. So that would have to be amended if the Senate bill that's currently still alive were to be used. And since the time of the executive order came out, the legislature had passed and created the Joint Committee on Child Welfare. The executive order does not create a committee. Additionally, in the last item about the two bills and regarding the confidentiality is that both of those bills within the statutes in the Sync Code and the Juvenile Justice Code had specific lists on who records could be released to and the types of records, such as the official court file, any LEO law enforcement records. And so in both of those bills had taken those statutes and amended them to include the child advocate on that list. With that, I am open for any questions as long as you would like to go this evening.
Well, Jesse, thank you for that invitation for the marathon meeting tonight, but hopefully we don't take you up on that for going as long. But we shall see how this goes. So, committee, do we have questions for Jesse? First of all, thank you to you and Nick for doing the work on this. It's very helpful in breaking it down and what the differences were. Committee, do we have questions for Jesse over this? Senator Foscato.
Thank you, Mr. Chairman. Ms. Pringle, thank you. And thank you for all the resolutions you've helped me with over the years, and congratulations in your new position. So in this Senate version, did it require so that child advocate to, how many staff members would be under that child advocate center or person?
I don't.
And was there any requirement in there to have a reporting to the legislature or to the governor to measure the success of the office and the outcome for those in need of care?
Certainly. Senator, I don't remember, and I don't have the language specifically in front of me, whether or not it outlined how many were to be in that office, but it gave the power generally to the Attorney General and the Child Advocate to determine the staffing needs within their budget and ask for that within their budget. As far as the Senate version for the requirements of reporting, specifically it states that a report to the legislature would be given, and it would include recommendations for changes in statutes, a proposed annual budget, the personnel, any other topics the office deems appropriate. So that language is limited as far as recommendations for changes in statutes, and that does not include, reporting or reviewing any outcomes or successes of current policy.
Okay, do we have any further questions for Jesse? Okay, Senator Gossage.
Thank you, Mr. Chair, and thank you, Jesse. I'll make this very short. Senator Baumgardner and I serve on the Judiciary Committee, as you may know, and we were just conferring about our bill that we had put forth and that it created this committee as part of that bill. And I'd like for you to clarify why then we would need to amend it to include the committee?
Yes, Senator, the current bill includes the creation of the committee, and since the committee creates and is already a statute, then that would not need to be included in the bill anymore.
Be not amended to add the bill, the committee, but amended to take it out since it was already created.
Correct.
And can you clarify, just so I understand the nuts and bolts, in the Senate Bill 301, yes, that we put into 2153, and then that was passed, and then that was sent over to the House. And what are you saying is the status of that at this point?
Yes, so for House Bill 2153, the whole Senate chamber voted on it, and it's currently being waited to be read in to the House chamber.
House chamber.
Yes,
All right.
so it has not been read in or referred at any point.
Thank you.
Mm-hmm.
Okay, Jesse, I have some questions, so I was going to let everybody else have theirs before I jumped in. I was being kind. So the only live bills currently are the two Senate bills. One's a House bill now, but the other one is the Senate Bill 301. I'm assuming is still live, or did they get that one? So is there just House Bill 2153, or is there House Bill 2153 along with Senate Bill 301?
Both of those are still alive. 301 was not worked in committee, and so it's just sitting in committee and was not amended in any sort of way.
Okay. Last meeting, I had asked and sent a request to the revisor's office about whether or not the EO should have been an ERO. Have you guys had an opportunity to look into the specifics of that?
Sure, and I'll take the moment to tell the committee a little bit about the context of that question and how that relates to the EO. So under the Constitution, Article 1, Section 6 very explicitly grants the governor a very limited legislative power to issue EROs and to reorganize, essentially, state agencies. Creating state agencies and doing that is normally a legislative power and reserved for the legislature. So in the language for that power, it specifically states the governor may issue an ERO for the purpose of transferring, abolishing, consolidating, coordinating the whole or any part of a state agency or its functions within the executive branch. While as executive orders are historically something that just flows from the power of the governor as an executive. So there's no legislative power given there, it's already within her power. The Constitution, when they grant that legislative power to the governor, also puts a legislative check on that as well. So when EROs are given to the legislature or transmitted to the legislature from the governor, the legislature ultimately has the opportunity to disapprove of that ERO by passing a disapproving disapproving resolution. Similarly, you saw quite a few of those EROs and resolutions this past session. And so because that's a legislative power that's being granted, there's a legislative check. And an EO just is something that the governor would normally be able to do within her power, the power of the executive. Understanding this difference is very important, or these little differences are very important in regarding what is legally sound and where the authority stems from. The authority to do those items as stated in the Constitution under an ERO, that's the authority to do that. And items that exist within the executive power have the legal authority to do so from the executive power. So we're not necessarily prepared to go line by line, on what should have been an ER or an ERO or that analysis. But there are definitely items in the EO that can raise some concerns about whether or not that is a coordination or a consolidation or a transfer of state agencies that is reserved specifically for EROs.
Senator Baumgartner.
Thank you very much, Mr. Chair. I was curious if the chair or if the revisers or anyone has heard any follow-up with regard to the executive order in the context of when Senate Substitute for House Bill 2153 was passed. We were informed by DCF as well as KDADS that they would need to add several positions. DCF estimates the enactment of the bill would result in the need for 3 FTE program consultant positions to coordinate office responses, and they gave a budgetary expense on that. They also said that according to KDAD's enactment of the bill would require the agency to have a dedicated staff to research, track down, and timely respond to complaint inquiries received from the office regarding children who have crossed over from DCF to KDAD's licensed facilities. So has anyone heard from either of these agencies with the executive order that those additional positions would be needed?
Speaking since that was directed to the chair as well, I have not.
I have no information regarding that.
Thank you. Mr. Chair, I think that we need to have that information because I think, oftentimes we receive that kind of testimony, if you will, in some ways to deter action or to say, well, that's not really the cost, it's going to be this. And, what we do have from the executive order that the funding will come through the governor's office and financial assistance from DCF as well. So I'm just kind of curious, since the governor is also setting a salary, what additional positions are needed, because we were told in the spring that they would need at least 4 FTEs. So I am curious about that, Mr. Chair.
That is a very good question. And Malaysia, is that something that we can make sure, send a request to get that information? For those of you listening online, that wasn't a silent, or it wasn't a head nod, it was a vocal yes. So thank you. Going back, and I'm looking at this, your memorandum, and I really appreciate the way it's laid out, the way you've put the information in there. As a kid, we all watched Schoolhouse Rocks, or at least some of us did. I don't know. Maybe some of you guys are too young to have experienced that joy in your childhood, but I did. And one of the things, they told you how a bill becomes law and stuff like that. And then you took your government class in school and they told you how a bill became law. And then you get elected and you come up to the state legislature and none of that is true. So I'm very disappointed. That's my beef on my childhood being disrupted by schoolhouse rocks. But anyway, my point that I'm getting to after that rabbit hole is it's very apparent that when you're looking at this memorandum, that the House, the Senate, and the governor all agree on one thing. We should have an office of a child advocate. That is very important to each chamber of the legislature and to our chief executive, which is our governor. Normally, what happens up here in the legislature is when you have something that each chamber wants and the governor wants, they come together and they talk about, hey, we want this position, but here's our differences. We can see the differences. They're all laid out very nicely and precisely on this memorandum. Some of them are major differences and some would be a little bit harder to overcome, but most of them are fairly simple. And to me, what was disappointing of the executive order is that we did not go through that process. And we should have. And if it was something that was very important to each chamber, why can't we do better? And why couldn't we have gotten together and tried to get something out? I'll repeat this for as long as I can. I do not like legislating from a pen and paper. I just really don't like that because there's a couple of issues that you have. Number one is an EO, executive order, is just that. It's from the executive branch. Pen and paper. What one governor gives, the other governor can take away in a stroke of a pen. So while there appears to be some continuality of 5 years, that's not true. If Governor Kelly is not reelected, the next governor can just change that with a stroke of a pen. The correct process is to go through the process that should have went through the first time, is the legislative process. It didn't, so here we are. We have an EO that more than likely should have been an ERO that would have provided the legislative body an opportunity to put their input into it and to give their stamp of approval. This is more of I'm going to ask for forgiveness rather than permission. And I don't know about you with how you guys handle that, but I'd rather someone ask me for permission and we discuss this and work it out. The EO, to me, has a couple of issues. Transparency and accountability. Whenever we first start talking about the Office of Advocacy, Child Advocacy, that was very important. Now, we have an independent office that is accountable to someone other than the direct supervisor of that department that needs that accountability. The EO puts that accountability under the governor. So I have a question based off of that. Based off of this EO, and as I'm looking at the EO, the governor doesn't appear to even need to have issued an executive order to define an office of advocate, child advocate. What would have caused or what would have stopped the governor, because this is a very important issue, from going ahead and doing that from the beginning without defining the child advocate position. But if we're going to make a position where we're overseeing what's going on, could they have not have done that from day one and not needed an EO or EO to define that position?
Mr. Chairman, there are multiple ways that this office could come about, and there's multiple ways the governor could have also created the Office of the Child Advocate. I won't opine on all of those options, as they each would likely have some sort of hurdle or require some possible statutory changes still.
Thank you. And that's kind of what I had assumed, that my thinking was this could have been accomplished several years back if that was something that was very important, instead of taking it a position like was taken. We will be taking up, and I'll leave because I said a lot, and I know that I might have stirred some questions from some committee members, and I don't want to have the last comment without giving you guys an opportunity to make a comment or ask a question. But we will be making recommendations tomorrow at the end, and hopefully, committee, we will look at this memorandum and look at it and come up with a way, constructive way of moving forward to where a child advocate's position is not done with a stroke of a pen, but it goes through the proper process of a legislative process, and that we work on that and get that going. So hopefully you guys will put some thought into that tonight and tomorrow, and then we'll have some good recommendations. So Senator Foscato.
Thank you, Mr. Chairman. Jesse, just for the record, for those listening in online, just briefly share again the difference between EO and ERO. And can you say the full name for those who don't know all the acronyms? Thank you.
Definitely, Senator. Hello, everyone that's listening online. I'm Jesse Pringle. I'm from the Revisor's Office. For a little context, again, an executive order is the type of document that was penned by the governor, and the authority for that flows from the broad general power that the governor is the executive. While in Article 2, Section 1, which is the legislative article of the Kansas Constitution, it gives some of the legislative power to the governor, and that it must be done through an executive reorganization order. So that's where they're similar. The second one just has 3 letters, so that's an ERO, colloquially called. And so that is when the legislative power of, creating agencies, directing the government that is reserved for the legislature is given to the governor in a very limited scope. And some of the language from that specific section states that it's for the purpose of transferring, abolishing, consolidating, or coordinating the whole or any part of any state agency or the functions thereof. And notably, in regards to it being a granted legislative power, further, that section then has a legislative check on the executive reorganization, and it gives the legislature the opportunity to hear and review those executive reorganization orders and either let it happen or to pass a resolution disapproving it. That is only required to be done by one chamber, but there is a time limit on it.
Representative Humphreys.
Thank you, Mr. Chairman. Thank you, Jesse. So just so I know tomorrow when we're making these recommendations, I want to make sure I understood what y'all talked about. You said you weren't prepared to make a decision or proclamation if you felt like this was an EO or an ERO? Did I hear that correctly? You weren't prepared to say that there could have been parts?
Sure. And
Okay.
Mr. Chairman, if I may.
And so, so my question is there someone that could make that decision, or are we past that? Can that be challenged? Do we need to ask the court for a decision, the Attorney General I mean, how do we go about figuring out, was this done properly as an executive order instead of an ERO?
Thank you, Representative, and that will be something that we can take up as a recommendation. So we have, the way I understand it, we have some options. We can say, yeah, we can do nothing and let the EO stand. We can request a AG's opinion on whether or not it should have been an ERO instead of an EO. Or we can request a AG file and make a decision to the courts on whether or not it's an ERO or an EO. So those are all questions that hopefully, and I'm glad we're doing this now so everybody has a chance to go home and sleep on it and think about it. So and come up with some good ideas. And one of the charges I want to give the committee is, too many times, no matter what we do, it's political. So, you know, you can say, don't be political about it. Well, you can't. That's what we do. We're up here. It's a political process. But what I would ask of each committee member is to give it some serious thought. And what is the most productive result? What is the most productive path to get this to where it is right? And that's what I'd like for the committee. That's my ask for the committee. And Jesse, I don't see any other questions or comments. None. So thank you very much. Everybody, just a couple of points before we adjourn. I have a couple notes. You have a draft minutes on your desk. Please be sure to look at that because we will try to approve them tomorrow. There is one correction on there, and Malaysia is going to correct that. No, two. So, okay. So it'll be Senator Reichman instead of Senator Erickson. Well, not. Yeah. So, but anyway, we'll have a corrected version, and it's just the one on staff being present. So, other than that, everything is good. And then if you have a voucher and you have not turned it in, make sure you do that because you might want that. So, with nothing else to come before the committee, we are adjourned. Thank you, everybody, and we'll see you tomorrow morning.